As long as she doesn't act like Tiffany.
Committee will come to order. The chair recognizes herself for an opening statement. Thank you to all of my colleagues who are leading on solutions. We're doing the hard work necessary to review and reauthorize programs and deliver results to the American people. That is our job as the people's representatives, to improve the lives of those we serve. We're making sure moms and babies get the support that they need at all phases of their lives. We're supporting research for sickle cell disease and childhood cancer. We're reauthorizing important programs to help people find hope and recover from substance use disorders. We're building on our work to stop fentanyl poisonings. We're making sure hospitals can train pediatricians. And we're also bringing accountability to the CDC. In addition, we are reauthorizing key authorities to help protect Americans from chemical, radiological, biological, nuclear, and cyber attacks. I've made clear my top priority is for these programs to be reauthorized on time. We're moving Mr. Hudson's legislation today to make sure America is equipped to respond to public health threats. Regarding drug shortages, as I said last week, we're working on legislation following our request for information to address the underlying causes. Just yesterday, we sent a letter to the FDA asking about their lack of foreign inspection of manufacturing sites in China and India, two countries with a long history of safety compliance failures. The Senate Help Committee released new provisions on shortages as well that seem to take a more tailored approach to more FDA authorities, and I look forward to hearing stakeholder feedback. Examining the FDA is only one part of addressing shortages, and our committee has the privilege of being able to look at federal reimbursement policies as well. And I hope Democrats will work with us on a comprehensive approach to address the root causes of drug shortages, including looking at FDA authorities and how Medicare and Medicaid pay for medicines. Let's work together. I think about how we came together for the Support Act, for example, and it's proof of what we can accomplish when we do work together. Today's Support Act reauthorization includes a key number of bipartisan wins, including agreements on lifting the IMD exclusion, helping people in our criminal justice system, and caring for foster youth in need. I'm proud of our work on this, and I'm looking forward to advancing it today. With that, thank you to all the members and their staff for the hard work leading up to today's markup. I look forward to the discussion and our work to advance these solutions to the full House for consideration. Thank you. I now recognize the gentleman from New Jersey, Mr. Pallone, for 5 minutes for an opening statement.
Thank you, Madam Chair. We're here nearly a week after the Health Subcommittee's markup of these bills, and unfortunately, the Republican majority has failed to make any progress on moving forward with a consensus reauthorization of the Pandemic and All Hazards Preparedness Act. This is not only disappointing, but also, in my opinion, an abdication of our important responsibility to reauthorize this law to prepare for and respond to public health emergencies and threats. This is the first time in the history of this law that it's being brought to the full committee for a vote in a partisan fashion. And I believe that's dangerous, considering we have just witnessed firsthand with COVID-19 how important pandemic response is. It should not be partisan, and we should be working together to protect the health and well-being of the American people. For months, Democrats have offered a common-sense proposals to ensure we're prepared for the next emergency. We've been more than willing to work with the majority to find a path forward to ensure that we reauthorize these important programs on time before the September 30th deadline. We also offered amendments during the subcommittee markup that dramatically improved this partisan bill, but every amendment was rejected by the Republican majority. At each turn, we've been met with opposition. And now the Senate Help Committee is expected to mark up a bipartisan PAPA agreement later this week that includes many of the provisions that committee Democrats here have been pushing for months to address the drug shortage crisis. That means that House Republicans are the only ones standing in the way of Congress acting to provide relief to patients impacted by these drug shortages. Fortunately, there is a comprehensive alternative that we should all support today, Every committee Democrat has introduced a serious and robust PAPA reauthorization bill that applies the lessons learned from the COVID-19 pandemic and ensures we will be better prepared for future public health emergencies, including the ongoing drug shortage crisis. And I want to thank Representative Schreier and Health Subcommittee Ranking Member Eshoo for their leadership on this legislation. It represents the action that this committee should be taking today and provides better hope for the future. While Republicans refuse to work with us on this preparedness bill in a bipartisan fashion, I'm pleased that we were able to work together on the Support for the Patients and Communities Reauthorization Act. Tragically, the opioid epidemic continues to impact every community across the country. The package before us today will reauthorize critical programs included in the Support Act 5 years ago, as well as some new provisions to expand prevention, treatment, and response efforts to the opioid epidemic. Since the subcommittee markup last week, I'm pleased we were able to reach a bipartisan agreement to include several important Medicaid policies in the Support Act reauthorization. An amendment we'll be taking up later includes policies that will help connect justice-involved individuals with Medicaid while they await trial. It will also help ensure people who are incarcerated are connected to Medicaid upon their release. For those incarcerated individuals struggling with opioid use disorder, the time of their release can be particularly dangerous. This legislation is going to help them get the treatment and support that they need. We were also able to work with the majority to address many of my concerns with the two IMD provisions before us. The bill before us strikes a good balance. It will expand access to coverage, connect beneficiaries to treatment, and ensure that people are trained in the setting that is right for them, which for the vast majority of people will be a community-based setting. And we found a path forward on xylazine, and I'm committed to continuing to work with our agency partners, both FDA and DEA, to work through any implementation issues. Finally, it's disappointing that Republicans continue to take a partisan approach to another program that has traditionally garnered overwhelming bipartisan support. The Republicans are using the Children's Hospital Graduate Medical Education Program to attack medical care for transgender youth. Committee Republicans are inserting themselves into this very private decision that should be left to doctors, patients, and their parents. And they're also disrupting the training of pediatricians at a time when we are suffering pediatric shortage. Today, committee Republicans are openly rejecting the opportunity to pass a reauthorization of the CHGME program on a bipartisan basis and instead include extreme and dangerous language, in my opinion, to restrict care for transgender youth. I believe these actions are targeting transgender youth who are just trying to find their way. I think it's discriminatory and beneath this committee. And with that, Madam Chair, I will yield back.
Gentleman yields back. Chair reminds members that pursuant to committee rules, all members' opening statements will be made part of the record. Are there further opening statements? I recognize Mr. Hudson for 3 minutes for an opening statement.
Thank you, Madam Chair. Today is an important day, continuing the work the American people expect us to do with the fourth generation of PAPA moving through the final steps of regular order in this full committee markup. I'm again disappointed that we will be without my colleague, Representative Anna Eshoo, who's championed this bill for years and knows the importance of emergency preparedness and seeing this through. I want to reiterate what a world without a plan for chemical, biological, radiological, and nuclear threats looks like. Without PAPA and the prior work of Representative Eshoo, Burr, Rogers, Brooks, and many others, we would have had no Operation Warp Speed, no public-private partnerships to produce countermeasures, produce or acquire PPE, rush tests, or create therapeutics. When a hurricane strikes my state in North Carolina and public health providers like health departments and hospitals need assistance, ASPR is there. Let me reiterate that without a PAPA reauthorization this year, we will not have a chance to build on our public-private partnership successes. We will not have a chance to build our stockpile with unique and necessary needs for our constituents. We will not have the chance to improve transparency and oversight for our federal agencies. And we will not have fulfilled our obligation to the American people that we are ready for the next threat. I cannot say this enough. This bill is essential. Sadly, we're seeing partisanship from Mr. Pallone and the Democrats, despite our commitment to addressing the drug shortages and our openness to negotiate any ideas that the other side has and willingness to try to include them in this bill. Democrats have let this issue derail the partisanship we've seen year after year for PAPA reauthorizations. Like PAPA, we'd all like to see a bipartisan bill to address drug shortages. We'd like to give the issue of drug shortages the attention it deserves. We'd like to give future pandemics and all hazards the attention they deserve as well. Future threats will happen with or without legislation to prepare for and to address them. I again am asking my colleagues to return to the table to address PAPA and drug shortages. I'm hopeful we can do both this year, especially if the Democrats would be willing to work with us. And with that, I yield back.
Gentleman yields back. Further opening statements. Lady from California, Ms. Eshu, is recognized for 3 minutes.
Thank you, Madam Chairwoman, and good morning, colleagues. Today, we're marking up 15 bills. 7 of them are bipartisan policies that continue successful programs, including my PREEMIE Act, which aims to reduce premature births. We're also voting on a bipartisan reauthorization of the Support Act to continue addressing the deadly scourge of the opioid epidemic by increasing access to prevention, treatment, and recovery for patients with substance use disorder. Urgent action is needed because we lose about 300 American lives every day from a drug overdose. I'm still disappointed that we haven't reached a bipartisan agreement on the PAPA reauthorization. The current product is a disjointed package of underfunded health programs that do not meet our nation's needs and will leave us unprepared for the next public health emergency. Most striking is that the bill does nothing to address the health emergency our nation is currently facing, the shortage of critical cancer drugs. It doesn't need to be this way. The Senate Help Committee demonstrated yesterday that bipartisan compromise that includes both Democratic and Republican priorities is possible. Lastly, we're also voting today on legislation that will damage the Children's Hospital's graduate medical education program irreparably by banning care for transgender children. For nearly 25 years, a quarter of a century, the CHGME program has trained half of the general pediatricians and a majority of pediatric specialists in our country. It's difficult for me to comprehend why my Republican colleagues are bringing up a cruel bill that will hurt children, hurt families, and exacerbate the ongoing shortage of pediatricians in rural and underserved areas, so many of them represented by my Republican colleagues. Today's markup has, there's an old saying, the good, the bad, and the ugly, with the anti-transgender bill, in my view, being the ugliest and the cruelest. I hope my colleagues will come to their senses and move a clean bill to reauthorize the CHGME as soon as possible. I thank the chair, and I yield back the balance of my time.
Lady yields back. Further discussion, further opening statements. Okay. Chair calls up HR 824 as amended by the Subcommittee on Health and asks the clerk to report.
Committee print of HR 824, a bill to amend Title 27 of the Public Health Service Act, the Employee Retirement Income and Security Act.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? For what purpose does the gentleman from Michigan seek recognition?
Thank you, Madam Chair. I have an amendment at the desk.
The clerk will report.
Amendment to HR 824, offered by Mr. Wahlberg. Strike all after enacting clause and insert the following. Section 1,
Amendment will
short
be
title.
considered as read without objection. Gentleman's recognized, Mr. Wahlberg, for 5 minutes on his amendment.
Thank you, Madam Chair. This amendment is simple. It would allow employers to offer telehealth benefits to their employees that don't currently have any benefits. largely part-time and seasonal workers. During the COVID-19 pandemic, the Trump administration allowed employers this flexibility to increase access to care for workers who might not have any other options. This amendment would make this flexibility permanent and ensure that employers can provide telehealth benefits for their part-time and seasonal employees that may not have access to employer-sponsored care. We heard concerns from our Democratic colleagues during the legislative hearing last month, and we moved to address those concerns. Importantly, this amendment includes important protections for patients, including protections for individuals with pre-existing conditions, ensuring that telehealth benefits are compliant with mental health parity requirements, and requiring employers to provide a one-page notice. That's unique. One-page anything is unique. But a one-page notice to their employees that receive these telehealth-only benefits that simply states that these plans are not major medical insurance and that these workers may still be eligible for major medical benefits through the exchange. This amendment is about increasing access to care. By definition, it will only help those who do not currently have benefits through their employer. This amendment includes all the consumer protections of the pandemic policy and goes above and beyond by adding additional notice requirements to patients about what these policies cover and, more importantly, what they do not. Telehealth offers an affordable and flexible option for health care that Americans embraced during the pandemic. Suddenly, people in rural areas didn't need to drive an hour to speak to their doctor, making everyone's lives easier and healthier. Allowing employers to offer this as a standalone benefit to those that currently do not have any benefits will undoubtedly increase access to care. I urge my colleagues to vote in favor of the amendment and the underlying legislation, and I yield back.
Gentleman yields back for the discussion. Gentleman, Mr. Sarbanes is recognized for 5 minutes on the amendment.
Thanks, Madam Chair. So I appreciate the gentleman trying to make the bill a little bit better with this amendment in the nature of a substitute, but it still doesn't achieve the level of protection that we need to have for consumers. So I oppose the Ains. I also continue to oppose the underlying bill. We believe that all individuals deserve access to quality, comprehensive health coverage for the services they need, whether delivered in person at a healthcare facility or whether delivered through telehealth. And so we want to make sure that if telehealth is the option that's offered, whether it's some kind of standalone telehealth policy or it's part of a more comprehensive policy, that it has all the protections you would want to see to make sure that that patient and that consumer is fully benefiting from it and isn't going to be taken by surprise by certain deficits in the coverage that's being offered. So while it would provide telehealth coverage to certain employees who are not offered a comprehensive employer-based health care plan, even with the changes made in the subcommittee last week, the coverage this bill provides wouldn't be subject to all of the Affordable Care Act's consumer protections, which are really important and were hard-fought benefits that we designed to make sure consumers were protected, and we think that workers deserve better. Many of these individuals could get better plans that offer more comprehensive coverage, including telehealth services. We love telehealth services. Let's make sure that the coverage of them is as comprehensive as it can be. And thanks to the ACA's tax credits, many workers could get these stronger plans at an affordable price. Those were the two things we were seeking: comprehensive plans at an affordable price. So I must ask, why is the committee working to advance legislation to expand less comprehensive forms of coverage rather than taking a hard look at policies that could actually incentivize more employers to offer stronger, more comprehensive coverage to their employees? If there's a gap out there in the universe in terms of coverage of services and plans and all the rest of it, let's fill the gap with good plans, not junk plans, not weak plans, but plans that have all the protections in place. Then what you'll have is a whole universe of coverage available to people, including coverage of telehealth services that have all of the benefits and consumer protections in place. That's what we should be focusing our attention on. Building on the ACA's success of increasing the quality and affordability of healthcare coverage and expanding its reach to millions of Americans. And we can and we should look at ways to continue to strengthen access to telehealth in the process. So I urge my colleagues to consider how we can make meaningful gains in ensuring every individual, no matter their job or their employer, has access to affordable, accessible, and comprehensive care. That should be our goal here. And I urge my colleagues to oppose the AINS as well as the underlying bill, H.R. 824, and I yield back.
Gentleman yields back. Further discussion on the amendment? Gentleman from Georgia, Mr. Allen, is recognized for 5 minutes on the amendment.
Madam Chair, I move to strike the last word.
Gentleman is recognized for 5 minutes.
During the COVID-19 pandemic, the previous administration enacted flexibilities that allowed for more widespread telehealth use. As the pandemic revealed how critical telehealth is to ensuring Americans can receive timely and affordable care from their home. The telehealth flexibilities help to make benefits more affordable for people who would otherwise have none, like part-time and seasonal workers. The Telehealth Benefit Expansion for Workers Act is a bipartisan bill, which I was proud to reintroduce with my colleague Tim Walberg this Congress. This legislation would empower job creators who do not currently offer major medical insurance for their employees to provide standalone telehealth benefits as accepted benefits. It would make standalone telehealth available to part-time and seasonal workers who would otherwise not have access to employer-sponsored care. While there may be some misconceptions about this legislation, let me be clear. This amendment includes protections for pre-existing conditions, requires employees to give their employees clear notice that this coverage does not include major medical benefits, and ensures that individuals currently covered by major medical insurance plans cannot have their plans dropped in favor of telehealth-only plans. I encourage my colleagues to vote in favor of this common sense amendment to help close coverage gaps and give businesses greater flexibility to provide robust benefits to their workforce. And with that, I yield.
Would gentleman yield? Would gentleman yield? Gentleman yield?
Yes, the gentleman will yield.
I want to be really brief. I know we got a long day, but the Affordable Care Act did not require employers to provide coverage for this group of people. These are people that are not required to have coverage from their employer. So I don't know the debate in that, but for some reason, these employees were exempted. I wasn't on this committee when it was debated, exempted from the Affordable Care Act. And therefore, if they didn't get an employee mandate, they go into the marketplace or into the pools and move forward. This changes none of that. None of that. Exactly what you all voted for is still in place. But these people are still left out. And what we're saying is let's give them an additional benefit on top of what they have from the Affordable Care Act. So this takes nothing away. It only offers something to them. And I don't want to sit here and be talked to like we're trying to take something away from society, giving them something less. That was in the Affordable Care Act that did that. What we're trying to do is give them an additional benefit to what they're already entitled to and make sure they're aware of that. If we don't have this one page in place, they don't get it now. So when they go to their employer and they don't get coverage, the employer doesn't say you can go to the marketplace. Good ones will tell them, but there's not a requirement. This actually adds an additional benefit and protection to them. So I'll yield back to my friend from Georgia.
The gentleman yields from Georgia.
Gentleman yields back. Further discussion on the amendment? Lady from California, Ms. Eshu, is recognized for 5 minutes to strike the last word.
Thank you, Madam Chairwoman. I want to thank Mr. Wahlberg for his improvements to the bill, because they are improvements. But I still oppose it, and let me say why. It lacks a very, very important element in insurance, and that is out-of-pocket costs. There are many things that are contained in insurance policies, a lot in the fine print, but there isn't anything that I think means more to people than having protections on their out-of-pocket costs. And to me, this is really major. And I think perhaps that's why the blue chip patients organizations like the Lung, Heart, and Cancer Associations still oppose the bill despite the improvements. So again, I thank Mr. Wahlberg. You've been willing to improve it. I wish I had, it contained this element of one of the most important, I think, consumer protections out-of-pocket costs. So regrettably, that's not included in this. And I think whether someone works part-time or full-time, wherever they live in the country, whatever their job is, whomever their employer is, they care about out-of-pocket costs. And I think that that is a protection, again, that should be attached to anything relating to health insurance, or any insurance for that matter. With that, I yield back. Thank you, Madam Chairwoman.
Gentlelady yields back. Further discussion on the amendment? Perfect. Okay, so no further discussion. The vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All opposed, nay? No. The ayes have it. The amendment is agreed to. Are there further amendments? Seeing none, the question occurs now on approving H.R. 824 as amended. A roll call has been requested. The clerk will call the vote.
Mr. Burgess. Mr. Burgess votes aye. Mr. Latta. Aye. Mr. Latta votes aye. Mr. Guthrie. Aye. Mr. Guthrie votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bilirakis. Aye. Mr. Bilirakis votes aye. Mr. Johnson. Aye. Mr. Johnson votes aye. Mr. Bouchon. Aye. Mr. Bouchon votes aye. Mr. Hudson.
Aye.
Mr. Hudson votes aye. Mr. Wahlberg. Aye. Mr. Wahlberg votes aye. Mr. Carter. Mr. Duncan. Mr. Duncan votes aye. Mr. Palmer. Mr. Palmer votes aye. Mr. Dunn. Mr. Dunn votes aye. Mr. Curtis. Ms. Lesko. Ms. Lesko votes aye. Mr. Pence. Mr. Pence votes aye. Mr. Crenshaw. Mr. Crenshaw votes aye. Mr. Joyce. Mr. Joyce votes aye. Mr. Armstrong. Mr. Armstrong votes aye. Mr. Weber. Mr. Weber votes aye. Mr. Allen. Mr. Allen votes aye. Mr. Balderson. Mr. Balderson votes aye. Mr. Fulcher. Mr. Fulcher votes aye. Mr. Pfluger. Mr. Pfluger votes aye. Ms. Harshbarger. Ms. Harshbarger votes aye. Ms. Miller-Meeks. Ms. Miller-Meeks votes aye. Ms. Kamick. Ms. Kamick votes aye. Mr. Obernolte. Mr. Obernolte votes aye. Mr. Pallone.
No.
Mr. Pallone votes no. Ms. Eshu. Ms. Eshu votes no. Ms. DeGette. Ms. DeGette votes no. Ms. Schakowsky. Ms. Matsui. Ms. Matsui votes no. Ms. Castor. Mr. Castor votes no. Mr. Sarbanes. No. Mr. Sarbanes votes no. Mr. Tonko.
No.
Mr. Tonko votes no. Ms. Clark. Ms. Clark votes no. Mr. Cardenas. Mr. Cardenas votes no. Mr. Ruiz. Mr. Ruiz votes no. Mr. Peters. Ms. Dingell. Ms. Dingell votes no. Mr. Veazey. Mr. Veazey votes no. Ms. Custer. Ms. Custer votes no. Ms. Kelly. Ms. Kelly votes no. Ms. Barragan. Ms. Barragan votes no. Ms. Blunt-Rochester. Ms. Blunt-Rochester votes no. Mr. Soto. Mr. Soto votes no. Ms. Craig. Ms. Craig votes aye. Ms. Schreier? Ms. Schreier votes no. Mr. Hand? Mr. Hand votes no. Ms. Fletcher? Ms. Fletcher votes no. Chair Rogers?
Aye.
Chair Rogers votes aye. Mr. Carter, you are not recorded. Mr. Carter votes aye.
Clerk, oh, are there any members seeking to be recorded? Clerk will report.
Chair Rogers, on that vote, there were 29 ayes and 20 noes.
The ayes have it and the bill is adopted. We will now recess and resume 15 minutes after the conclusion of the joint meeting. The committee will stand at recess.
We must be muted.
Okay. The committee will come to order. Welcome back, everyone. I think we all got a little inspiration there. Together, we can bring hope, make the world better, and heal a fractured world. There we go. We get to go to work on that now. We will resume business and call up HR 3226. Clerk will report.
Committee print of HR 3226, a bill to reauthorize the prematurity research expansion in education for mothers who deliver.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? Okay. Lady from California, Ms. Eshu, for what purpose do you seek recognition?
To strike the last word, Madam Chairwoman.
Gentlelady's recognized for 5 minutes.
Bill, speaking of hope, every baby deserves a healthy start, and I'm proud to sponsor this PREEMIE Act with Representatives Miller Meeks, Kelly, Burgess, and Blunt Rochester to help us toward that goal. Every day, 1 in 10 infants are born premature in our country, putting them and their mothers at an increased risk of complicated health problems. America's prematurity rate is one of the highest in the world, and it's the leading cause of newborn death. Even babies born just a few weeks too soon can face serious health challenges. In 2005, I introduced the original PREEMIE Act with, as I said during the subcommittee markup, with former Chairman Fred Upton, which was the first and remains the only law to focus solely on the prevention of preterm births. Since it was first passed, the PREEMIE Act has helped researchers and doctors identify the causes of premature births and work to prevent them. This year's reauthorization will improve future policy by studying what could have led to the recent surge in preterm births and how we can address it. We saw a significant 4% increase in preterm births in 2021, the highest recorded rate since 2007. The PREEMIE Act will help prevent newborn death and disability, expand research into the causes of preterm birth, and promote the development, availability, and uses of evidence-based standards of care for pregnant women. For all these reasons and more, Madam Chairwoman, I urge the full committee to vote for this bill. I think it's worthy of every member's support. And with that, I yield back.
Gentlelady yields back. Chair recognizes the gentlelady from Iowa, Ms. Miller Meeks, for 5 minutes in support of her bill.
Thank you, Chairman Rogers. I'd like to speak in favor of H.R. 3226, the bipartisan bicameral PREEMIE Act. I am proud to lead this legislation with Ranking Member Eshu as well as Representative Burgess, Kiggins, Blunt, Rochester, and Kelly. As a mother, physician, and the former director of the Iowa Department of Public Health, I understand the harmful health implications of preterm births and recognize the importance of public health programs like PREEMIE, which seek to address the root causes. In 2021, Iowa mothers gave birth to almost 3,700 preterm babies, which represented 10% of all the births in the state that year. Preterm births pose great health risks to the mothers and to her baby and are also very costly to the healthcare system. Over 28% of infant deaths are preterm related, and the average cost associated with preterm births in Iowa is $58,000. This legislation will provide crucial funding to address this issue and reduce this public health epidemic. I encourage my colleagues to support the legislation and yield back the balance of my time.
Gentlelady yields back. Is there any further discussion? Seeing none. The question now occurs on approving H.R. 3226 as amended, and a roll call has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Guthrie. Latta votes aye. Guthrie. Griffith. Bilirakis. Johnson. Johnson votes aye. Bouchon. Hudson. Wahlberg. Hudson votes aye. Wahlberg. Carter. Duncan. Duncan votes aye. Palmer. Dunn. Wahlberg votes aye. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kemick. Kemick votes aye. Obernolte. Pallone. Aye. Pallone votes aye. Eshu. Eshu votes aye. DeGette. DeGette votes aye. Schakowsky. Matsui. Matsui votes aye. Castor.
Okay.
Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Blunt Rochester. Soto. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye. Ms.
Mr.
Barragan
Clerk.
is not recorded. Barragan
Clerk.
votes aye.
Would you call the names that are not recorded? I think
Yes, ma'am. Guthrie is not recorded.
Aye.
Guthrie votes aye.
Griffith votes aye.
Griffith votes aye. Bilirakis is not recorded. Bilirakis votes aye. Bouchon is not recorded. Bouchon votes aye. Carter is not recorded. Carter votes aye. Palmer is not recorded. Palmer votes aye. Balderson is not recorded. Balderson votes aye. Yes, sir. Wahlberg is recorded as aye. Schakowsky is not recorded. Cardenas is not recorded. Schakowsky votes aye. And Mr. Obernolte is not recorded. Mr. Obernolte votes aye. Mr. Cardenas is not recorded. Mr. Veazey is not recorded. Ms. Blunt Rochester is not recorded. Mr. Soto is not recorded.
The clerk will report.
Chair Rogers, on that vote, there are 48 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 3838 as amended by the Subcommittee on Health and asks the clerk to report.
Committee print of H.R. 3838, a bill to amend Title III of the Public Health Service Act to reauthorize federal support of states in their work to save and sustain the health of mothers during pregnancy.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill? Gentleman from Texas, for what purpose do you seek recognition?
Speak on the bill.
Gentleman's
last word.
recognized for 5 minutes to strike the last word.
Well, I won't take all of the 5 minutes. We talked about this significantly during the subcommittee markup. This is an important bill. Maternal mortality continues to be a problem that vexes people in this country. This continues the work of Jamie Herrera Butler from 2018. The bill was signed into law by President Trump. It's now necessary to reauthorize it. It is being reauthorized to levels previously appropriated, so there is no significant change there. I urge all members to support this bill, and I'll yield back.
Gentleman yields back. Further discussion? Ms. Kelly's recognized for 5 minutes to strike the last word.
I'm elated to see this bipartisan bill being brought forward to address the maternal health crisis. One of the most glaring inequities in our country is the disparities in maternal health outcomes. Frustratingly, the number of women dying of maternal causes continues to rise. Over 1,000 women died in 2021 due to maternal complications compared to 861 in 2020 and 754 in 2019. What's even worse is that the color of your skin determines whether or not you are more likely to become a maternal mortality statistic. Black women are nearly 3 times more likely to die from pregnancy-related causes as non-Hispanic white women. Indigenous women are more than twice as likely to die from pregnancy-related causes as non-Hispanic white women. This is unacceptable. We are all aware of the problem, but I'm glad that we are here to discuss a promising solution for addressing the maternal health mortality crisis. The Preventing Maternal Deaths Act that I co-led with Reps. Burgess, Comack, Carter, Castor, and DeGette would strengthen and expand federal support for maternal mortality review committees. State-fashioned MMRCs are tasked with identifying maternal deaths, analyzing the factors that contributed to those deaths, and translating the lessons into policy changes. I would like to thank my colleague, Rep. Burgess, for including a piece of my mama's bill in the Preventing Maternal Death Act. I challenge all of my colleagues here today to continue to think about how we can work together to end this maternal health crisis and advance health equity. I know we can do this. The lives of our moms and babies rely on our ability to take action. I strongly encourage my colleagues to support this bill. Thank you.
Will the gentlelady yield?
Yes, I will.
I thank the gentlelady. The United States has one of the worst rates of maternal deaths anywhere in the developed world, which is why in 2018, I was proud to lead the passage of the Preventing Deaths Act of 2018. This bipartisan bill increased federal investments to help states better understand the factors that led to these deaths and work with a wide group of public health stakeholders to develop policy solutions. The funding of this bill the funding that the bill secured was vital to help states create maternal mortality review committees, or MMRCs, which are invaluable to get the data that we need and not only understand the causes of maternal deaths, but also identify and address racial disparities in maternal deaths. And because of that bill, we now have MRCs in every state that are working to reduce the high rate of maternal mortality. In September 2022, CDC published the first data from maternal mortality review committees, where we learned that 84% of pregnancy-related deaths are preventable, and over 50% of pregnancy-related deaths occur during the window from 7 days after delivery to 1 year postpartum. We also learned that there are differences in the leading underlying cause of pregnancy-related deaths by race, ethnicity. For example, because of this program, we know that cardiac and coronary conditions were the leading cause of pregnancy-related deaths among Black people. Mental health conditions were the leading underlying cause for Hispanic and white people, and hemorrhage was the underlying cause for Asian people. These findings, these precise findings, are so critical if we're going to actually make targeted interventions to save lives. And this bill today, Madam Chair, would provide critical resources to protect women throughout their pregnancy, childbirth, and postpartum period by promoting and disseminating best practices that MMRCs have identified. And it will help to continue to provide recommendations to improve healthcare quality and outcomes for mothers. We're facing a maternal health crisis in this country, and it's imperative that we work in a targeted and unified way to take steps to address it. I urge everyone to support this bill, and I'm happy to yield back to my colleague from Illinois.
I yield back.
Lady yields back. Is there further discussion on the bill? Gentleman from Illinois, for what, Indiana, what purpose do you seek
I
recognition?
move to strike the last word.
Gentleman's recognized for 5 minutes.
And I'll be brief. I'm in support of this. Indiana has one of the highest maternal mortality rates in the nation. And I think one of the more critical pieces of this legislation is, from a medical standpoint, is the dissemination of best practices. We heard testimony in this committee in the past from Parkland Hospital in Dr. Burgess's home state. They primarily serve underprivileged, uninsured, and minority patients, and they have some of the best data in the country as it relates to this issue. So this can be done. Best practices need to be followed. And if we can do that and get adoption of these type of practices across the country, I think will make a substantial dent in really an appalling rate of maternal mortality in this country. So I'm in support of this legislation, and I yield back unless somebody wants my time. Yeah, I yield.
I want to thank my colleagues for, or I'll just move to strike the last word.
Oh.
Gentleman yields back. Ms. Gentlelady from Florida, Ms. Castor, is recognized for 5 minutes to strike the last word. Well, thank you, Madam Chair and colleagues. The Preventing Maternal Deaths Reauthorization Act is critical legislation to address the abysmal maternal mortality rates in America, and I'm very proud to be a co-lead with my colleagues because we must do more to ensure that women have access to the care that they need before, during, and after pregnancy. Unfortunately, pregnancy can be a traumatic, life-threatening experience in the United States, especially for Black women who often experience worse outcomes due to disparities in access to health care services that they need. In fact, the maternal mortality rate for Black women is up to 2.5 times that of white women. So this legislation will help us recommit to the health of families by ensuring that moms can have safe pregnancies and outcomes are improved for patients at highest risk of maternal mortality and morbidity. In the Tampa Bay area, I'd like to thank the local community organizations like Avera Health, Reach Up, the Healthy Start Coalition of Hillsborough County and Pinellas County, the University of South Florida, and all of the maternal health specialists who are working so hard to ensure that moms and babies across my community get the care they need. They have all worked tirelessly to improve the quality of care, which is really a hands-on, person-by-person, family-by-family initiative. And this bill will help them. It will help local organizations across America by building upon the comprehensive framework of the Preventing Maternal Death Act, supporting the maternal mortality review committees, and strengthening life-saving initiatives that improve health outcomes. Finally, I'd like to thank my partners on the committee, Representatives Burgess and Kelly, Carter, DeGette, and Kamek, for co-leading this legislation with me. Together, we can work to improve the health of pregnant women and postpartum women in America. So I urge a yes vote on this important legislation and yield back my time. Gentlelady yields back. Is there further discussion on the bill? Seeing none. Question now occurs on approving H.R. 3838 as amended, and a roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Johnson. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. Pallone.
Aye.
Pallone votes aye. Eshu. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers. Chair Rogers votes aye.
Clerk, how is,
Mr. Johnson is not recorded. Johnson votes aye. Bilirakis is not recorded. Bilirakis votes aye. Eshu is not recorded. Eshu votes aye.
Clerk, how is Mr. Dunn recorded?
Chair Rogers, Mr. Dunn is not recorded. Dunn votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 50 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 3843 and asks the clerk to report.
H.R. 3843, a bill to amend Title III of the Public Health Service Act to reauthorize grants to address dental workforce needs. Be it
Without
enacted by the
objection, the
Senate.
first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill? For what purpose does Ms. Kelly seek recognition? You're recognized for 5 minutes.
Thank you, Chair Guthrie and Ranking Member Eshu for holding, wrong people holding. Thank you, Chair McMorris Rogers and Ranking Member Pallone for holding today's markup and including H.R. 3843, the Action for Dental Health, and I'm proud to co-lead with Rep. Mike Simpson. Oral health is a critical part of our overall health, and preventative dental care can reduce costs for families and help so many people live better lives. Oral disease is a common risk factor with chronic diseases such as cardiovascular diseases, cancers, diabetes, and respiratory diseases. Oral health affects our ability to eat, speak, smile, and show emotions. Oral health also affects a person's self-esteem, school performance, and attendance at work or school. Additionally, oral health is an important part of perinatal health. Reducing bacteria in a woman's mouth during pregnancy can significantly reduce her risk of developing oral diseases and spreading decay, causing bacteria to her baby. Moreover, some evidence suggests that women with periodontal disease during pregnancy could be at a greater risk for poor birth outcomes, such as preeclampsia, preterm birth, and low birth weight. Regular preventive dental care is essential for good oral health, so one can find problems earlier when they are easier to treat. Unfortunately, many don't get the care they need. More people are unable to afford dental care than any other type of health care. Children, low-income Americans, minorities, and the elderly are especially at risk for having limited dental care and poorer oral health outcomes. We must address the barriers to oral health care services. The more we can address early diagnosis, intervention, and preventative dental treatments, the better off our patients and our healthcare system will be. I was honored that this bill passed the Health Subcommittee with unanimous support, and I encourage my colleagues here to support this bill. Thank you, and I yield back.
Gentlelady yields back. Further discussion? Seeing none, the vote occurs on approving H.R. 3843, and a roll call has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Duncan. Duncan votes aye. Mr. Palmer. Palmer votes aye. Dunn. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. Pallone.
Aye.
Pallone votes aye. Ashu. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Sarbanes.
Aye.
Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blount Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye.
Clerk?
Mr. Joyce, you are not recorded. Mr. Joyce votes aye. Mr. Johnson, you are not recorded. Mr. Johnson votes aye. Mr. Carter, you are not recorded. Mr. Carter votes aye.
Clerk, how is Miller Meeks recorded?
Ms. Miller Meeks is not recorded.
Clerk, how is Dr.
Miller
Dunn
Meeks votes
recorded?
aye.
Yeah, how's Dr. Dunn recorded?
Dunn is not recorded. Dunn votes aye.
How is Ms. Eshu recorded?
Ms. Eshu is not recorded. Ms. Eshu votes aye.
How is Ms. Castor recorded?
Ms. Castor is not recorded. Ms. Castor votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 50 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 3884 as amended by the Subcommittee on Health and asks the clerk to report.
Committee print of H.R. 3884, a bill to amend Title 11 of the Public Health Service Act to reauthorize the program providing for sickle cell disease and other heritable blood
Without
disorders.
objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill? For what purpose does Dr. Burgess seek recognition?
I seek recognition to speak on the underlying bill.
You're recognized for 5 minutes.
Thank you, Madam Chair. We talked about this extensively in the subcommittee markup. This is a bill that has been introduced by Danny Davis for several years. It's important that we reauthorize it. The Sickle Cell Disease and Other Heritable Blood Disorders Research, Surveillance, Prevention, and Treatment Act. I sought recognition because I have 2 letters that I would like to introduce for the record. The first letter is from 4 organizations: the National Alliance for Sickle Cell Centers, Sickle Cell Disease Association, Sick Cells, and the American Society of Hematology. The second letter is from the Sickle Cell Disease Partnership Organization, asking unanimous consent that these be made part of the record.
Without objection, so ordered.
And I urge passage of the bill, and I'll yield back.
Gentleman yields back. Further discussion on the bill? Seeing none. Question occurs on approving H.R. 3884 as amended, and a roll call vote has been requested. Clerk will call the roll.
Burgess?
Burgess votes aye.
Burgess votes aye. Latta? Aye. Latta votes aye. Guthrie? Aye. Guthrie votes aye. Griffith? Griffith votes aye. Bilirakis? Aye. Bilirakis votes aye. Johnson? Bouchon? Bouchon votes aye. Mr. Johnson votes aye. Hudson? Hudson votes aye. Wahlberg? Wahlberg votes aye. Carter? Duncan? Duncan votes aye. Palmer? Palmer votes aye. Dunn? Dunn votes aye. Curtis? Curtis votes aye. Lesko? Lesko votes aye. Pence? Pence votes aye. Crenshaw? Crenshaw votes aye. Joyce? Joyce votes aye. Armstrong? Armstrong votes aye. Weber? Weber votes aye. Allen? Allen votes aye. Balderson? Balderson votes aye. Fulcher? Fulcher votes aye. Pfluger? Harshbarger? Harshbarger votes aye. Miller Meeks? Miller Meeks votes aye. Kamick? Kamick votes aye. Obernolte? Obernolte votes aye. Pallone?
Aye.
Pallone votes aye. Eshu? DeGette? DeGette votes aye. Schakowsky? Schakowsky votes aye. Matsui? Matsui votes aye. Castor? Castor votes aye. Sarbanes?
Aye.
Sarbanes votes aye. Tonko?
Aye.
Tonko votes aye. Clark? Clark votes aye. Cardenas? Cardenas votes aye. Ruiz? Ruiz votes aye. Peters? Peters votes aye. Dingell? Dingell votes aye. Veazey? Veazey votes aye. Custer? Custer votes aye. Kelly? Kelly votes aye. Barragan? Barragan votes aye. Blunt Rochester? Soto? Soto votes aye. Craig? Craig votes aye. Schreier? Schreier votes aye. Trahan? Trahan votes aye. Fletcher? Fletcher votes aye. Chair Rogers?
Aye.
Chair Rogers votes aye. Mr. Carter, you were not recorded. Carter votes aye.
Clerk, how is Ms. Eshu recorded?
Ms. Eshu is not recorded. Ms. Eshu votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 50 ayes and 0 noes.
The ayes have it, and the bill is adopted. The chair calls up H.R. 3821 and asks the clerk to report.
H.R. 3821, a bill to reauthorize the Firefighter Cancer Registry Act of 2018.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill? For what purpose does Ms. Kamick seek recognition?
Thank you, Madam Chairman. I move to strike the last word.
You're recognized for 5 minutes.
Thank you. I am very proud to support H.R. 3821, the Firefighter Cancer Registry Reauthorization Act, not just as a member of Congress, but also as the wife of a first responder. My husband, Matt, a 16-year career firefighter for the city of Gainesville, actually just completed his annual life scan last week. And these life scans are incredibly critical to all of our first responders in identifying potential or current health issues. But unfortunately, around the country, many departments are just now adopting life scans, and others are simply unable to provide this critical screening. As we know, cancer is the leading cause of death for our firefighters, and in fact, our firefighters experience an enormous increased cancer risk, more so than the general population. For example, firefighters are 200% more likely to receive a mesothelioma diagnosis, or 116% more likely to be diagnosed with throat cancer, a 202% increase in testicular cancer, 132% increase in brain cancer, 151% increase in non-Hodgkin's lymphoma. The various data points go on and on. It is clear that our first responders need more resources when it comes to identifying the trends that we are seeing within health issues on the first responder community. But as we work to increase resources, testing and treatment for our frontline first responders, things like improved particulate blocking hoods, training and treatment for PTSD, second sets of bunker gear, better extraction methods for gear in removing harmful carcinogens, and other key steps, supporting this reauthorization of the National Firefighter Cancer Registry is critically important. Without reliable, up-to-date, and accurate data, we will not be able to meet the needs of our first responders as they battle both fires and cancer. I urge all of my colleagues to support this reauthorization, and I yield back.
Gentlelady yields back. Chair recognizes, or for what purpose does Mrs. Dingell seek recognition?
Madam Chair, I move to strike the last word.
You're recognized for 5 minutes.
Thank you, Madam Chair. I want to begin by thanking Representative Pascrell for leading the Firefighter Cancer Registry reauthorization and how proud all of us have been to work with him in a very bipartisan manner. My colleague on the other side articulated the issues so well. We all care deeply about our nation's frontline emergency responders. They're the backbone of communities across America and put their own well-being on the line to keep us safe. Due to the nature of the job, firefighters are often exposed to a range of toxic substances and chemicals. I remain alarmed about their exposure to PFAS forever chemicals in particular, and it's something that we're working on separately, and you all will see in the future. But unfortunately, we know this exposure makes these men and women more susceptible to developing serious illnesses, including cancer. That's why the National Firefighter Registry is so important. It's one of the largest efforts taken to understand cancer among American firefighters. This registry has been a critical resource in monitoring and tracking the risk of cancer, which provides valuable guidance that can pave the way for new protocols that keep the next generation of firefighters safe. I urge my colleagues to support this important legislation to ensure the registry can continue its important mission. I remain committed to working with everyone here to do more to protect our firefighters from contaminants and other occupational hazards. Their safety on the job is non-negotiable. Thank you, Madam Chair, and I yield back.
Gentlelady yields back. Further discussion? Gentleman from Florida, Mr. Soto, for what purpose do you seek recognition?
I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Madam Chair. Our firefighters are our local heroes, charging into burning buildings, helping out during major disasters, major accidents, as well as we had an amazing reminder during the pandemic of the hard work that they do. I've heard too many stories of cancer throughout our fire department and our force across this state, whether it was the cancer cluster that we experienced at our local fire college in Florida, dirty equipment that would lead to folks getting skin cancer and other cancers, toxic fumes. We've celebrated too many retirements only to see a firefighter pass shortly thereafter. In the state Senate, I was proud to work on key issues to make sure cancer presumptions were in law so that it was presumed to be on the job if you got cancer as a firefighter. We also had one of the first registries in the country and boosted research. Information is critical to research, and research is critical to prevention, treatment, and cures. That's why renewing the voluntary firefighter cancer registry is so important. It authorizes more than double the funds that we had historically allocated before, and this will go a long way to saving lives. Our heroes deserve nothing less. And I yield back.
Gentleman yields back. Further discussion? Seeing none, the vote occurs on approving H.R. 3821. And a roll call vote has been requested. The clerk will call the roll.
Burgess. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamek. Kamek votes aye. Obernolte. Obernolte votes aye. Pallone. Pallone votes aye. Eshu. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes.
Aye.
Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers. Chair Rogers votes aye.
How is Dr. Burgess recorded?
Dr. Burgess is not recorded. Burgess
Howe.
votes aye.
Clerk Howe.
Mr. Johnson is not recorded. Johnson votes aye.
Clerk Howe, is Ms. Eshu recorded?
Ms. Eshu is not recorded. Ms. Eshu votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 51 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 3391 as amended by the Subcommittee on Health and asks the clerk to report.
Committee print on H.R. 3391, a bill to extend the Gabriella Miller Kids First Pediatric Research
Without
Program.
objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? For what purpose does Mr. Bilirakis?
Strike the last word.
You're recognized for 5 minutes.
Thank you. I appreciate it very much. I'll keep my comments very brief. I want to express my strong support for this bipartisan legislation that we put forward and that I'm proud to help lead through this committee. And I know there's several original co-sponsors on this. This bill will continue the work being done to conduct biochemical or biomedical research and discover new insights into pediatric conditions, such as childhood cancers. We all agree that these scientific discoveries could help unlock the key to developing future treatments and cures for our most vulnerable patients, our kids who suffer from pediatric cancers and rare diseases. We must continue to fight the battle against kids' cancers, both inside and outside the federal government. So, Madam Chairwoman, I just got an email from a constituent, a grandmother, and I want to read part of the email here. My 2-year-old granddaughter, and this is very timely, my 2-year-old granddaughter has been diagnosed with LCH, and I conferred with Dr. Burgess, and it is a rare disease, probably a form of cancer. That's the way it looks. It's so rare that there are no programs for help, resources for my daughter. They are using an intravenous chemo to see if it does anything. This poor baby is happy, according to her grandmother. Her mom is absolutely the best mom and spends every working moment making sure that the baby is comfortable. Please, please help. Please help. And I've already talked to Dr. Burgess about this, and I'll contact my constituent. I know you have a lot of constituents in this position, all of us. That's why we need this good bill passed, but we'll help her. Apparently, there may be some clinical trials available, according to Dr. Burgess. It's great to have physicians on the committee, isn't it? In any case, let's pass this bill, get it on the floor, get it to the Senate, and we'll reauthorize the Gabriella Miller Kids Research Act 2.0. And with that,
Would the
I'll
gentleman
yield.
yield?
Yes, please.
Well, this is an important and a good bill, and but I just want to add a reflection here. Our colleague just read the email from the woman whose grandchild has this rare disease, cancer, type of cancer. That's why it works so hard from this side, that in the bill that legislation that must move would include something for pediatric cancer drugs. That's what this child needs. So this bill passes, but we don't do anything about that, then you know what, friends and colleagues? There's no help for that family and other families like them across the country. So thank you, Mr. Bilirakis, for your hard work, but we need to complete the loop on this. Thank you.
I don't know if there's anyone who wants my time. Doctor, do you want my time? All right. Yes? No? Okay, I'll yell back. Thank you, Mr. Chairman. Thank you.
The chair recognizes the gentlelady from Michigan. What purpose, gentlelady from Michigan, seek recognition?
I move to strike the last word, Mr. Chairman.
Gentlelady is recognized.
Thank you, Mr. Chairman, and I too will be brief. I was proud to join Representatives Wexton, Bilirakis, and Cole in introducing the Gabriella Miller Kids First Research Act 2.0, which will reauthorize the Gabriella Miller Kids First Pediatric Research Program at NIH through fiscal year 28. No child should have to endure a cancer diagnosis. We just heard from my colleague about another family. It's a terrible disease that causes unmanageable hardships for young patients and their families. But unfortunately, cancer remains the #1 disease-related killer of children, and many pediatric cancers are terminal upon diagnosis. Diffuse intrinsic patina glioma, or DIPG, is one example that's almost always fatal. It accounts for nearly 80% of all pediatric brainstem tumors, and the overall survival for children diagnosed is less than 1 year. It is critical we invest in research to better understand the biology of pediatric cancer, since many are fundamentally different than cancers found in adults. Many unanswered questions remain that are impeding the development of new treatment and cures. This bill is named after Gabriella Miller, a brave childhood cancer advocate who lost her battle with DIPG when she was 10 years old. We owe it to her memory and to the memory of all other children who've lost their own battles with pediatric cancer. I went through it with the Carr family as I watched Chad Carr and his siblings and his family and try to support them, and then they've become champions. We have to authorize this program without delay. With this legislation, we can drive life-saving research forward that puts us one step closer to finding new treatments and cures that will save children's lives. I urge all of my colleagues to support this important legislation. Thank you, Mr. Chairman, and I yield back.
The gentlelady yields back. Anyone else seeking recognition on the bill? Seeing none, seeing no further people seeking recognition. More page. The question now occurs on approving HR 3391 as a, 3391, and a roll call vote has been requested, and the clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson.
Aye.
Johnson votes aye. Bouchon.
Aye.
Bouchon votes aye. Hudson.
Aye.
Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Duncan. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Dunn votes aye. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamek. Obernolte. Obernolte votes aye. Pallone. Pallone votes aye. Eshu. Eshu votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers. Chair Rogers votes aye.
Recorded.
Mr. Carter is not recorded. Mr. Carter votes aye.
Is there anyone else on the Republican side? How's Ms. Kamick recorded?
Ms. Kamick is not recorded. Ms. Kamick votes aye.
Anyone on the Democrat side? Minority side? None? Seeing none, is anybody present that hasn't answered the roll?
Ms. Blunt Rochester is not recorded. Ms. Blunt Rochester votes aye.
The clerk will report.
Chair Guthrie, on that vote, there were 50 ayes and 0 noes.
With 50 ayes and 0 nays, the bill is adopted. The chair calls up H.R. 3836 as amended by the Subcommittee on Health and asks the clerk to report.
Committee print of H.R. 3836, a bill to facilitate direct primary care arrangements under Medicaid, be it enacted by the Senate.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek recognition on the bill? For our purposes, Mr. Crenshaw, seek recognition?
Mr. Chairman, I move to strike the last word.
Gentleman is recognized.
Thank you, Mr. Chair, and I want to express my gratitude to Chairwoman Rogers and Chairman Guthrie and Congresswoman Schreier for partnering with me on this crucial bill. This bill might seem small, but it actually packs a lot of punch when it comes to addressing the access issues that our state Medicaid programs are facing. It cuts through the red tape, it empowers our states with the necessary guidance to innovate, and it's a model that I'm a huge fan of, which is direct primary care. It offers patients an excellent entry into healthcare. They get a limited access to their primary care provider in exchange for a recurring monthly payment. I think it's a win-win for both patients and doctors. This is important because in Medicaid, we're witnessing rising emergency room costs, and the truth is most primary care doctors simply can't serve patients in Medicaid due to the low reimbursement rates. So really happy that we're pushing this through. This legislation is straightforward. It basically clarifies that current laws don't prohibit direct primary care arrangements within the Medicaid program, and also offers guidance for states that want to incorporate direct primary care models into their unique Medicaid programs. So I'm glad we're pushing this through in a bipartisan manner. I think it transcends party lines, and thank you all for that, and I yield back.
Gentleman yields back. Anyone seeking recognition? Our purpose is Dr. Schreier seek recognition.
I'd like to strike last word and speak
Your
on.
gentlelady's recognized.
I would just like to echo some of my colleague, Mr. Crenshaw's comments about this bill. This was a great bipartisan effort. We both agree that what we want is better outcomes, lower costs, and a pursuit of health instead of fee-for-service in this particular case. It has a proven track record, direct primary care in my state with better patient outcomes and lower costs, specifically in Medicaid. And so this clarification that we can use this sort of system to provide care, have unlimited access to a primary care physician, and limit the need for specialists and emergency room visits. So I want to thank you for your partnership, Mr. Crenshaw, and I yield back.
Gentlelady yields back. Are there any other people seeking recognition on the bill? Are there any bipartisan amendments to the bill? Seeing none, are there any amendments to the bill? Seeing none, the question now occurs on approving H.R. 3836 as amended in the subcommittee, and a roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Bouchon.
Aye.
Bouchon votes aye. Hudson.
Aye.
Hudson votes aye. Wahlberg.
Aye.
Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Dunn votes aye. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Armstrong. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Obernolte. Obernolte votes aye. Pallone. Pallone votes aye. Eshu. Eshu votes aye. Deget. Deget votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Blunt Rochester votes aye. Soto. Soto votes aye. Craig. Schreier. Schreier votes aye. Trahan. Fletcher.
Aye.
Fletcher votes aye. Chair Rogers. Chair Rogers votes aye.
Are there any members seeking recognition to vote on the bill? Has Mr. Johnson recorded?
Mr. Johnson is not recorded. Mr. Johnson
Curtis?
votes aye.
Okay. Mr. Curtis?
Mr. Curtis is not recorded. Mr. Curtis
Dr.
votes
Joyce? I'll come
aye. Mr.
back.
Joyce is not recorded.
Ms. Kamick?
Mr. Joyce votes aye.
Ms. Kamick?
Ms. Kamick votes aye.
Ms. Craig?
Craig votes aye.
Ms. Craig votes aye.
Ms. Trahan?
Ms. Trahan votes aye.
Is anyone present in the room that has not been recorded? Seeing none, the clerk will call the roll.
Chair Guthrie, on that vote, there were 51 ayes and 0 noes.
With 51 yeas and 0 nays, the ayes have it, and the bill is adopted. The chair calls up H.R. 4531 and asks the clerk to report.
H.R. 4531, a bill to reauthorize certain programs that provide for opioid use, disorder prevention, recovery and treatment, and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek to be recognized on the bill? What purpose is the general, what purpose did Dr. Burgess seek recognition?
Move to strike last word to speak on the bill.
Gentleman is recognized.
So, Mr. Chairman, I wanted to thank members of the committee and the Energy and Commerce Committee staff for their support and commitment to getting the bill to lift the Institute for Mental Disease, or IMD exclusion, to get that included in this reauthorization of H.R. 4531, with support for Patients and Communities Reauthorization Act. Lifting the outdated IMD exclusion has been a priority of mine to ensure that proper mental health and substance use care is given to all patients regardless of their income or status. It is no longer the 1960s, and there is no longer the same stigma against the treatment of mental health. We must focus on bolstering our healthcare workforce and supporting providers to ensure that mental health and substance use patients have access to personalized care and personalized medicine. Every American deserves access to the best standard of care that we can give them, and I believe that lifting the IMD exclusion gets us one step closer. One last thing to note, to reach an agreement, we had to strike a provision that permits states to stack authorities to extend days in an IMD. The Center for Medicare and Medicaid Services made clear that states can stack authorities or run them concurrently. It's cited on page 6 to 7 of their report, and I would like to submit the CMS report for the record. So
Without objection, so ordered.
I urge all members to support this provision and support the underlying bill. And when it comes to a vote on the House floor, and I yield back.
The gentleman yields back. Anyone seeking purpose for recognition? Ms. Schakowsky, what purpose do you seek recognition?
I move to strike the last word.
Gentlelady is recognized.
So I support this legislation, and I'm particularly happy that it includes a bill that I was proud to co-lead along with Representative Buddy Carter and myself. What this bill does is require that state state Medicare programs would monitor the use of anti-psychotropic drugs in long-term care facilities. This is really important because we know that since the end of the pandemic, we have seen an increase in the use of psychedelics, psychophobic drugs in nursing homes. And the Human Rights Watch found that on every week that nursing facilities administer anti-psychotropic drugs. Am I saying that right? Yes. Psychotropic drugs to over 175,000 patients in long-term care facilities. And what was also found about the use of these drugs was by the FDA, that found that the use of these drugs has killed 15,000 nursing home patients every single year. These drugs are often used just to calm people down and make it easier to handle them. And they also found that the FDA found that these are often unnecessary uses of that drug. So I am very happy to join Congressman Carter in making sure that this is in the bill that we are considering right now, and the kind of scrutiny will protect our seniors. They deserve better. And with that, I yield back.
The gentlelady yields back. What purpose is the gentleman from Ohio, you seek recognition? Mr. Carter, what purpose does Mr. Carter seek recognition?
Mr. Chairman, I move to strike last word.
Gentleman's recognized.
Mr. Chairman, the Support for Patients and Communities Reauthorization Act is critical legislation that reauthorizes and amends several programs that will help in the prevention and treatment of substance use disorders, including bolstering prescription drug monitoring programs and requiring a study on the use of remote monitoring for patients who are prescribed opioids. The safe prescribing of controlled substances and understanding the root causes of substance use disorders are key to effective prevention. That's why Representative Trahan and I led the Medication Access and Training Expansion Act in the last Congress, which requires any practitioner with a DEA registration to complete at least 8 hours of training. 8 hours of training on substance use disorders and the appropriate treatment of pain. The Medication Access and Training Expansion Act was signed into law at the end of last year, and the administration has now begun enforcing education requirements before providers can apply for or renew their DEA registrations. However, it has come to our attention that SAMHSA is not recognizing the training of several major provider groups as being compliant with the new law, including the training of pharmacists, dentists, family physicians, optometrists, and podiatrists. These trainings are pertinent to the patient population served by these providers. Representative Trahan and I recently sent a letter to the agency clarifying congressional intent and making clear that these trainings should be considered compliant with the MAID Act. We are currently awaiting response. I ask that the chair and ranking member commit to working together with us so that all prescribers can receive credit for completing the most appropriate training needed for them to address the opioid crisis. I appreciate the willingness to work with me on this important issue, and I yield back the remainder of my time.
The gentleman yields back. For what purpose is the gentlelady from California seek recognition?
Strike the last word.
Gentlelady is recognized.
I want to thank my colleagues who worked so hard on this bill, especially Representative Guthrie and Representative Custer. I'm grateful that this bipartisan package includes legislation that I worked on with Representative Guthrie. Our bill makes a minor fix to the Controlled Substances Act that will have a major impact for the small populations of patients who are affected. Our language ensures patients whose medications must be administered under supervision are able to access their life-saving treatments. This update will expand access and save lives. However, I also want to speak about another issue which I think is conspicuously absent from this bill. Electronic health records are no longer novel technology. They become a must-have for patients and providers in our modern healthcare system. However, only 6% of mental health facilities and 29% of substance use treatment centers use an EHR, compared to more than 90% of hospitals. Despite widespread recognition of the value of health IT, behavioral health providers have been left behind. They were ineligible for HITECH Act funding intended to incentivize IT uptake, resulting in this significant gap. That is why I'm excited to be working with Representative Bill Johnson on legislation to remedy this problem. Our bill will provide long overdue funding that will ensure mental health providers can invest in the technology needed to support integrated whole person care. This bipartisan policy is supported by experts at MACPAC and the Bipartisan Policy Center. It's common sense. We cannot talk about integrating behavioral and physical health care without ensuring providers have the tools for connectivity. While I'm glad to see the Support Act reauthorization move forward today, I hope this committee will continue to work on the important issue of behavioral health IT. I'd like to yield the remainder of my time to the gentleman from Ohio, Mr. Johnson.
I thank the gentlelady for yielding, and I am very, very pleased and proud to work with my good friend and colleague, Representative Matsui, on this very, very important issue. The fact of the matter is, rates of electronic health record adoption among mental health and substance use disorder treatment providers lag significantly behind adoption rates for medical and surgical health care providers. The Office of National Coordinator for Health Information Technology reported in 2019, as my colleague just mentioned, that psychiatric hospitals are using electronic health records at a rate of much lower, 46%, compared to 96% in general medical and surgical practices. That's quite a disparity. When you live and represent a rural district like mine, this type of technology can make a huge difference in patient outcomes. I thank the gentlelady from California for working with me on this issue, and I look forward to continuing to move the ball forward on it. With that, I yield back.
I yield back.
The gentlelady yields back. What purpose does the gentleman from Florida seek recognition?
Strike the last word.
Gentleman's recognized.
Thank you, Mr. Chairman. I want to speak in support of the aims and the overall bill, if that's okay.
Your gentleman's recognized.
Okay, good, good. I want to share my support for the aims offered by Mr. Guthrie in support of the Patients and Community Reauthorization Act. The aims reflects hard work done on both sides of the aisle to continue strengthening critical opioid prevention and substance abuse treatment policies. This includes language I have worked on in a bipartisan manner with my colleague, Representative Blunt Rochester, and also Representative Crenshaw, Representative Trahan, to better enable CDC and other public health entities to conduct wastewater surveillance to detect and identify trends for synthetic opioid use such as fentanyl. We have the capability to do this effectively, and I'm hopeful the CDC will quickly take up the mission to identify the spikes in abuse occurring in our local communities and best provide resources to help. The aims also includes a compromise deal struck between both sides on my bill, H.R. 4056, the Ensuring Medicaid Continuity for Children's and Foster Care Act. The language would ensure that Medicaid covers services for foster youth who are staying in qualified residential treatment programs, which are currently incorrectly being interpreted as institutions for mental disease, IMDs, and that's not the case. But IMDs, it prohibits Medicaid access for these beneficiaries, the way it's interpreted. It's simply unacceptable that these kids are unable to access a service they need while staying in these treatment programs, which were specifically created in the Family First Prevention Services Act in 2018, with many safeguards to keep accountability and safety regulated under child welfare law. And while I'm grateful to the chair and the ranking member for including a fix to ensure foster children receive Medicaid coverage and care outside of the program, and that's what it does, care outside of the program, I would be remiss if I didn't express my strong disappointment that more could not be done to help ensure these foster kids get mental health care that's already required to be provided within the QRTPs under Family First. I want to thank my colleague, my co-sponsor, and a great friend and a neighbor from Tampa, Florida, Kathy Castor, for her strong bipartisan collaboration on this policy. She's been a true partner to work with on this particular issue, and I'm grateful for the joint support on our bill and on this compromise language. While this compromise language is not the leap forward that I had hoped for or envisioned that was outlined in my original bill to fully remove the IMD exclusion barriers for these foster children, I'm grateful that at least this is a first step in the right direction. I want to reiterate that this is not the end of our fight to help our states and countless provide foster youth with the mental health and support services they need. So with that, I've got some more here, but with that, Mr. Chairman, if anybody wants my time, otherwise I'll yield back the balance.
Gentleman yields back. Anyone seeking recognition? The lady from Florida, what purpose do you seek recognition?
Strike the last word.
Gentlelady is recognized.
Well, thank you, Chair Guthrie. The landmark Support for Patients and Communities Act brought hope to families as an important first step towards tackling the nation's opioid epidemic. When it was enacted 5 years ago, I said that to truly turn the tide of the deadliest drug overdose epidemic in our history, we would need a sustained, long-term, and substantial investment. And I believe today's package will continue to advance that goal, expanding resources for evidence-based treatment and other wraparound services to support families and communities that need it. And I want to thank you, Chair Guthrie, and my good friend, Rep. Custer, for leading the charge here. And in regard to the amendment in the nature of a substitute that is forthcoming, this package now will include an important policy that will help keep foster youth in my district and across the country, will allow them access to Medicaid services that they need and deserve. For years, I've worked with my good friend and colleague, Representative Gus Bilirakis, to address a problem that has kept the most at-risk children from being able to access appropriate health services. And Rep. Bilirakis really jumped in on this go-round, as did many of the members of the committee. Thank you all for weighing in. I know you have the best interest of children in foster care at heart, but Gus, thank you especially for your leadership on this. When Congress passed the Families First Prevention Services Act of 2018, the goal was to prioritize prevention and stabilize families so that foster care was not necessary. We really were aiming to successfully keep more children with their families. The law clearly recognized that some children would still need targeted, time-limited residential treatment that could not be provided in a community setting. Qualified Residential Treatment Programs, or QRTPs, were created as a new child welfare setting to deliver trauma-informed and family-focused care to address emotional and behavioral issues. The law included safeguards against inappropriate placements, and it included requirements for wraparound supports to ensure that children can ultimately be successfully reunited or placed in a family-based setting after their time-limited stay. Unfortunately, long-standing Medicaid law has prevented this law from fully realizing its potential. It has led to incomplete, delayed, or in some states, no implementation of this critical component of the Family First law. This has left many foster youth without access to QRTPs, which were intentionally designed 5 years ago to be an integral part of the continuum of care. For example, in Florida, the third most populous state, only has 5 QRTPs, a result of the organizations being unable to to comply with the IMD exclusion. Pediatricians and other providers have recognized that states are sending youth far from home or out of state due to inadequate QRTP capacity. Many states are covering the entire cost of medical, dental, and mental health care for children residing in QRTPs. But Congress created these foster care settings to be subject to federal welfare requirements and mandated that they provide clinical, mental, and behavioral health services that unfortunately child welfare dollars will not pay for. So for years, Rep. Bilirakis and I have been working to make it easier for states to comply with both the child welfare and the Medicaid laws. Most importantly, to keep the kids front and center so that they have access to health care and the services they need both inside and outside of facilities. So the legislation before us today is a compromise. It's an important step forward. It will help bridge the existing gap in children's health care services. I want to thank Ranking Member Pallone and Chair Rogers for working with us on a policy to help expand access to care for these foster youth and allowing more Medicaid dollars to flow towards these children's care. However, I do believe, like Rep. Bilirakis, that this is a first step, and I hope we'll be able to continue to work together to ensure that the goals of the Family First Law can be fully realized and that children across the country, the most vulnerable kids, can access Medicaid funding for their health inside and outside of QRTP. So thank you, colleagues. Look forward to voting for the Ains, and I yield back.
Gentlelady yields back. What purpose does the gentleman from Pennsylvania seek recognition?
Mr. Chairman, I move to strike the last word.
Gentleman's recognized.
Thank you, Mr. Chairman. I wish to add my support for the important legislation before the full committee today. The Support for Patients and Communities Act is comprehensive and bipartisan legislation that reauthorizes key provisions of the Support Act and builds on its success. Included in this package is H.R. 4097, the Mental Health Improvement Act, which I co-introduced with Representative Sykes, which reauthorizes Section 756F of the Public Health Service Act, which provides important grant funding for our behavioral health workforce. Investments like these in workforce are crucial as communities, especially rural communities across the country, work to tackle the scourge of addiction and the devastation that it leaves in its wake. This bill is a product of a comprehensive legislative process, which included a field hearing in Gettysburg, Pennsylvania, where we heard powerful and important testimony from my constituents. And I would again like to thank Mike Straley, Chief Bill Saravola, and Dr. Mitch Crawford for their input and sharing their firsthand experience with the opioid and addiction crisis that we are facing throughout our nation. I would also like to add my support for the inclusion of Dr. Burgess' legislation to address the IMD exclusion, which limits access to care for Medicaid patients and was addressed at the field hearing by Dr. Mitch Crawford. I am pleased to see progress being made on this front. I urge support of this bill. Thank you, Mr. Chair, and I yield back.
The gentleman yields back. The chair, next, I think you're next. The chair, what purpose does the gentleman from New York seek recognition?
Mr. Chair, I move to strike the last word.
Gentleman is recognized.
Thank you. As we consider the Support Act reauthorization, let me share that clearly there are some good policies we're moving forward. I'm glad that we are reauthorizing several programs that have been successful. I'm pleased that we are including my Extending Access to Addiction Treatment Act that I was proud to work on with my friend Representative Armstrong. As we may know, medication-assisted treatment for addiction significantly reduces the risk of overdose deaths. However, despite the effectiveness, approximately 87% of individuals with opioid use disorder who may benefit from life-saving medication-assisted treatment simply do not receive it. My Extending Access to Addiction Treatment Act makes permanent the requirement that Medicaid provide coverage for addiction medication for Americans who need it. I also think we're taking a step in the right direction by requiring states to suspend rather than terminate coverage of Medicaid for justice-involved individuals, making it easier to restart those benefits upon release. We also include a provision to allow pregnant incarcerated individuals who are being detained pre-trial to maintain their Medicaid coverage. With that said, I say to all my colleagues here today, let's not kid ourselves. We are not meeting the moment. This package falls far short of taking the necessary steps to address the deep need of this crisis. We all know the scale of the devastating disease of addiction. Frankly, I am very disappointed that there is not the will to think big enough to address this crisis. We need a crisis response. We know that our justice system is a revolving door for those struggling with addiction and mental health issues. Over 1/2 of people in state prisons and 2/3 of individuals in jails have substance use disorder. The need for uninterrupted and comprehensive coverage for individuals prior to release from incarceration has never been more critical, and the inability of Medicaid to cover otherwise eligible individuals has unintentionally stood in the way, creating burdens for law enforcement and obstacles for individuals who need care. I'm beyond disappointed that we could not come together today to move forward the Reentry Act and the Due Process Continuity of Care Act. Individuals reentering society after incarceration are some 129 times more likely to die of a drug overdose in the first 2 weeks after release versus the general population. By allowing inmates to receive addiction treatment and other services before returning home, my Reentry Act would bring targeted treatment to those at the highest risk of overdose. The Due Process Continuity of Care Act would make certain that pretrial detainees are not kicked off Medicaid prior to ever being found guilty of a crime. We know these are the individuals at highest risk of overdose and suicide, and yet we refuse to take meaningful action to save lives. It's unacceptable that the Support Act, aimed at saving lives and uplifting those in the throes of addiction, is overlooking those most at risk with the exclusion of reentry and due process. I'm told that some people believe that justice-involved individuals are not worthy of treatment or saving. These are our loved ones. These are our friends. These are our neighbors, our mothers, our fathers, our sons, our daughters, our brothers, our sisters. These are our families. And I know that some people will talk about the cost of these bills. And I've been told that for some, this isn't a priority worth paying for. Shame on us. When nearly 110,000 of our loved ones dying from overdoses last year, how do we fall short of moving forward one of the most effective ways we can save lives? What are their lives worth? To those bemoaning the expense of this bill, I ask, how expensive is it for families to bury another one of their loved ones? How expensive is it to get caught in a cycle of addiction and incarceration without any light at the end of the tunnel? Personally, I measure success in lives saved and families kept whole. By that measurement, this is money well spent. We know the human cost of inaction. To be precise, last year we lost 109,680 lives. For each of those individuals, there's a whole universe of friends, of family, and of communities impacted. Is that a cost we're willing to bear? Before I conclude, I want to thank Representative Turner, Representative Trone, Representative Rutherford, and the many bipartisan co-sponsors and supporters of reentry and due process. I thank the law enforcement, correctional leaders, faith leaders, medical experts, mental health and addiction leaders, and other vocal advocates who recognize the need for pre-release addiction services and coordination of care. I also want to thank the many members on both sides of the aisle who co-sponsored the legislation and championed it. The vast coalition and the wide bipartisan support on both of these bills gives me hope that there will be a day, and I hope that day is not too far away, where we can work together to get these life-saving policies signed into law. Communities are being ripped apart by poison seemingly beyond our control. And with that in mind, our work is not done, and I hope we can find the will to truly meet the moment. With that, I thank you, Mr. Chair, and yield back.
The gentleman yields back. Anybody seeking recognition? Gentleman, one person from Ohio seeking recognition.
Thank you, Mr. Chairman. Appreciate that. Thank you to
Gentleman's
Chair Rod.
recognized.
Sorry about that. I moved to strike the last word, Mr. Chairman. My apologies. Thank you, Chair Rogers and Chair Guthrie, for holding this important markup today and for leading the reauthorization of the Support Act and for including my bill, the Remote Opioid Monitoring Act, as part of this package. Unfortunately, my state of Ohio has been especially hit by opioid use disorder and fentanyl poisonings. In Ohio, drug overdoses involving fentanyl are the leading cause of preventable death among citizens aged 15 to 64. Last year, fentanyl deaths were up 55% from 2020, and over 40% of illicit opioids now contain a lethal dose of fentanyl. Many times, opioid use disorder begins after a patient has chronic pain or undergoes surgery and is properly prescribed an opioid for short-term pain. We now have technologies that allow doctors to track how a patient is sticking to their prescribed dose and how a patient is responding to the medicine after being discharged. Opioids are unpredictable. Even the prescribed dose can be dangerous. Patients taking opioids will be safer by the remote monitoring, providing respiratory depression warnings in time to administer Narcan and prevent overdose. However, many of these technologies have yet to be covered by CMS. That is why I joined Representative Kelly in introducing the Remote Opioid Monitoring Act, and I am pleased that the text of this bill is included in the Support Act reauthorization today. The act requires GAO to study the current use of remote monitoring for individuals who are prescribed opioids, potential cost savings from the expanded remote monitoring, and recommendations to improve availability, access, and coverage for remote monitoring in the future. I look forward to continuing working with my colleagues on this issue and urge support of this bill. I yield back, Mr. Chairman.
The gentleman yields back. The chair now recognizes Mr. Peters from California. What purpose do you seek recognition?
Mr. Chairman, I move to strike the last word.
Gentleman is recognized.
Thank you, Mr. Chairman. When this committee originally considered the Support Act in 2018, the third wave of the opioid epidemic was ravaging communities across the United States. 5 years later, our communities are urging us to reauthorize these programs because they provide vital funding and coordination for treatment, recovery, and emergency response efforts. I co-sponsored this bill because it will do several critical things for my district in San Diego. First, the package will ensure that all state Medicaid programs cover medication-assisted treatment for patients battling addiction. Make no mistake, coverage for medication-assisted treatment will save lives in San Diego and across the country. But we also need to focus on the entire continuum of care for patients in treatment, and that's why I co-led the Comprehensive Opioid Recovery Centers Reauthorization Act, which will help fund comprehensive recovery centers across the country and in San Diego. And I want to thank Representative Guthrie for his partnership and work to advance the bill, which is included in today's reauthorization. And finally, this bill touches one other issue that's important to my district. Though many of San Diego's foster youth depend on these programs, Medicaid has determined that their funding can no longer support care in these facilities if they're larger than 16 beds. That would mean San Diego County could lose funding for almost 70% of the beds across its qualified treatment programs. This bill contains an exemption that will allow San Diego and other counties across the country to continue using Medicaid dollars to care for foster youth in qualified residential treatment programs. I look forward to passing this bill today, reauthorizing the Support Act, and averting disaster for San Diego's foster youth services. Thank you, Mr. Chairman. I yield back.
Gentleman yields back. Anyone seeking recognition? What purpose does the gentleman from Ohio seek recognition?
Strike the last word.
The gentleman's recognized.
Thank you, Mr. Chairman. The Support Act is one of the most important and most meaningful bills I've been a part of during my time in Congress. Simply put, we came together to implement bipartisan policies that would save lives. One of the most horrible tragedies a parent can experience is losing a child. Compounding this injury is the feeling that the child's precious life is stolen when it's lost to drug addiction. Gone are the days of this issue being a far-off problem or one that doesn't impact your local community. Instead of hearing the words, "I know someone who knows someone," too often do we hear our friends, families, and neighbors say, "I know someone personally impacted by addiction." These deadly drugs on our streets are so powerful that children who are injecting them into their bodies are being killed within seconds. According to the DEA, drug cartels are manufacturing fentanyl-laced pills for 10 cents apiece at the cost of one American life. This is an assault on our American communities. In order to fight back, we need to reauthorize the Support Act, which will ensure that we have the right tools at our disposal. I'm saddened that even with all the progress this committee has made to fight this faceless enemy, we still haven't defeated it. This isn't the direction our country should be moving. This is a somber reminder that we may never fully defeat addiction. However, I strongly believe that if we continue to work together like we are today with the reauthorization of the Support Act, we will continue to make progress, and we will continue to fight back, and we will continue to save lives. This reauthorization is needed now more than ever. Again, for the second year in a row, the United States lost over 109,000 Americans to drug poisoning. And over 73,000 of these 109,000 deaths are attributed to fentanyl and fentanyl-related substance poisoning. It's devastating, and we must act now. I appreciate the opportunity to collaborate in a bipartisan manner with the gentleman from California's 36th Congressional District. Together, we're advancing our legislation reauthorizing the Trauma-Informed Care Task Force, a proposal that is included in this bill. While we can be proud of the work we are doing today to reauthorize the Support Act, we must continue building on this work and make sure we are not forgetting those who are. I extend the invitation to work with anyone on the effective policies to save lives. Mr. Chair, I thank you for your leadership on the Support Act. I again pray that one day we will not be having to have these discussions. Let's fix it. Let's promote treatment for tragedy hits and stop these poisonings. I yield back the remainder of my time.
The gentleman yields back. What purpose does the gentlelady from Michigan seek recognition?
Mr. Chair, I move to strike the last word.
Gentlelady's recognized.
Thank you, Mr. Chairman, and I speak both in support of the AINS, which you have yet to offer, and the override bill. The opioid crisis has taken a devastating toll on communities across America. We continue to hear too many stories of loved ones and constituents losing their lives to addiction and to drug overdose. And many of us in the Congress have seen it in our own families. 5 years ago, this committee came together to pass the Support Act, which was an important step forward. The Support Act made tremendous strides in addressing the growing substance use disorder and mental health crisis by helping communities expand prevention, treatment, and recovery services. But in the wake of an evolving crisis driven by synthetic opioids like illicit fentanyl, it is critical we re-examine support to ensure its key programs are extended before they expire at the end of this year. I strongly support this package today, which includes the Fine Fentanyl Act legislation I led with my colleague Rep. Bilirakis to reauthorize the Support Act's laboratory program to strengthen coordination between public health laboratories and those operated by law enforcement. Collaboration between the two plays a critical role in our nation's response to the opioid epidemic and can help us better track evolving threats. But beyond reauthorizing core programs, this legislation includes new bipartisan policies that take what we've learned about the opioid epidemic since the enactment of the Support Act in 2018 and update our approach in responding to these complicated challenges. I want to thank you, Mr. Chairman, and Rep. Custer for your leadership in addressing the mental health and substance use disorder crisis that's facing communities across the nation. More than communities, it's facing too many families. I urge all of my colleagues to support this legislation that I know will save lives. Thank you, Mr. Chair, and I yield back.
Thank you. The gentlelady yields back. Anyone on the Republican side seeking recognition? Anyone on the Democrat side seek? Was a purpose lady from New Hampshire seek recognition?
Thank you, Mr. Chairman. I move to strike the last word.
Gentlelady's recognized.
I am proud to co-lead the Support Act reauthorization with Chairman Guthrie to address the addiction and mental health epidemic in a bipartisan way. This crisis doesn't care about our politics or our party, and neither should our approach to address it. I'm glad this bill reflects that reality. The version of the bill we're discussing today includes new policies regarding Medicaid coverage for people who are incarcerated. One policy builds on my bill that became law as part of the 2023 funding package to expand access to pretrial medical screenings and referrals, and another prohibits the termination of Medicaid coverage upon incarceration. While these are crucial first steps, I believe we can and must do more. I will continue to advocate for my bills and those of my colleagues that advance Medicaid coverage for justice-involved individuals. Our recidivism rates are just too high, and we need to give people the treatment that they need to recover from mental health or substance use disorder. Mental health and substance use challenges affect people who are incarcerated at higher rates, but it's clear that we need an expansive and holistic approach to addressing these issues. Reauthorizing the Support Act is a bipartisan opportunity for this community to direct critical resources to the communities struggling to respond to these crises across the country. I look forward to broad bipartisan support for the bill, and I urge my colleagues to bring it to the floor for a vote without delay. Thank you again to Chairman Guthrie for your partnership and to my colleagues for your support of this bill, and I yield back.
Thank you. The gentlelady yields back. Anyone on the Republican side? Seeing none. The gentlelady from Illinois, what purpose do you seek recognition?
I'd like to strike the last word.
Gentlelady is recognized.
Thank you, Mr. Chair. Given their bipartisan work to advance policies to address trauma, I ask unanimous consent to submit a letter from Representatives Davis and Gallagher thanking the committee for reauthorizing critical policies that they helped enact in the Support Act to expand our understanding of and services help children and families who experience trauma.
Without objection, so ordered.
Trends in modern healthcare and opioid prescriptions have resulted in new risks for patients taking opioids at home. Surgery is among the most common indication for opioid initiation, as opioids are routinely prescribed for postoperative pain management to treat short-term pain. Same-day discharges have resulted in home caregivers becoming responsible for recognizing the signs of respiratory depression. Opioids continue to harbor significant public health risks, such as opioid misuse, overdose, and diversion, with approximately 32% of opioid overdose deaths resulting from prescription opioids. This is why I was happy to work with my partner, Rep. Balderson, to introduce H.R. 4093, the Remote Opioid Monitoring Act of 2023, which requires a GAO study on the use of remote monitoring for patients who are prescribed opioid to better understand the efficacy, individual outcomes, and potential cost savings from using this tool. I am glad to see this bill included in the larger bill. With so many individuals having access to opioids, we must better understand how to ensure patients are safely monitored when they are discharged home and what additional support resources they need to be provided, I encourage my colleagues to support this bill. Thank you, and I yield back.
Thank you. The gentlelady yields back. Anyone from the Republican side? Seeing none. Anyone from the Democrat side? Seeing none. Are there any bipartisan amendments to the bill? Yeah, seeing no bipartisan amendments, I do have an amendment at the desk. The amendment nature of substitute. Is it bipartisan? The whole amendment is bipartisan? Clerk will report.
Amendment in the nature of a substitute to H.R. 4531, offered by Mr. Guthrie. Strike all after the enacting
The reading
clause.
of the amendment is dispensed with, and I guess it is a bipartisan amendment moving forward, but I'll recognize myself for, to strike the last word. This amendment will build on the work we've already done this year in subcommittee to curb illicit drug trafficking in our communities. Specifically, it would schedule a dangerous drug, xylazine, while protecting the current use of it within the veterinary community. Reauthorize federal programs first authored by this committee 5 years ago that provide critical resources to those seek to overcome their substance use disorder. Among these reauthorizations, the bill includes reauthorization of comprehensive opioid recovery centers, which I led when we first passed the Support Act to allow comprehensive programs for individuals in recovery. And the amendment also includes significant resources dedicated to preventing overdose deaths and helping to reduce opioid dependency altogether. And I think we've all heard from in our districts about, even though we still have a large problem with overdoses, a lot of the deaths haven't happened because we have worked together to increase Narcan and make that more available. We also look at straight-level prescription drug monitoring programs. And I'm also proud that we reached compromises on key issues for members of the committee to ensure these policies are fully offset. This includes permanently lifting the IMD exclusion for substance use disorder and permitting qualified treatment programs to bill Medicaid for healthcare services provided outside the walls of these facilities for vulnerable children. Additionally, we did provide in this bill, we do provide for Medicaid coverage to individuals in the criminal justice system by providing for coverage for individuals in incarceration to be ready for them on use of day one. And what the big concern is, I know Medicaid is a state-by-state program, but in Kentucky, people in the prison system, if they're incarcerated, do receive health care benefits provided by the prison system. And a concern that was brought as we were discussing this by my good friend from New York is there's a lag between leaving prison and getting Medicaid services. So we make provisions for people to be fully signed up and ready for Medicaid on day. They don't leave the prison and then expected to go sign up for Medicaid. They're signed up on day one when they leave to prevent the gap that was discussed. So I believe we've addressed that in this amendment. In closing, I remain optimistic that our continued bipartisan efforts will help us turn the tide and change lives. I thank my colleagues for joining me, and I look forward to advancing this legislation to the full House today. I will yield back. And what purpose, gentleman from New Jersey, seek recognition?
To strike the last word and speak in support of your amendment.
Gentleman is recognized.
Thank you, Mr. Chairman. At our subcommittee markup last week, I said that I hope we would be able to find a path forward on policies that will help improve access to Medicaid for justice-involved individuals. In the intervening week, we were able to work together and agree to an amendment that does just that. I'm happy to support this bipartisan compromise and urge my colleagues to do the same. The amendment before us strengthens Medicaid and protects access to care for justice-involved beneficiaries. It will provide states with the option to keep pregnant women on Medicaid enrolled while they are in pretrial detention. This will ensure access to important prenatal care for these individuals and is an important civil rights protection for individuals who have not been convicted of a crime and may only be incarcerated because they are unable to afford bail. The amendment will also prohibit states from disenrolling people from Medicaid just because they have been incarcerated. This policy will help protect access to care for many individuals who would have been kicked off Medicaid during their incarceration. While I'm disappointed that we weren't able to go further, this is a good next step as we continue to work towards a more robust Medicaid reentry policy that so many of our members on both sides of the aisle support. Several members have worked hard on these issues, but I especially want to thank Representative Tonko and Representative Trone for their tireless advocacy and hard work on behalf of Medicaid beneficiaries who are struggling with substance use disorder. Finally, at our subcommittee markup last week, several members, including myself, raised serious concerns with legislation that would have created a major loophole for providers that treat children in foster care who have serious mental health issues. I was especially concerned that this legislation would weaken protections against the use of seclusion and restraint in these settings. I'm glad that the amendment today contains significant changes to this policy that will enable Medicaid to cover children in these facilities for care that they receive outside the facility while maintaining Medicaid's strong beneficiary protections against the use of seclusion and restraint. And I want to thank Chairwoman Rogers and the bill's sponsors for working with me to address these concerns. And while I'm still strongly opposed to the original policy, I'm pleased to support this compromise language. The amendment will make important investments in Medicaid that will expand access to care for vulnerable individuals struggling with substance use disorder, maintain and enact strong beneficiary protections, and make strides towards equitable treatment for justice-involved populations. I would have liked to see us go further, but this bill will still make meaningful improvements to the lives of low-income individuals struggling with substance use disorder. And I'm proud to support your amendment and urge my colleagues to vote yes. Thank you, Mr. Chairman. I yield back.
Thank you. The gentleman yields back. Anyone on the Republican side seeking recognition to speak on the amendment? Anyone on the Democrat side? For our purpose, the gentleman from California seek recognition.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman is recognized.
Thank you. I want to applaud my colleagues for coming to key agreements in this manager's amendment. Expanding Medicaid coverage for services provided to foster youth, reducing barriers to using test strips for fentanyl and xylazine, and lifting Medicaid exclusions for pregnant women in pre-trial custody are huge steps in ensuring access to care for all who need it. I look forward to voting in favor of this bill and continuing to work with my colleagues on policy that will improve access, services, and outcomes for everyone. However, I still want to raise caution about the provisions in this bill that exclude xylazine, that schedule xylazine. Specifically, I'm disappointed that we're criminalizing possession of this substance for a couple of important reasons. First, if someone is charged with possession, oftentimes they're someone who is suffering from substance use disorder. We should not be criminalizing people for an addiction that requires a medical intervention. Second, xylazine is an adulterant, meaning people are often not aware of its presence or the amount of it in their drug supply. It's becoming popular because of the effects it has when combined with fentanyl. So if there's a xylazine problem and it stems from our fentanyl problem, why would we increase criminal penalties on this substance when it is often included without the user's knowledge and is very rarely taken by itself. And my last point is this: there is no evidence to suggest that harsher drug penalties deter use. In fact, our rush to criminalize certain substances in many cases prevents us from treating addiction like the medical condition that it is. I want to reiterate the importance of harm reduction measures in addressing the addiction crisis in our country. And while I think there's a lot of great policy in this bill, I hope that we can pivot away from criminalizing and continuing to work together to promote an adequate, compassionate health response to addiction. As I have said before, we should not be throwing people in jail for having substance use disorders. And also, I'd like to thank my colleagues on the Republican side of the aisle, especially Gus Bilirakis and Kathy Castor and Paul Tonko, and many of my colleagues who spoke passionately today and who likely all of us are going to support this legislation before us, but I think rightfully so pointed out how short we are and what an opportunity we're missing to actually solve many of the issues that we're well aware of, many of the issues that we can and should agree on. Then we have a lot of work to do. And I'm very proud to be on this Committee of Energy and Commerce, because this is where the vast majority of policies actually flow through Congress and to the floor of the House of Representatives and eventually to the President's desk. So I hope that we stand up and work harder in the future to make sure that we actually address these issues more holistically. And once again, thank you so much, Mr. Chairman, and I yield back.
Gentleman yields back.
Madam Chairwoman.
Thank you. Anyone seeking recognition? Speak on the Ains? Any amendments? Any bipartisan amendments? Any amendments? Gentleman from Texas, Mr. Pfluger is recognized for purposes of offering an amendment.
Thank you, Madam Chair. I have an amendment at the desk.
Clerk will report.
Amendment to the amendment in the nature of a substitute to H.R. 4531, offered by Mr. Fluker.
Without objection, the reading of the amendment is dispensed with. Gentleman's recognized for 5 minutes in support of his amendment.
Thank you, Madam Chair. The drug crisis in our country is becoming more tragic every single day, with drug traffickers turning to important veterinary tranquilizer to make drugs more addictive and, unfortunately, more deadly. Xylazine has emerged as an increasingly popular drug to cut fentanyl with, to the intensity of the drug effects and lower the cost of those illicit drugs. Since xylazine is not scheduled under the Controlled Substances Act, it is easy for dealers and traffickers to purchase the substance online for as little as $6 per kilo. The effects of xylazine are devastating and include severe skin wounds that often lead to amputation and severe withdrawal symptoms that leave users trapped in a vicious cycle of addiction. Unfortunately, xylazine use only continues to grow, with the DEA recently reporting that 23% of fentanyl powder contained it in 2022, with much higher levels in population centers like New York, Philadelphia, and Washington, D.C. And despite alarming reports about the rise of xylazine, federal, state, and local law enforcement do not have the tools necessary to effectively track it or crack down on the traffickers that are using it to increase their profits. I'm pleased that the Support Act builds upon a bipartisan bill that Representative Panetta and I have worked to schedule illicit xylazine under Schedule 3 while, and this is important, protecting this critical drug for illicit veterinary use and the livestock industry. The fentanyl crisis has inflicted significant damage on our treatment clinics and programs, on public health agencies, and our entire medical system. The addition of yet another highly toxic and addictive substance to the illicit drug supply has only escalated this crisis. It is of the utmost importance that this committee mounts an active and energetic response to this emerging threat. This amendment would make a technical correction to the bill, allowing the DEA to track the non-animal use of xylazine using their Automated Comprehensive Drug Reporting System, otherwise known as ARCOS. This change is instrumental in allowing DEA to track the illicit sale of xylazine by monitoring every step of the supply chain from manufacturing up to the point of sale. I believe scheduling xylazine while protecting critical uses is a very responsible and, again, bipartisan approach. And I appreciate the committee's work to address this growing threat. I urge my colleagues to support this common sense change, and I yield back.
Gentleman yields back. Further discussion on the amendment? Seeing none, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. Those opposed, nay. The ayes have it, and the amendment is agreed to. Any further amendments? She has an amendment? Okay. Chair recognizes Ms. Castor for 5 minutes for purposes of offering an amendment.
Thank you, Madam Chair. I have an amendment at the desk. It's labeled Castor 039.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 4531, offered by Ms.
Without
Castor.
objection, the reading of the amendment is dispensed with. Gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Madam Chair. Too many young people in America are grappling with mental health challenges. It's gotten so bad, the Surgeon General had to issue an advisory that said the challenges facing today's generation of young people are unprecedented, and it is very difficult to navigate many of those challenges. This was confirmed by national surveys of young people. But the good news is that mental health challenges are treatable, they are preventable. That's why I'm offering an amendment that is my Assist Act. I'm certain that every member here has heard from students and parents and teachers and healthcare providers across the country, as I have in the Tampa Bay area, about the significant shortage of mental and behavioral health professionals, how that is delaying and preventing our neighbors from receiving the care that they need. I recently spoke to a pediatrician about a teenage boy whose biological parents succumbed to addiction, and he said he wanted to do anything he could not to go down that road. The doctor helped him access ADHD medicine and family supports, but couldn't help him with health care in the community. He unfortunately did succumb to drugs and had to go into rehab. He still struggles with addiction issues, and his guardian has trouble getting him into pediatrician appointments. If he had access to school-based therapy or a coping skills development program, he likely never would have found himself in rehab. This is what my proposed Assist Act does. It would provide additional counseling through school systems through a new grant initiative. I also learned about an 11-year-old girl in Tampa who can't find any mental health care services. She has progressively worsening separation anxiety from her mother. Her mother works from home but can't do her work because her daughter spends her days crying at the closed door of her office. The mother is afraid she's going to lose her job. Intervention or cognitive behavioral therapy at school would be a cost-effective help for her anxiety issues and in a comfortable environment for the child that would allow for coordinated care between child, parent, and pediatrician. These stories go on, and I know that you're hearing them too. They're just a few of the examples to illustrate the enormous need for mental health and substance use disorder services because so many kids cannot find the care that they need right now. So the Advancing Student Services in Schools Today Act is common sense legislation that I'm co-leading with Senator Warnock to help hire and retain more mental health and substance use disorder care professionals in schools. Schools are probably the most common sense access point for mental health services, and young people are more likely to seek support in a school-based setting. Unfortunately, going into the past school year, 19% of public schools had vacancies for mental health professionals. 84% of those schools reported it will be somewhat or very difficult to fill those positions. So I'm going to offer this and then withdraw it, Madam Chair, but I really hope that colleagues, this is something that we can work on together in the coming months. We're at a crisis now. There's much we can do on the preventative side, but so many of our kids today need these additional supports, and the school-based setting makes the most sense. This would be a way to attract the counselors that we need to help take care of our kids. Otherwise, I fear that this generation of young people will continue to struggle with the challenges that are all too preventable and treatable. So thank you, Madam Chair, for allowing me to present the Assist Act as as an amendment to the Support Act, and I'll go ahead and withdraw the amendment. Thank you.
Without objection, gentlelady yields back without objection. The amendment is withdrawn. Further amendments? Further discussion? Seeing no further discussion, the vote occurs on the amendment offered by Mr. Pfluger. All those in favor shall signify by saying aye. Aye. All those opposed, nay. The ayes have it, and the amendment is agreed to. Okay, question now occurs on the Guthrie Manager's Amendment as amended. All those in favor say aye. Aye. Those opposed, nay. Ayes have it. Guthrie Amendment as amended is adopted. Question now occurs on approving H.R. 4531 as amended, and a roll call has been requested. The clerk will call the roll.
Burgess. Latta. Aye. Latta votes aye. Guthrie. Griffith. Bilrakis. Aye. Bilrakis votes aye. Johnson. Aye. Johnson votes aye. Bouchon. Aye. Bouchon votes aye. Hudson.
Aye.
Hudson votes aye. Wahlberg. Carter. Aye. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Duncan. Excuse me. Dunn. Dunn votes aye. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Fulcher. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Pallone.
Aye.
Pallone votes aye. Eshu. Eshu votes aye. DeGette. DeGette votes aye. Schakowsky. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz.
Aye.
Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Blunt Rochester votes aye. Soto. Soto votes aye. Craig. Schreier. Schreier votes aye. Trahan. Mr. Han votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye.
Clerk, would you call the names of those members who are not recorded?
Chair Rogers, Mr. Burgess is not recorded. Mr. Guthrie is not recorded. Aye. Guthrie votes aye. Mr. Griffith is not recorded. Mr. Wahlberg is not recorded. Aye. Mr. Wahlberg votes aye. Mr. Curtis is not recorded. Mr. Armstrong is not recorded. Mr. Balderson is not recorded. Mr. Balderson votes aye. Mr. Fulcher is not recorded. Mr. Obernolte is not recorded. Mr. Obernolte votes aye. Ms. Schakowsky is not recorded.
Jan, or Ms. Schakowsky?
Ms. Schakowsky votes aye. Mr. Veazey is not recorded. Mr. Veazey votes aye. And Ms. Craig is not recorded. Craig votes aye.
Clerk, how is Mr. Curtis recorded?
Mr. Curtis is not recorded. Curtis votes aye. Mr. Cardenas is recorded as aye.
Clerk will report.
Chair Rogers, on that vote, there were 49 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 4529 and asks the clerk to report.
H.R. 4529, a bill to amend the Public Health Service Act regarding guidance documents of the Centers for Disease Control and Prevention and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Okay, I have an amendment at the desk. Clerk will report.
Amendment in the nature of a substitute to H.R. 4529, offered by Chair Rogers.
Without objection, the amendment is, the reading of the amendment is dispensed with, and I wish to speak in support of the aims of H.R. 4529, the Public Health Guidance, Transparency, and Accountability Act of 2023. Over 25 years ago, this committee worked together to make sure that guidance released by the Food and Drug Administration still had some kind of a process for input and was clearly noted as guidance rather than regulation enforced by law. FDA has been able to implement that requirement in a way that allows for stakeholder comment and allows for quick release of information in the case of an emergency. It is time CDC does the same. We saw over and over how CDC's guidance, 6 feet of distancing, for example, was taken by businesses, states, localities to be undisputed, best science, and required. What if there had been a public docket opened on that guidance, where school administrators could have noted that guidance is forcing schools to stay shuttered longer, where substance use disorder treatment programs could have indicated the same, where data from around the world suggesting 6 feet didn't really have any scientific significance could have come in. Former Director Walensky finally acknowledged in March of 2021 that 6 feet of guidance was a primary hurdle for wider reopening of classrooms and said CDC would review. CDC guidance wasn't changed until over a year later. CDC's insistence on recommending masking of toddlers was another example where the agency was a global outlier and failed to consider not only other education concerns like speech development, but also the recommendations of other Western public health agencies. Good guidance practices would speed up that whole process, from allowing the public a clear process to flag potential consequences and quickly signal the risk of the policy outweigh the benefits. CDC may have good scientists, but they do not have the only scientists and experts. And it's not just CDC scientists who have had input on these problematic guidances. Teachers' unions influence CDC's guidance on reopening schools based on politics and self-interest, not science. This bill will open up CDC's insular culture and decision-making process to more outside voices, not just the administration's political allies, and bring much-needed transparency to the process, leading to better results. That should be our goal, results based on evidence and science. Each of us represents a district with brilliant constituents who bring expertise and perspectives that could improve the quality of the guidance CDC is releasing. A transparent and accountable guidance development process, one that is visible to outside experts and the public and open for public comment. This is how we will rebuild trust in the agency. I recommend yes on the AINS and the underlying bill. And I yield back. Further discussion? Gentleman from Maryland, for what purpose do you seek recognition?
Move to strike the last word.
Gentleman's recognized for 5 minutes.
Thanks very much, Madam Chair. I certainly agree with the goal of getting to good results, whatever agency's involved, and certainly the CDC is an example of that. But I don't believe that this particular bill advances the CDC's ability to meet that expectation. And actually, I'm disappointed because the committee today is marking up a series of bills. We're going to hear about some others that suggest we haven't really learned from the recent public health emergencies. And I would include this bill among them. Especially in the early days and the weeks of the pandemic, we learned just how important it was for the CDC and other public health agencies to be nimble, to adapt their processes and their guidance to address quickly changing data and emerging science using the experts and the experience they have at their disposal. And we also learned the critical importance of strong two-way communication between federal public health agencies and their state, local, and community partners. And yet the bill that we're discussing right now, H.R. 4259, in my opinion, I think it's shared over here, directly undercuts both of those lessons learned. And in fact, it would hamstring the CDC's ability to do its job and to respond to emerging public health challenges. That's the concern. It would hamper the CDC's ability to share vitally important public health information with the public, disseminate guidance on how to best respond to crises, and effectively stunt our public health response efforts at the federal, state, and local levels. In fact, if you look at it, the CDC could be embarked on trying to provide very important real-time guidance, and that would be completely upended or blocked by some of the provisions that are included in this bill. So it would have the opposite effect of what is being suggested here. And we can't afford that. Now is the time that we leverage the lessons that we learned from the pandemic that took the lives of over 1 million Americans. We need to strengthen the ability of CDC to provide infection prevention and control guidance that will protect patients and healthcare providers, and we need to streamline and boost data collection efforts to ensure that the most effective and efficient communication pathways exist to coordinate our public health efforts. And we need to build up our ability to quickly and deftly deploy a strong public health workforce to be ready not only for the public health crises of tomorrow, but to better respond to the public health challenges we face today. Actually, I want to emphasize that point. This isn't only about how the CDC operates under emergency or pressing or pandemic or public health crises conditions. It's about how it operates on an ongoing basis in order to support strong public health across the country. I urge my colleagues to support legislation when we have it before us that does those sorts of things. And I oppose this particular bill, H.R. 4259, which I think would actually only serve to restrict the ability of the CDC to do its job and protect the health and safety of Americans. And for that reason, I'm opposed. I urge my colleagues to oppose, and I yield back.
Gentleman yields back. Further discussion? Seeing no further discussion, a vote occurs on the amendment. All those in favor, let's see here, yeah. Yeah, all those in favor say aye. Those opposed, nay. The ayes have it. Amendment's agreed to. Any further amendments? Question now occurs on adopting H.R. 4529 as amended, and a roll call vote has been requested. The clerk will call the roll.
Burgess, Latta, Guthrie. Guthrie votes aye. Griffith, Bilirakis, Johnson, Bouchon. Bouchon votes aye. Hudson, Wahlberg, Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Dunn. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kemick. Kemick votes aye. Obernolte. Obernolte votes aye. Pallone. Pallone votes no. Eshu. Eshu votes no. DeGette. DeGette votes no. Schakowsky. Schakowsky votes no. Matsui. Matsui votes no. Castor.
No.
Castor votes no. Sarbanes. Sarbanes votes no. Tonko.
No.
Tonko votes no. Clark. Clark votes no. Cardenas. Cardenas votes no. Ruiz. Ruiz votes no. Peters. Peters votes no. Dingell. Dingell votes no. Veazey. Veazey votes no. Custer. Kelly. Kelly votes no. Custer votes no. Barragan. Barragan votes no. Blunt Rochester. Soto. Soto votes no. Craig. Schreier. Schreier votes no. Trahan. Trahan votes no. Fletcher. Fletcher votes no. Chair Rogers. Chair Rogers votes aye.
Recorded?
Mr. Latta, you are not recorded. Latta votes aye. Wahlberg votes aye. Mr. Hudson is not recorded. Mr. Hudson votes aye. Mr. Johnson is not recorded. Johnson votes aye. Bilirakis is not recorded. Bilirakis votes aye. Crenshaw votes aye.
Clerk, how is Dr. Burgess recorded?
Dr. Burgess is not recorded. Burgess votes aye.
Thank you. Clerk will report.
Chair Rogers, on that vote, there were 25 ayes and 21 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 4381 and asks the clerk to report. 4381. Thank you. Somebody was paying attention.
H.R. 4381, a bill to amend the Public Health Service Act with respect to the determination, termination, and renewal of public health emergencies.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? For what purpose does the gentleman, Mr. Guthrie, seek recognition?
Madam Chair, I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Madam Chair. I'm proud to co-lead this bill with Dr. Murphy, which will give Congress the ability to vote on extending or terminating a public health emergency after it has been renewed twice or 6 months after its declaration. The executive branch needs the flexibility that the public health emergency statute provides them to respond to emerging public health threats. However, I strongly believe Congress also has a role in ensuring our resources are being appropriately utilized during such outbreaks, and this legislation strikes that balance. To put this into greater context, the COVID-19 public health emergency was extended 12 times over the course of 3 years. We've seen the impact COVID-19 PHE had on our kids and others in the community struggling from a loss of a job or because they lacked access to critical behavioral health care services during the public health emergency due to lockdowns. We must pass this bill to ensure Congress is part of the equation when determining when a public health emergency ends, to restore confidence in our public health institutions, and to appropriately respond to emerging threats. Madam Chair, I urge the passage of this bill, and I will yield back.
Gentleman yields back. Further discussion? Mr. Cardenas is recognized. For what purpose do you seek recognition?
Thank you, Madam Chair. I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you. I want to take this moment to reiterate my concerns with the approach of this bill. During the subcommittee markup, my colleagues on the other side of the aisle were quick to call my remarks partisan, revisionist, history. They were quick to talk through their concerns with certain politicians and their culpability in hindering the response to COVID-19. But isn't that exactly the point? You're worried about the politicization of public health emergencies, yet you're putting forth a bill that would only add fuel to the fire. Why would we want to give politicians more say over how we respond to public health emergencies? We must ensure that policy is informed by science and that our experts are guiding the response. This bill, which requires a vote or multiple votes to maintain emergency authorities for our public health specialists, injects politics where it simply doesn't belong. During the COVID-19 pandemic, our public health experts had a hard job in responding to a completely novel virus. They responded quickly, revised guidance where necessary, and ultimately demonstrated an expertise around public health that us politicians just do not have. They are the best defense we have when navigating these types of deadly emergencies, and they are the most qualified to determine whether or not we are in a public health emergency. If this bill were to become law, we risk making public health decisions based on political expediency, not the realities on the ground for all of the people in America. I've said it before and I'll say it again. Politics has no place here, especially when it comes to deadly health emergencies. I hope we can work together on real policies to improve our public health preparedness and responses. A new emergency could hit us at any time, and we should be strengthening our readiness, not cutting our experts off at the knees. With that, I yield back.
Gentleman yields back. Further discussion? Seeing none, the vote now occurs on adopting H.R. 4381, and a roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Wahlberg. Carter. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Pallone.
No.
Pallone votes no. Eshu. Eshu votes no. DeGette. DeGette votes no. Schakowsky. Matsui. Matsui votes no. Castor. Castor votes no. Sarbanes. Sarbanes votes no. Tonko.
No.
Tonko votes no. Clark. Clark votes no. Cardenas. Cardenas votes no. Ruiz. Ruiz votes no. Peters. Peters votes no. Dingell. Dingell votes no. Veazey. Veazey votes no. Custer. Custer votes no. Kelly. Kelly votes no. Bardagan. Bardagan votes no. Blunt Rochester. Soto. Soto votes no. Craig. Schreier. Schreier votes no. Trahan. Trahan votes no. Fletcher. Fletcher votes no. Chair Rogers.
Aye.
Chair Rogers votes aye. Mr. Allen, you are not recorded. Mr. Allen votes aye. Mr. Carter, you are not. Mr. Carter, you are not recorded. Mr. Carter votes aye. Mr. Johnson, you are not recorded. Mr. Johnson votes aye.
Clerk, how is Mr. Armstrong recorded?
Mr. Armstrong is not recorded. Mr. Armstrong votes aye.
How is Ms. Schakowsky reported?
Ms. Schakowsky votes no. Mr. Obernolte votes aye.
Oh. Clerk, how is Mr. Wahlberg recorded?
Mr. Wahlberg is not recorded. Mr. Wahlberg votes aye.
The clerk will report.
Chair Rogers, on that vote, there were 28 ayes and 21 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 3813 and asks the clerk to report.
H.R. 3813, a bill to accelerate the applicability of the requirement that the Director of the Centers for Disease Control and Prevention be appointed by the President by and
Without
with...
objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill?
Madam
For
Chair.
what purpose does the gentleman seek recognition?
Madam Chair, I move to speak in support of the bill.
Mr. Guthrie is recognized for 5 minutes.
Thank you, Madam Chair. The CDC Leadership Accountability Act is what we have before us today, and I'll start this by yesterday. I think some of us might have had the rounds from the CDC, new CDC Director, Dr. Cohen, and I can assure everybody here that there's opportunities for us to work together, work across the aisle with each other, and work together with her. Hopefully, we'll have a great working relationship. And this bill was filed prior to her, so it's nothing on her. However, I do believe Congress should always extend its authority where appropriate, and it certainly is appropriate in the Constitution for the advice and consent, not of this House, but of our friends in the Senate. And I know during the subcommittee, there was a lot of concerns about the sometimes slow pace of the Senate, and that's absolutely frustrating to us at some point on this side of the aisle as well. But I will tell you, it's important that we have oversight, that Congress does move forward. And hopefully whenever there's a president of either party, both parties are can sometimes victims of this or do this, is that when the president's of your party, you don't want to support strengthening legislative oversight, but I think it's vitally important to do that. I think we found that the CDC director during a pandemic is vital to the country, and I think having congressional oversight, even though it's only one house of Congress, is absolutely important through the advise and consent provisions in the Constitution. So what this bill does is make, in 2025, the CDC director is to be confirmed, and this moves it to current, within 6 months. If there are no further questions, or I will yield back.
Gentleman yields back. Chair recognizes the ranking member, Mr. Pallone, for 5 minutes. on the
Thank
bill.
you. Thank you, Madam Chair. I am speaking in opposition to the bill. This bill, in my opinion, is nothing more than an attempt to undermine the Biden administration and force the CDC's newest director, Dr. Mandy Cohen, to be relegated to an acting position subject to the political whims of the United States Senate. This bill serves no other purpose than subjecting a qualified, seasoned public health leader to a drawn-out confirmation fight at a time when senators, as we've seen plainly, are more than willing to hold up critical appointments that are vital to our national security. Should this bill be enacted, CDC would be forced to operate without a permanent director at a critical time when the nation is continuing to recover from COVID-19, as we face new and emerging public health threats, and as the agency is implementing its Moving Forward initiative. And I continue to believe that subjecting the CDC director to Senate confirmation only politicizes the position in a way that is detrimental to our nation's public health preparedness and response capabilities. Additionally, retroactively applying this requirement, Dr. Cohen, does nothing to improve CDC accountability and instead only further ties the hands of our preeminent public health agency to the detriment of the American people. And for those reasons, I urge my colleagues to oppose this bill, and I yield back, Madam Chair.
Gentleman yields back. Further discussion on the bill? Seeing none, the question now occurs on approving H.R. 3813, and a roll call has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Bouchon. Hudson.
Aye.
Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Duncan. Duncan votes aye. Palmer. Dunn. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. Pallone.
Votes no.
Pallone votes no. Eshu. Eshu votes no. DeGette. DeGette votes no. Schakowsky. Matsui. Matsui votes no. Castor. Castor votes no. Sarbanes.
No.
Sarbanes votes no. Tonko.
No.
Tonko votes no. Clark. Clark votes no. Cardenas. Cardenas votes no. Ruiz. Ruiz votes no. Peters. Peters votes no. Dingell. Dingell votes no. Veazey. Veazey votes no. Custer. Custer votes no. Kelly. Kelly votes no. Bardagan. Bardagan votes no. Blunt Rochester. Soto. Soto votes no. Craig. Schreier. Schreier votes no. Trahan. Trahan votes no. Fletcher? Fletcher votes no. Chair Rogers?
Aye.
Chair Rogers votes aye. Mr. Allen, you are not recorded. Mr. Allen votes aye.
How's Mr. Latta recorded?
Mr. Latta is not recorded. Mr. Latta votes aye.
How's Mr. Johnson recorded?
Mr. Johnson is not recorded. Mr. Johnson votes aye.
How's Mr. Bouchon recorded?
Mr. Bouchon is not recorded. Mr. Bouchon votes aye.
How's Mr. Carter recorded?
Mr. Carter is not recorded. Mr. Carter votes aye.
How's Mr. Fluger recorded?
Mr. Fluger is not recorded. Mr. Fluger votes aye.
How's Mr. Armstrong recorded?
Mr. Armstrong is not recorded. Mr. Armstrong votes aye.
The clerk will report.
Chair Rogers, on that vote, there were 27 ayes and 20 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 4421 and asks the clerk to report.
H.R. 4421, a bill to reauthorize certain programs under the Public Health Service Act with respect to public health security and all hazards, preparedness and response related
Without
to the
objection, the
administration.
first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seek to be recognized on the bill? For what purpose does the gentleman seek recognition?
Mr. Chair, I have an amendment at the desk. I don't know if you'd rather take some
clerk.
comments first.
We're doing the underlying bill before amendments.
I yield back.
You want to speak on the underlying bill? Chair recognizes the ranking member, Mr. Pallone, for 5 minutes on the underlying bill.
Thank you, Madam Chair. I regret that we're considering for the first time a partisan PAPA reauthorization. It's unfortunate that the Republican majority is taking us down this path after our country was caught so unprepared for COVID-19. The bill in front of us fails to properly strengthen our capabilities for the next public health emergency and instead further politicizes public health. The legislation also continues to ignore the drug shortage crisis and other vulnerabilities in our supply chain, like unsafe contaminated drugs and shortages in medical devices. House Republicans are now the only thing standing in the way of Congress acting on the national drug shortage crisis in the PAPA reauthorization. For months, Energy and Commerce Democrats have been pushing for real legislation to address the drug shortage crisis, and I'm glad to report that the Senate Democrats and Republicans on the HELP Committee have heeded our call and have come to an agreement to include some of these policies in their bill. Meanwhile, House Republicans have tried to give themselves political cover for refusing to act. The night before our markup last week, we heard about a draft of legislation that Republicans might get around to distributing at some point, although they haven't shared anything with us. And yesterday, Republicans tried to distract from our opportunity to legislate once again with a long letter to the FDA commissioner that asks him questions that he has already answered and puts no new ideas forward. Instead of these distractions, we can make real progress today. Democrats will once again offer policies to strengthen our medical product supply chain as part of the PAPA reauthorization, because we know this is key to improving our preparedness and response capabilities. While I've never said that our legislation will solve every problem associated with drug shortages, each of these 5 policies takes real concrete steps to help FDA prevent or mitigate future shortages and shore up our vulnerable supply chain. The Democrats will not give up in their fight to address the drug shortage crisis that Americans are facing every day. At our Health Subcommittee markup last week, I talked about the roundtable I held at St. Peter's Hospital in New Brunswick, where an oncologist told me that she has had to tell some of her patients that she doesn't know whether they will get their next round of chemotherapy. I had to tell that doctor that we have an opportunity to legislate to better prepare ourselves and prevent future drug shortages, but that House Republicans have so far refused to address it. The Republicans' amendment in the nature of a substitute before us puts more politics, in my opinion, into our public health system by allowing big corporations to help craft the public health strategy developed by HHS through a new private advisory committee to the FEMC, and by requiring inflexible contracts for BARDA and the Strategic National Stockpile that lock in contracts regardless of how these corporations perform or whether their products are still useful or respond to urgent threats. Additionally, one of the most common responses we got when we solicited input for the PAPA reauthorization was to increase funding for the Strategic National Stockpile, BARDA, and other key preparedness programs. However, this Republican bill makes no progress in increasing authorization levels for these programs, leaving us vulnerable again to a future pandemic or other public health threat. Now, this PAPA reauthorization is an opportunity to show the world that we have learned from COVID-19 and will be better prepared for the next public health emergency. Unfortunately, Republicans are ensuring that PAPA expires by engaging in a totally partisan process. Yesterday, Representative Schreier, SU, and every Energy and Commerce Democratic member introduced the Protecting PAPA Act, a bill that increases funding for our core preparedness programs, ensures public health officials have access to critical data in a timely fashion, and includes policies to help secure our supply chain. And I encourage Republicans once again to thoughtfully consider the policies Democrats have offered to show the world that we can work collaboratively on a bipartisan basis on this important subject. And with that, I yield back, Madam Chair.
Gentleman yields back. Further discussion on the underlying bill?
Madam Chair.
On the underlying? Chair recognizes Mr. Hudson for 5 minutes on the underlying bill.
Thank you. Today's an important day for the American people because this committee is taking action that will make America safe. Unfortunately, politics has entered into this. And, after months of negotiating, after extending my hand to our colleagues on the other side and begging them to come to the table so that we can have a bipartisan PAPA bill, here we are today still playing politics. And we hear from the ranking member lecturing us on not caring about drug shortages. We've already had a hearing on drug shortages. We have been very clear that we intend to address drug shortages. In fact, our chair has announced that she's going to be releasing a discussion draft next week on drug shortages. And I implore my colleagues across the aisle, please engage us. Let's make this a bipartisan drug shortages response. And the truth of this is, if we can come together and we can deal with this in a true, meaningful way, I think this is something that we can do very quickly. I mean, to say that we're going to pass these 5 partisan bills that deal with FDA on the drug shortage issue, and that's going to solve the whole problem. And shame on us for not just taking these 5 bills and going home and declaring victory and looking our constituents in the eye and lying to them and telling them we've solved the problem. We have an opportunity starting next week to come together and really solve this. And I believe that if Republicans and Democrats would work together on this, and not only look at just FDA, but let's look at Medicare and Medicaid. Let's look across the spectrum. Let's examine the questions that were raised in our hearing on this, where it was indicated that market forces are the biggest driver of the shortage. I think we can truly solve this. And I just ask my colleagues, let's put politics aside. Let's stop pointing fingers. Let's stop with the daily press releases calling the other side bad people. And let's truly solve it. The ranking member raised some other concerns about the bill we're considering today, one being the FEMC Advisory Board. Well, the National Academies recommended this advisory board in their report, Ensuring an Effective FEMC in 2021. They said this was a good idea that will make the process better. There's also been concerns about our provisions in BARDA that allow more certainty for the private sector. Our bipartisan request for information responses came in over and over and over from the private sector that if they're going to invest large amounts of money to build manufacturing facilities to provide the things we need to respond to pandemics and other emergencies, they need enough certainty. A 1-year contract is not enough to justify the expense to build the kinds of facilities we need to build so that we can make things in America. And so this is a recommendation that came out of our bipartisan RFI. And so I believe the underlying bill is a good bill. I believe we have a responsibility to the American people to take the lessons we've learned over the last 5 years and make our emergency response system better. And a lot of the ideas in this bill are bipartisan ideas that have come from my colleagues across the aisle. I've begged and pleaded and offered opportunities to include other things. The door is still open because ultimately we need a product that we can be proud of, that the American people are counting on us to deliver. And I believe today is a great first step. And so I encourage my colleagues to support the bill. And with that, I yield back.
Gentleman yields back. Chair recognizes the ranking member on the Health Subcommittee, Ms. Eshoo, for 5 minutes on the underlying bill.
I seek recognition, Madam Chairman, to strike the last word and speak on H.R. 4421. Thank you very much. 8 months ago, I entered in good faith to draft a bipartisan PAPA reauthorization. Today, I have two major sensibilities. One, I'm highly frustrated, and my other emotion is I'm worried, because this is such a serious effort that we need to get right, and in my view, it's not right. I think that instead of negotiating a set of bipartisan policy priorities, we're set on locking our nation's public health programs into 5 years of underfunding. Beyond low funding levels, the main substantive policy changes in this policy is going to tie the hands of our preparedness professionals and hinder decision-making. The bill requires BARDA to issue contracts for a minimum of 5 years. 5 years gets rid of flexibility. Flexibility was key to the success of BARDA during the pandemic. So that top line will end up wasting taxpayer money. This is absolutely short-sighted, because at the same time, the bill chooses to fund our strategic national stockpile at less than half of what the experts on the FEMC say is needed to protect our nation. And you know, if you have the resources, then you can buy the products. If you can buy the products, the private sector gains. And most importantly, the people of our country will get the products, those resources that are going to advance the protection of the public health in our country. So if the stockpile has the resources it needs, then the contracts and the certainty that industry is requesting would follow. More importantly, a fully funded stockpile will ensure that we never have to see nurses wrapping themselves in black plastic garbage bags for PPE. This business about the funding levels for the stockpile, I think is really, it's not only woefully inadequate, it drives all the negatives relative to this legislation. Our stockpile is currently stocking flu antivirals that are over 20 years old because it doesn't have the money to replenish. Our smallpox vaccine stockpile was decimated by monkeypox, and we're not providing any increased authorization to address that. The bill is going to provide industry stakeholders with unprecedented influence. There's a place for the private sector, but if you're going to put them in charge of everything that they want and need for their own businesses, that doesn't mean in every case that the public interest would be served the way it should be. We were unprepared for COVID. We've had hearings describing the mistakes and the errors that led to our nation losing more than 1 million lives to the virus. This bill, in my view, and I've worked damn hard on it, it ignores those lessons and it really chooses unpreparedness. by ignoring, we have had key Democratic policies Democrats have offered. And why is it when the Democrats offer a policy, it's partisan? You offer a policy, it's neutral. Doesn't have anything to do with anything partisan. So I want to reject that. I don't want to view your policies as partisan. Our policies certainly are not. This is not a place for any games to be played. I want to continue the success of Operation Warp Speed, but the bill doesn't give ASPR the contract authority. It says it needs to continue that progress. And most critically, you know, this business about this crisis of drug shortages in our country, why is next week and 2 weeks and 2 months from now good? Why isn't this bill the place to at least get cancer drugs for children in this country so that they can keep up their the treatment that they need? With that, I don't have any more time to yield, but I do yield back.
Gentlelady yields back. Chair recognizes gentleman from Ohio, Mr. Latta, for 5 minutes to address the
Thank you,
underlying
Madam
bill.
Chair. Move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you. This is the third time I will be participating in the reauthorization of PAPA, and I'm proud that historically this has been a bipartisan measure. Unfortunately, my friends on the other side of the aisle have chosen this year's reauthorization to pursue a different path. I want to again reiterate what I said to my colleagues last week. I share the same concerns you have surrounding shortages of our nation's drug supplies. Tragically, cancer rates continue to rise in our country. However, with new forms of treatment, we are able to extend the life expectancy and quality of life for millions of patients. We cannot allow this to be disrupted. I've spoken to countless patients, hospitals, and industry leaders, and everyone agrees we can and must fix this immediately. Fortunately, under the leadership of the gentlelady from Washington, our chair of the full committee, we're currently working on a discussion draft to fix this immensely important issue. I encourage and welcome any bipartisan input from my colleagues on this separate topic. However, PAPA is not, let me repeat, not the appropriate vehicle. Simply put, we must not exceed the scope of PAPA's authority. Turning our attention to the bill before us, I'm pleased that the bipartisan legislation, the Healing Response Act, which I'm co-leading with my friend and colleague from Illinois' 2nd Congressional District, is included in the reauthorization. This legislation aims to help rapidly produce medical countermeasures, not if, but when we are in another public health emergency. I'm very proud of all the work this committee continues to produce and how we almost always find a way to work in a bipartisan fashion. This is the best committee in Congress, and I truly hope that my colleagues will support this legislation. Thank you, Madam Chair, and I yield back the balance of my time.
Gentleman yields back. Further discussion. Chair recognizes Ms. DeGette for 5 minutes on the underlying bill.
Thank you very much, Madam Chair. I just want to make 2 observations. The first one is we have worked on the PAPA bill and reauthorization in a bipartisan way over the years, and I want to commend Ms. Eshoo and my colleagues for doing that. I was the chair of the Oversight and Investigation Subcommittee right before the pandemic, and we had a hearing where we brought in all of the scientists, and this was under the Trump administration, and they all assured us that we were ready if we had a pandemic. And we learned woefully during the pandemic that our stockpile was strategically, was fundamentally understocked, that we had problems from start to finish. So today, we have a wonderful opportunity to reauthorize PAPA and actually be ready for the next crisis that we have. Instead, what we're doing is we're just glossing over it, and we're doing some things, but not everything we need to do. And this is our opportunity to do it in a bipartisan way. So I'm disappointed in that. But the other thing I'm disappointed in, and I want to echo what Ms. Eshoo said, because you can't find 2 more bipartisan people than the 2 of us sitting here. And I am really offended when people say that we are being partisan when we're trying to get the drug shortage addressed in this country. I personally am having phone calls from parents whose kids are on these pediatric cancer drugs who are afraid they can't get these drugs. And it's of little solace to them to hear that the chair is releasing a draft bill next week, 1 week before a 6-week congressional recess, where we then come in for 2 weeks in September and 2 weeks in October, during which time we're trying to do the appropriations bills all at the same time by October 1st. Because that's not going to give us, if it's only a discussion draft, it's not like we're even going to be able to mark it up. So that's why you're sensing this frustration over there. It's not because we're being partisan, it's because we're worried about our constituents. So I would suggest we actually hunker down and we try to have a bill that we can pass as quickly as we can to address these drug shortages, because that's really what our constituents are expecting, and I yield back.
Will the gentlelady yield?
I'd be happy to yield.
I'm over here, Diana.
Oh,
Thank you, I
yes.
appreciate that. I appreciate your comments about it makes you feel funny when we say it's partisan. Maybe now, I very gently say, hopefully you can understand that when we're labeled as being in big oil's back pockets or putting polluters before people, we feel kind of the same way.
I'm going to reclaim my time and say I have never said those words, and I'll yield back.
Yes, ma'am, I
Would
agree.
the gentlelady yield?
I'd be happy to yield to the.
I'd just like to very quickly speak on the FDA drug and device policies not included in either HR 4420 or 4421. And I feel like those are the main reasons why the minority is suggesting that we've turned this PAPA reauthorization into a partisan bill. It is true that historically, reauthorizations of these authorities have included FDA policies targeting to facilitating the development of medical countermeasures or drugs, devices necessary to respond to threats, such as smallpox vaccines, anthrax, antitoxins, medicines necessary for radiological and nuclear emergencies. Clearly, the clinical trials in demonstrating these products as safe and effective is different than the drugs with commercial markets. And Congress asked FDA to put out specific guidance and provide a special authority for FDA on those products. Instead, the drug and device bills grant sweeping authority to the FDA to demand information. It duplicates information that they already have, and it is not limited to public health emergency responses. I am committed to addressing the drug shortages. And as has been stated, we are working on a draft bill. This is critical to all of us, Republicans and Democrats, that we address the drug shortages. We are all heartbroken when we hear from our constituents and others the stories, but we need to get at the root cause and the economics behind the drug shortages. And that is what we're committed to doing. The committee has jurisdiction over many programs. We did an FDA-only approach to shortages in this committee a little over 10 years ago in the 2012 user fee bill. The number of drugs in shortage in 2012 are still in shortage again. And I don't want to be having this conversation 10 years from now. So let's do it right. I'm committed to the process. I yield
Madam
back.
Chair, will you tell us what your timetable for actually trying to pass legislation is, rather than just introducing a draft bill next week?
I'm committed to working with the minority to address the drug shortages. We need to take the time. As I just said, this committee took action 10 years ago with an FDA-only approach, and I believe that we need to get to the underlying issues. And we also need to include the reimbursements, the Medicare and Medicaid reimbursements that are also an issue when it relates to the drug shortages. So let's take some time and do it right. I yield back.
Got it, thank you.
Okay.
My time's expired, so.
Madam Chair,
More to come. Okay.
Madam Chair.
Yes. Yes. Okay. Chair recognizes Dr. Bouchon for 5 minutes.
I move to strike the last word.
Chair's recognized, or gentleman's recognized for 5 minutes.
I've been in healthcare for almost 40 years. I went to medical school in 1984. Then I was a resident, and then I was in practice for 15 years. And I couldn't agree more with my Democrat colleagues that drug shortages are a critical problem. I just don't think in PAPA is the right place to address it because it's more complicated than just trying to adjust what federal agencies are doing on this issue. That hasn't been successful. Drug shortages have been an issue since I've been in medical school. And in many respects, even though it seems really bad today, there's been times across my career in medicine that it's been worse. And so I just think that that we can all work together on this issue and really do a deep dive in all the reasons why there's drug shortages. A lot of it's related to economics. You know, companies just can't afford to produce medications that they lose money on, and not just lose a little bit of money, but lose a lot of money. And we have to figure that out. We also have to figure out how do we work with the overseas production, primarily overseas production of active ingredients that are in our medications, and in many respects, the final product, which happened recently with carboplatin, when which is a chemotherapeutic agent, which became short because of a factory in India had to be shut down because of manufacturing issues that might risk patient safety. That can be the FDA, of course, and their evaluation of overseas production of products that are then imported into the U.S. market. But I just agree with the approach of the committee, chairwoman, and members on the Republican side that we should do a deep dive into this. We should really get into the issues in a bipartisan way, because in my experience, almost 40 years in healthcare, to this point, I'm not sure Congress has been very successful in addressing the shortage of medications that has waxed and waned since I first went to medical school in 1984. So let's work together on this. PAPA, I don't believe, is the proper place to address it, especially when it's not a last-minute addition, but it's, I think, late in the discussion addition to PAPA that unfortunately has resulted in disagreement between the two parties on the future of this bill. So with that, Madam Chairwoman,
Would the gentleman yield?
I will yield to the ranking member.
You know, I hear what you're saying on the Republican side, but I can't believe I'm actually saying something positive about the Senate. But, you know, if you look at what the Senate Help Committee is doing, right, and they're supposedly voting on this today, they've included things that we haven't, that the Democrats on our side, you know, that we put forward, things like having reporting on demand issues, having reporting on where the drugs are being manufactured. They don't have the recall, but the demand and the reporting on where these things are manufactured are very key points. Now, I understand you're saying we have to take a deep dive, but you know, these are not things, in my opinion, that are very difficult to figure out. Recall authority, I think, for the most part, many people would be surprised to find out that FDA doesn't have recall authority. Demand, I mean, if you don't know what the demand is, how can you react? You know, I'm not suggesting that that what we're putting forward is simplistic, but it's something that, you know, you can easily figure why you need to have reporting on demand, why you need to know where the manufacturing takes place, why you need recall authority. I don't think these are the kinds of things that we really have the time to spend months on, because
Okay, reclaiming my time because I've only got 45 seconds. I appreciate those comments. I really do. I think we have an opportunity here. It's a complicated reason why things are short. For example, one-time propofol, which is an anesthetic agent, was short in the United States because we had one manufacturer in Europe, and they were opposed to capital punishment, and a couple of our states had proposed to have propofol in their capital punishment protocol, and so the company wouldn't produce it and import it in the United States. So, I mean, that's just one reason. I mean, manufacturing problems overseas, the inability of companies to be profitable. These are very complicated issues, and I think we need a deep dive. I yield back.
Gentleman yields back. Further discussion? Chair recognizes Mr. Peters for 5 minutes.
Thank you, Madam Chair. As we consider reauthorizing the Pandemic and All Hazards Preparedness Act, or PAPA, it's clear we have some lessons yet to learn from the COVID-19 pandemic. And this legislation does contain some individual items that I support. I think it needs to contain a few things that it is glaringly missing. So each year, according to CDC, more than 2.8 million antibiotic-resistant infections occur in the United States, and nearly 35,000 people die as a result. This bill doesn't deal with that. And as pathogen resistance increases, our first-line antibiotics are becoming less effective, but our pipeline to develop new antibiotics is broken. In fact, some of our most innovative antibiotic developers have withdrawn from the market or declared bankruptcy because there's no incentive for them to invest in antibiotics. So my bill with Representative Drew Ferguson, the PASTEUR Act, will repair the pipeline for novel antibiotics so we can be better prepared for the next superbug. Unfortunately, the package before us does nothing to address our antibiotic research and development pipeline, which is a real security and healthcare issue. Second, data. The legislation we're considering today doesn't take concrete action to improve our public health agencies' ability to collect, standardize, and share public health data with decision makers in the field. This is a huge gap, and it's a threat to us that we don't have data that we can use that's consistent, reliable to make public policy decisions. State and local public health departments need access to complete, accurate, and actionable data in real time if we want to respond effectively to the next threat. And last, the drug shortage issue. Now, I take in good faith the assurances of the chair and Mr. Hudson that we're going to see that. I think that's great. I had hoped that it would be in PAPA. I think drug shortages cost patients their lives and cost healthcare providers valuable time. I was just visiting UCSD's Moore's Cancer Center. There's shortages of drugs there that are needed for treatment of cancer, and they've come very close to not having enough of them. So I've co-sponsored Representative Schreier's bill, providing a clean authorization of the core PAPA programs, giving our public health agencies the data authority they need, identifying and resolving drug shortages, and bolstering the strategic national stockpile. This should be an opportunity for the committee to address these glaring issues. I will take the assurances of my colleagues, Mr. Hudson and the chair, as an opportunity to look forward to addressing these issues, and I appreciate their assurances. But because they're not addressed today, I will not support the bill as it stands, and hope we can get it to a place we all can agree on. And I yield back.
Gentleman yields back. Chair recognizes Mr. Carter for 5 minutes on the underlying bill.
Madam Chair, I move the strike last word.
Gentleman's recognized for 5 minutes.
Madam Chair, I'm pleased to see that my bill, H.R. 3631, the State Strategic Stockpile Act, is included in this package. The COVID-19 pandemic made it abundantly clear that the United States cannot rely on China for anything, let alone the safety and security of our drug supply chain. For example, months before we knew of the COVID-19 pandemic, China was withholding critical drugs and PPE from the U.S. We all remember the scramble among states and the federal government for limited supplies of diagnostics, PPE, treatments, and other critical medical countermeasures. And each state had differing priorities and needs. While one needed ventilators, another needed masks. In my home state of Georgia, healthcare providers and patients struggled to access critical medical supplies and personal protective equipment. That's why it's important to not only ensure that the strategic national stockpile is robust, but to also provide ways for states to stockpile treatments and products for their specific needs. To be clear, this would supplement, not replace, the federal strategic national stockpile. Again, this is supplementing the national strategic stockpile, not replacing it. Last year, Congress passed provisions of my State Stockpile Readiness Act, which established a 2-year authorization for grants to encourage the development of state medical stockpiles. My bipartisan bill, H.R. 3631, the State Strategic Stockpile Act, which is being considered today, would extend this matching program through 2028 to create more certainty for states. I encourage my colleagues to support this bill before us today. Thank you, Madam Chair, and I yield back.
Gentleman yields back. Further discussion? Is there anyone on your side? Yes. Chair recognizes Mr. Duncan for 5 minutes.
Thank you, Madam Chairman, Chairwoman. Yeah, the spirit of this is right, and I've got an amendment on the next bill which follows these same lines. the amount of money authorized, it enough for the ranking member of the subcommittee. And it's almost like the Democrats have never seen a dollar they don't want to spend. We allocated $4.5 trillion for the COVID response, money I voted for, the CARES Act and other spending. I think we spent about, well, just say north of $4 trillion without a lot of guardrails and accountability on how that money was spent and why we didn't do some of the things addressed in this during that period. So I'm going to try to support this legislation from my friend, Mr. Hudson, and others, and talk more about spending. But let me remind my colleagues that we're $32 trillion in debt. We just authorized a debt ceiling increase to allow another $4 trillion plus or minus. At some point in time, the chickens are going to come home to roost for this nation with the amount of money we owe. The borrower is servant to the lender, according to Solomon. So just keep that in mind. I yield back.
Further discussion? Chair recognizes Mr. Pence for 5 minutes.
Thank you, Madam Chair. I move to strike the last word.
Gentleman's recognized for 5 minutes.
I was proud to lead the Diagnostic Testing Preparedness Plan Act with my colleagues Congressman Bouchon, Carson, and Congresswoman Schreier. Diagnostic testing capabilities are crucial for successful disease outbreak containment during a public health emergency. Innovators in the Hoosier State, such as Roche Diagnostics, have been leading the charge to ensure the nation has safe and reliable diagnostics. It's important HHS have a blueprint that would facilitate the innovation and development of diagnostics during a PHE. I look forward to working with my colleagues on the Energy and Commerce Committee to get this legislation across the finish line, and I urge my colleagues to support the bill. With that, I yield back.
Gentleman yields back. Further discussion? Gentleman from... Okay, any amendments? Any amendments? Chair recognizes Mr. Hudson for the purpose of offering an amendment.
Madam Chairwoman, I have an amendment at the desk.
The clerk will report.
Amendment in the nature of a substitute to H.R. 4421, offered by
Without
Mr.
objection,
Hudson.
the reading of the amendment is dispensed with. Mr. Hudson is recognized for 5 minutes in support of his amendment.
Thank you, Chairwoman. I filed an amendment in the nature of a substitute for H.R. 4421. After months of bipartisan work and negotiations, about a month ago, we reached an impasse. My comments earlier about the partisanship, I don't want that directed at any individual, and I apologize to Ms. DeGette if she took that as a direct attack on her. But this disagreement we're having over how to address the drug shortages, unfortunately, stopped our discussions on this bill for about a month. Last week, for the first time, I heard concerns with this legislation from my friend and colleagues across the aisle. And since then, I've tried to address some of these issues. And we've implemented, by implementing technical assistance from the administration. I've also tried to have conversations with as many of my colleagues as possible to try to negotiate working through some of these concerns. I've also included a bipartisan initiative to require a biological attribution strategy. While doing this, I'm committed to ensuring that ASPR is an entity that can maintain public trust by communicating with industry, having proper oversight by Congress, and running efficiently to prepare for our next and an inevitable threat. Doing all of these things while keeping it within the bounds of the path to a floor vote has not been easy. But as you all know, it's an essential and timely task. All the provisions in this bill are within the bounds of authorized appropriations and minimal bureaucratic expansion. Now, I would agree with my colleagues across the aisle who've called for more funding for the SNS. I agree it's woefully underfunded. It ought to be funded at the full $2 billion rate. And I've offered to my colleagues that if they could help me come up with some offsets so that it could comply with House rules so that we can move to a floor vote, I would certainly entertain that. I'm proud of the work we've done here, and I would still love to make this a bipartisan bill. And I look forward to moving this legislation to ensure that we have a preparedness plan for our nation when, not if, another disaster happens. So I appreciate all my colleagues for working with me, and I yield back.
Gentleman yields back. Further discussion? Schreier? Are there any amendments? Chair recognizes Dr. Schreier for 5 minutes to offer an amendment.
Thank you, Madam Chair. I have an amendment at the desk.
The clerk will report.
Ms. Schreier, can you specify your amendment?
This is the amendment to HR 4421, the Protecting PAPA Act amendment. Sorry. H4421, Manager's Amendment 01.
Amendment to the amendment in the nature of a substitute to HR 4421, offered by Ms. Schreier. Strike page 2, line 1, and all that follows, and insert the following, and make such conforming changes as necessary. Title 1, preparing
Without
for...
objection, the reading of the amendment is dispensed with. Ms. Schreier is recognized for 5 minutes in support of her amendment.
Thank you, Madam Chair. I'd like to offer an amendment to HR 4421 in order to put forward simply a more comprehensive approach to pandemic response. You have just heard many of our concerns. This amendment simply comprehensively looks at the hardships that we faced during the pandemic and takes some lessons that we need to learn going forward. It takes into account the multiple agencies needed to work together to respond to a crisis. ASPR, CDC, and the FDA have to work in tandem to respond to emergencies, and this Protecting Pandemic and All Hazards Preparedness Act, PAPA amendment, does just that. It reauthorizes the core PAPA programs and also increases the authorization amounts for the Strategic National Stockpile, the Hospital Preparedness Program, and the Public Health Emergency Preparedness Grants, which are used in so many of our districts. It preserves bipartisan efforts like my bills, the Doctors at the Ready Act, which allows ASPR to directly hire healthcare professionals into the National Disaster Medical System, so talent can be retained, and the faster timeline means there will be more providers readily available for patients when they are needed in an emergency. And another is my bipartisan Diagnostic Tested Preparedness Plan, which directs HHS and related agencies to develop a plan for rapid development, approval, and scaling up of diagnostics during a public health emergency. Moreover, it looks holistically at the issues, addresses the nation's drug shortage crisis, something lacking in the previous bill, and works to shore up our supply chains. This bill includes provisions like early warning systems to prevent drug shortages, and it creates transparency to make sure medicines are getting to kids and families who need them. In an emergency, the last thing we should have to worry about is access to necessary medication. We need to make sure we put forward a bill that we can all agree on, that meets the needs that we have just seen during the pandemic, meets the needs of our communities, and one that can make it through the Senate and be signed into law. Our local communities are depending on us to do that and to work together, and we need to make sure that we illustrate in this what we have learned from the pandemic. I yield back.
Gentlelady yields back. Further discussion. Chair recognizes Mr. Hudson for 5 minutes.
Thank you, Madam Chair. I move to strike the last word. This manager's amendment is a complete substitute for HR 4421. It combines HR 4421 and 4420, something that I've been open to doing if Democrats would come back to the table and negotiate with us. It includes a good idea on cybersecurity in the National Health Security Strategy, which I look forward to supporting and hope to include in the final HR 4421. But that's where the potential bipartisanship ends. This amendment strikes a number of my priorities that have gone through regular order, such as codifying that ASPR is now responsible for the Strategic National Stockpile, including an advisory committee for stakeholder input, such as state, and local, and industry perspectives into FEMSI. Again, this is a provision that was recommended by the National Academies for improving the process. It also removes requiring more certainty from BARDA in its interactions with industry partners. This is something that our bipartisan request for information turned up over and over again that was critical. If we want to return manufacturing back to America, if we want people to make huge investments to build manufacturing facilities and with all the input costs to start producing things that we need, they need some certainty. And 1 year contract is not enough certainty for the types of massive capital investments we're talking about. It also increases funding for these programs without cutting authorizations elsewhere and adds broad new authority for CDC to collect data on Americans. Now, CDC has a lot of work to do to restore its credibility coming out of the pandemic. Providing CDC authority to require information from any entity that they deem appropriate for any reason is the last thing the American people want to see. And finally, the manager's amendment adds the 5 drug and medical device shortage provisions that have gotten a lot of discussion in the previous markup and today, and frankly, don't go far enough. These are requests for more information and more authorities to FDA when we don't even know what they've done with the current authorities and all the information that we've allowed them to take now. They're not using them appropriately to address the drug shortage problem as it is. And so just giving them a whole lot more data and a whole lot more authority is not going to solve the problem. This substitute makes it clear that the Democrats' view of consensus and compromise is all of their priorities and none of ours. And from the start, I've been working in good faith to write a bipartisan PAPA. I've been over backwards. I've been open to making changes to this bill at every step of the process. A month ago, for the last month, the concern has been adding these FDA bills. Not one word about these other concerns that we heard about for the first time last week. But I've been working for the last week trying to incorporate some of these ideas. But every negotiation we have ends with me saying, if I add this to the bill, will you support it? And the answer is always no. I'm still open to this negotiation process. I'm still open to perfecting this bill and including the concerns from the other side. But it takes 2 partners to reach bipartisanship. I beg my colleagues to please come back to the table because Republicans are not going to shirk our responsibility to the American people. We are going to move forward with this reauthorization because the lessons we learned from the last pandemic and frankly over the last 5 years demand us to make changes because there is going to be another emergency. It might be this year, it might be in 5 years, but it's going to happen. And we have a responsibility to the American people to do the best that we can and prepare for it. And so we're going to move forward, but I beg my colleagues to join us. We can make better policy that way. We can make this bipartisan. The American people demand it. The invitation is still open. And with that, I yield back.
Gentleman yields back. Further discussion. Chair recognizes Ms. Castor for 5 minutes. For what purpose?
Strike the last word on the aims.
Ladies recognized.
Colleagues, this is a disappointing day. It's not disappointing because we're Democrats or Republicans. It's disappointing for cancer patients. It's disappointing for pediatric patients. We've all heard directly about drug shortages and device shortages. At St. Joseph's Hospital, Children's Hospital, just last month, I heard deep, deep concern from oncologists, from hospital leaders, but that paled in comparison to what I heard from parents who simply want Congress to work on solving problems. We learned a lot of lessons through the pandemic. We watched supply chains come under stress. Certain devices, certain just basic supplies were not available. Yes, there have been drug shortages on and off for a long time, But what we learned through the pandemic is if you build on the transparency in supply chains, we can help bring some fixes. And in doing so, we can help save lives. This really is a unique opportunity because of the PAPA reauthorization, a way for us to work together quickly before the September deadline on a must-pass bill to get something done to save lives across the country. And we're talking largely about these pediatric cancer patients, people that need basic chemotherapy drugs, and this was the unique opportunity. So I would say, let's take advantage of what Dr. Schreier, what Ranking Member Eshoo has put together. A lot of this work was bipartisan. In fact, when you look at some of these bills that should be included in a reasonable aims on drug and device shortages, Drug Origin Transparency Act. Bring transparency to the drug supply chain, require manufacturers to report their pharmaceutical ingredients. This isn't about a cost to the taxpayers, how much money Democrats want to spend. This is asking the drug companies to provide a little bit of transparency. The Drug Shortage Prevention Act required drug sponsors to notify FDA when there's an unanticipated spike in demand for a product that's likely to lead to shortage. There are bipartisan bills in here too. We need to solve these problems. This isn't a partisan fight for partisan fight's sake. This is about people who are going to live or die because of what we do in this committee on moving policy forward. We heard directly the testimony of oncologists who asked us to move forward on shortages. But I hope you remember what Laura Bray, a brave mom, had to say at the beginning of her testimony. She was sitting in a hospital with her daughter Abby when she first heard the words, "We don't have the drug that your daughter needs today. It's on shortage." This was because her daughter was diagnosed with cancer and they were trying to do everything right. Why don't we meet them where they are and try to do what's right for the patients today by actually working to solve problems together, not backing off because the right wing of the right wing in the Congress says we want to make, we don't believe in science and we don't have the wherewithal to do things. This is dangerous, folks, because this right now is being paired with very drastic cuts in the Appropriations Committee to medical research, the National Cancer Institute, and NIH. I know a lot of my Republican colleagues don't want to carry that mantle forward. You've worked too hard for too many years in a bipartisan way on solving problems and moving medical research forward in this country. Just look back at the 21st Century Cures Act that we worked on together. Let's reach back and find that bipartisan spirit again and work to save lives in this committee like we've done in the past. Thank you. I yield back.
Gentlelady yields back. Further discussion on the amendment? There's no further discussion. The vote occurs on the amendment offered by Dr. Schreier. The clerk will call the roll.
Burgess. Burgess votes no. Latta. Guthrie. No. Guthrie votes no. Griffith.
So now,
Griffith votes no. Bilirakis. Johnson. No. Johnson votes no. Bouchon.
No.
Bouchon votes no. Hudson.
No.
Hudson votes no. Wahlberg. Wahlberg votes no. Carter. Carter votes no. Duncan. Duncan votes no. Palmer. Dunn. Curtis. Curtis votes no. Lesko. Lesko votes no. Pence. Pence votes no. Crenshaw. Joyce. Joyce votes no. Armstrong. Weber. Weber votes no. Allen. Allen votes no. Balderson. Balderson votes no. Fulcher. Fulcher votes no. Pfluger. Pfluger votes no. Harshbarger. Harshbarger votes no. Miller Meeks. Kamick. Obernolte. Pallone. Pallone votes aye. Eshu. Eshu votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes no. Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers. Chair Rogers votes no.
Madam Chair, how is Latta recorded?
Mr. Latta, you are not recorded.
No?
Mr. Latta votes no. Miller Meeks is not recorded. Miller Meeks votes no. Mr. Palmer is not recorded. Mr. Palmer votes no.
Clerk,
Ms. Kamick is not recorded. Ms. Kamick votes no. Mr. Armstrong is not recorded. Mr. Armstrong votes no. Mr. Crenshaw votes no.
Clerk, how is Mr. Bill Arrakis recorded?
Chair Rogers, Mr. Bilirakis is not recorded. Bilirakis votes no.
The clerk will report.
Chair Rogers, on that vote, there were 22 ayes and 27 noes.
The amendment is not agreed to. Are there further amendments?
Madam Chair,
Dr. Bouchon,
I have an amendment at the desk.
clerk will
It's
report.
H 4421 FRC Amendment 02.
Amendment to the amendment in the nature of a substitute to H.R. 4421, offered by Mr. Bouchon. Page 4, after line 18, insert the following. C, cybersecurity
Without
resiliency.
objection, the reading of the amendment is dispensed with. Gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Madam Chair. This amendment will add to the National Health Security Strategy a goal for cybersecurity resilience of healthcare delivery systems. As we learned in the COVID-19 pandemic, an integral part of our preparedness efforts is having the healthcare infrastructure in place to be able to take care of patients. Unfortunately, given our technology-driven world, our healthcare system and the ability to care for patients is vulnerable to cyber threats, whether that's just common criminals conducting a ransomware attack or a state-based actor conducting an attack on our healthcare system and disrupt our ability to care for patients. In the first half of this year, there were 295 healthcare data breaches just for the healthcare sector, and this number only includes the breaches required to be reported to HHS. I'm sure there were many more. In 2022, the federal government received more reports of ransomware attacks against the healthcare and public health sector than it received for any other critical infrastructure sectors. When health systems face these ransomware attacks, it throws the system into chaos and threatens its ability to treat patients. This amendment would seek to help these facilities protect, mitigate, and address any impact of these cyber attacks. Additionally, the amendment would encourage hospitals to use the best practices for security
the HHS 405D cybersecurity program already puts out. I encourage others to support this amendment, and I yield back.
Gentleman yields back. Further discussion? For what purpose does the gentlelady from California seek recognition?
Strike the last word and speak on the amendment.
Gentleman.
Colleagues, I support this amendment. I think it is important thinking. I think it's solid policy. In fact, I wrote it. This was included in what we took up yesterday in our underlying PAPA bill. So I thank the gentleman, Dr. Bouchon, for the flattery. But in all seriousness, this is it's a good amendment. It's worthy of everyone's support. PAPA's purpose is to protect our country from, quote, all hazards, including, as everyone here knows, but it's worth restating, bioterrorism and other nefarious attacks. Hospitals have to be in a place to better protect their digital infrastructures from attacks. And U.S. health facilities have been hit with 226 cyber attacks that affect 36 million people in just the first half of this year. Those are staggering numbers. They really are. That's all of our hospitals, not just mine and Dr. Bouchon's. I see Mr. Hudson smiling down there. He likes the fact that Dr. Bouchon and I agree on this, right? At any rate, we need to do more, and I think that this amendment is going to help. I think this is the type of policy improvements we should be pursuing, and we are with this amendment. And I thank the gentleman, and with that, I yield back.
Generally yields back. Further discussion on the amendment? Seeing none, vote occurs on the amendment offered by Mr. Bouchon. All those in favor say aye. Aye. Those opposed, nay. The ayes have it. The amendment is agreed to. Further amendments? Are there any further amendments? Chair recognizes the ranking member, Mr. Pallone, for 5 minutes to offer an amendment.
You have mine. It's the one that says SCD-recall 01, underscore 01.
The clerk will report.
Amendments to the amendment in the nature of a substitute to H.R. 4421, offered by Mr. Pallone. Page 26, after line 12.
Without objection, the reading of the amendment is dispensed with. Gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Madam Chair. This amendment will address a glaring supply chain vulnerability that weakened our response during COVID-19 and could lead to serious harm to Americans if we fail to act. Under current law, if FDA finds that a product is contaminated or otherwise dangerous, there is no process in which they can order a drug to be recalled. That means that if FDA is aware that a drug is dangerous and sitting on pharmacy shelves or in medicine cabinets across the country, and a manufacturer refuses to recall the product when FDA asks, then that product could remain available and cause serious harm for patients. And this is not just some theoretical problem. As the FDA commissioner has explained, during the early days of the COVID-19 pandemic, our country tried to expand its supply of hand sanitizer and over-the-counter drug. A few months later, FDA became aware of some dangerous products after individuals reported serious illness. Several hand sanitizers were contaminated with methanol, microbials, and other harmful ingredients. In one case, the product was imported to the United States from Mexico, and when FDA officials asked the manufacturer to pull the product from store shelves, it took several weeks for them to get a response. All the while, FDA was left powerless in its efforts to protect consumers. In this case, it happened with hand sanitizer, a tool Americans started using at significantly higher rates when the pandemic began. It also happened at one of the riskiest times during the pandemic. What happens when we find out a countermeasure or other critical drug product poses a threat during or in advance of the next public health emergency? And this amendment in front of us would give FDA the authority to recall drugs if that drug would cause serious adverse health consequences or death, and continued availability of that drug could harm public health security and all hazards preparedness and response for emergency periods. The amendment also includes built-in measures for due process that can move quickly. Nothing in this amendment is a radical proposal. I know when I was talking or addressing Mr. Hudson before, and he said that, we need a deep dive on some of these things. I don't really think that's the case, certainly not in this case. I mean, this is not a radical proposal. FDA already has this authority for biologics, controlled substances, food, medical devices, and cosmetics. This amendment would simply address the gap that was highlighted for us during COVID-19. And I know this policy can get bipartisan support because it already has. When the White House took up, when the House took up the SUPPORT Act 5 years ago, it included an amendment that I offered, and this committee adopted unanimously to include this policy. All the Republican members of this committee who were in Congress at the time voted for this policy in that bill. I'm not going to read off the members, but it's the majority of the Republican members that are here today. Unfortunately, when Republicans watered down the policy, they left Americans exposed to contaminated products during COVID-19, which led to some people becoming seriously ill. And while that decision on the part of the Senate Republicans was unfortunate, we have the opportunity to correct this problem here so we aren't left vulnerable during the next emergency. And again, I don't think that these measures this is one of the 5 that, we've been trying to get included. I don't think these things are anything other than common sense, to be perfectly honest. I think most people would probably think that FDA already has the recall authority, but in fact it doesn't. And so that I would ask members to support this really common sense proposal, and I yield back, Madam Chair.
Gentleman yields back. Further discussion on the amendment. Chair recognizes Dr. Bouchon for 5 minutes.
I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Madam Chair. I urge my colleagues to oppose this amendment. It's not clear how mandatory drug recall authorities are specific to either emergency preparedness or, for that matter, addressing the shortage crisis we're currently facing that needs addressed comprehensively, as I mentioned in earlier comments. FDA currently has a number of authorities in its power to enforce against drugs that may be unsafe to the public, including import, seizure, and injunction authorities, as well as new facility and records inspections authorities given to the agency in recent years. This amendment would also give the FDA broad discretion in determining when it could use these recall authorities. Language this broad warrants additional consideration and on how this policy would support public health, let alone how it wouldn't be redundant to existing authorities. The example I've heard brought up by my colleagues most recently is hand sanitizer companies refusing to pull a product. But this amendment applies much more broadly than just over-the-counter drugs. For these reasons, I urge my colleagues to vote no on this amendment, and I yield back.
Gentleman yields back. Further discussion on the amendment. Seeing none, the vote occurs on the amendment offered by the ranking member. A recorded vote has been requested. The clerk will call the roll.
Burgess.
Burgess votes no.
Burgess votes no. Latta.
No.
Latta votes no. Guthrie.
No.
Guthrie votes no. Griffith. Bilirakis. Johnson. Bouchon. Bouchon votes no. Hudson? Hudson votes no. Wahlberg? Wahlberg votes no. Carter? Duncan? Carter votes no. Duncan votes no. Palmer? Dunn? Dunn votes no. Curtis? Curtis votes no. Lesko? Lesko votes no. Pence? Crenshaw? Joyce? Armstrong? Joyce votes no. Armstrong? Armstrong votes no. Weber? Weber votes no. Allen? Allen votes no. Balderson? Balderson votes no. Fulcher? Fulcher votes no. Pfluger? Pfluger votes no. Harshbarger? Harshbarger votes no. Miller Meeks? Miller Meeks votes no. Kamek? Kamick votes no. Obernolte? Pallone?
Aye.
Pallone votes aye. Eshu?
For the purposes of national security, SU votes aye.
Eshu votes aye. DeGette? DeGette votes aye. Schakowsky? Schakowsky votes aye. Matsui? Matsui votes aye. Castor? Castor votes aye. Sarbanes? Sarbanes votes aye. Tonko?
Aye.
Tonko votes aye. Clark? Clark votes aye. Cardenas? Cardenas votes aye. Ruiz? Ruiz votes aye. Peters? Peters votes aye. Dingell? Dingell votes aye. Veazey? Veazey votes aye. Custer? Custer votes aye. Kelly? Kelly votes aye. Barragan? Barragan votes aye. Blunt Rochester? Blunt Rochester votes aye. Soto? Soto votes aye. Craig? Craig votes aye. Schreier? Schreier votes aye. Trahan? Trahan votes aye. Fletcher? Fletcher votes aye. Chair Rogers?
No.
Chair Rogers votes no.
Clerk, how is Mr. Johnson recorded?
Chair Rogers, Mr. Johnson is not recorded. Johnson votes no.
Griffith votes no.
Mr. Griffith votes no.
How is Mr. Latta recorded?
Chair Rogers, Mr. Latta is not recorded. I'm sorry. I have Latta down as no.
Clerk, how is Mr. Palmer recorded?
Mr. Palmer is not recorded. Mr. Palmer votes no.
How is Mr. Pence recorded?
Mr. Pence is not recorded. Mr. Pence votes no.
How is,
Mr. Bilirakis is not recorded. Bilirakis votes no.
the clerk will report.
Chair Rogers, on that vote, there were 23 ayes and 27 noes.
The noes have it, the amendment is not agreed to. Are there further amendments? Chair recognizes Ms. Castor for the purpose of offering an amendment.
My amendment is entitled SCD-device-shortage-04.
The clerk will report.
Amendment to the amendment in the nature of a substitute to H.R. 4421.
Without objection, the reading of the amendment is dispensed with. The gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Madam Chair. Members, one of the important lessons that we learned from the COVID pandemic was the need to strengthen the resilience of our device and the medical device and drug supply chains. I know every one of you is hearing directly from patients and providers at home who are experiencing very severe drug and device shortages. They're scrambling to find workarounds, and they're really doing everything they can to ensure that people get the care that they need. And yes, I get a little bit emotional about this, about drug and device shortages, because I feel a responsibility to convey the frustration and downright desperation of parents and patients and doctors, the way they've conveyed it to me. I've been actively listening to them for many, many months. I've heard from parents whose children couldn't get the chemotherapy drugs or the IV medical nutrition they need to survive.
I've heard from an emergency department physician who is asking pharmacists to proactively report what drugs they have in stock so they can tailor their prescriptions for patients based on whatever is available that day. I heard from a cancer researcher who almost had to halt a clinical trial of CAR-T, and a pediatrician who has hired an employee just to handle pharmacy callbacks. Now, the local Tampa Bay area hospitals and many providers, they've formed a network to help manage and mitigate shortages, but that takes a lot of resources and purchasing power, neither of which are easily available. And when you think about it, I come from a large metro area, and they've been trying to work together to solve this. But if you represent a rural area, if you serve a lot of veterans, if you're really scrambling to serve a pediatric cancer patient in the middle of the country that may not have a children's hospital nearby, it's no wonder that parents and doctors are desperate. What's happening is everyone is scrambling to keep up with the shortages that have cascading effects. It's a colossal waste of money and time, but worst of all, it's having a negative impact on the health of Americans. Based upon what I've heard at home and in this committee during testimony, we need federal legislation to help us have a 30,000-foot view of our nation's supply chains so we can navigate and redirect when we know a shortage is coming. There are a lot of factors that contribute to drug and device shortages, and I agree that market incentives play a role in this problem, but just because we cannot solve the entire problem in this legislation doesn't mean we shouldn't be trying to solve part of the problem. It's unacceptable to me that my GOP colleagues are choosing to ignore concrete policy solutions that we could implement today that we know work. My amendment, based on my Medical Device Shortage Reduction Act, would require manufacturers of critical medical devices to report interruptions that are likely to lead to shortages during a public health emergency. These notifications will have to support public health and security and all hazard preparedness and response for emergency periods, which make this amendment germane. Notifications like these are currently required of drug manufacturers, and you all probably voted for it before because it was required of device manufacturers during the COVID-19 public health emergency in the CARES Act. We have concrete examples of the tremendous help that this authority was to the FDA during the heart of the pandemic, giving the agency the best information to make sound decisions. By the end of 2022, the agency has received over 455 potential and actual shortage signals, translating to hundreds of thousands of devices in shortage, many of which were unrelated to COVID-19. But this information was used to mitigate 350 shortages because the FDA learned about supply chain issues early enough to make a difference. This includes taking action after Winter Storm Uri that halted production of fresh resin to keep production moving on catheters, syringes, and other devices, allowing for the importation of saline flush syringes after a recall so that first responders could rapidly administer life-saving treatment during a cardiac arrest. By the time we learn about a shortage from a provider or patient, it is too late. We've got to get ahead of the drug and device shortages before they happen, and our current haphazard approach of addressing crisis episode by episode is not sufficient to give American families the certainty and quality of care that they need and deserve. This should be an easy one. It will make a tremendous difference. Colleagues, please, on behalf of these patients back home and all of the brave health providers that are working to make sure that they survive and they thrive, let's adopt this amendment to help address one part of the problem right here, right now. I yield back.
Generally yields back. I now recognize myself to strike the last word. I urge my colleagues to oppose the amendment. I think the amendment is in good faith, obviously. Committee Republicans are committed to identifying targeted solutions to drug shortages and the chair has announced she plans to release a discussion draft on drug shortages. I won't repeat my own personal extensive comments from earlier, but we're committed to addressing this in a comprehensive way. The amendment before us talks about medical device shortages reporting to the FDA. It would require device manufacturers to submit information to the FDA anytime there is a reduction of supply of a device that, and I quote, more than negligible. FDA had this authority temporarily during the pandemic, and we have continually asked for how that authority was used and what FDA did with the information. Did the information actually help address the shortages? Is it necessary to require companies to provide it if they think the FDA can help? Will the FDA get flooded with reports as manufacturers over-report minor changes in production? We still don't have those answers from the pandemic and going forward. This policy, I think, needs more work and justification, and I urge my colleagues to vote no on the amendment. I yield back. I will yield to the gentleman from Texas.
I mean, I've been good. I've been sitting here listening to all of this. May I remind the committee that last Congress was a reauthorization year for the Food and Drug Administration. The user fee agreements have to be reauthorized every 5 years or they don't get the extra money that comes their way to do their work. So they're very sensitive to that. And we had virtually no hearings with the FDA in the last Congress. They should have been up here every week. We should have been asking them questions about the problems that were encountered during the pandemic. But for whatever reason, it was decided that we would do a clean reauthorization. I mean, I had an amendment on cybersecurity, which we just heard about. No one really questioned the FDA in the last Congress, and we should have. So we'll have ample opportunity to bring them in the future. I hope we will. But today, the task in front of the committee is to reauthorize the Pandemic All Hazard Preparedness Act, and that is what we should be about. I thank the gentleman for listening to me.
Gentleman yields back. Anyone in Republicans? Anybody? I yield back the balance of my time. Any other members wishing to speak on the amendment? Seeing none, a vote will now occur on the amendment. A recorded vote has been requested. The clerk will call the roll.
Burgess. Burgess votes no. Latta. Latta votes no. Guthrie. Guthrie votes no. Griffith. Griffith votes no. Bilirakis. Bilirakis votes no. Johnson. Johnson votes no. Bouchon. Bouchon votes no. Hudson. Wahlberg. Carter. Carter votes no. Duncan. Palmer. Dunn. Dunn votes no. Curtis. Curtis votes no. Lesko. Lesko votes no. Pence. Pence votes no. Crenshaw. Joyce. Joyce votes no. Armstrong. Armstrong votes no. Weber. Weber votes no. Allen. Balderson. Balderson votes no. Fulcher. Fulcher votes no. Pfluger. Pfluger votes no. Harshbarger. Harshbarger votes no. Miller Meeks. Miller Meeks votes no. Kamick. Kamick votes no. Obernolte. Pallone. Pallone votes aye. Eshu. Eshu votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Aye. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester? Blunt Rochester votes aye. Soto? Soto votes aye. Craig? Schreier? Schreier votes aye. Trahan? Trahan votes aye. Fletcher? Fletcher votes aye. Chair Rogers? Chair Rogers?
How's Chair Rogers recorded?
Chair Rogers votes no.
How's
Mr. Allen is not recorded.
Mr. Duncan?
Mr. Allen votes no.
How's Mr. Duncan recorded?
Mr. Dunn is recorded as no.
Duncan.
Mr. Duncan votes no.
Mr. Crenshaw, how's he reported?
Mr. Crenshaw is not recorded. Mr. Crenshaw votes no.
Mr. Palmer, how's he recorded?
Mr. Palmer is not recorded.
Mr. Hudson?
Mr. Palmer votes no.
Mr. Hudson, how's he recorded?
Mr. Hudson is not recorded. Mr. Hudson votes no.
Mr. Wahlberg, how's he recorded?
Mr. Wahlberg votes no.
How's Mr. Dunn recorded?
Mr. Dunn is recorded as no.
Mr. Dunn's recorded as no. Any other members? We got everybody, I think. The clerk will report the result.
Chair Bouchon, on that vote, there were 22 ayes and 28 noes.
The amendment is not agreed to. Are there any further amendments? Who's up next? Ms. For what purpose does the gentlelady from Colorado seek recognition?
I have an amendment at the desk.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 4421, offered by Ms. DeGette. Page 36.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Well, I'm glad we're here discussing the importance of reauthorizing programs that are vital to our nation's pandemic preparedness and response. I'm incredibly frustrated at some of the policies that my colleagues on the other side of the aisle have chosen to exclude from this package, as you've heard. But despite and this is one thing, despite the testimony provided by leading scientists, public health experts, and government officials who led our nation through the worst public health crisis in a generation, the majority is ignoring some of the lessons we learned during the COVID-19 pandemic. Then the pandemic underscored the importance of both diagnostic test access and accuracy. We all remember what happened with that original COVID test that was incorrectly developed at the CDC. These tests are an important tool that healthcare providers across the country rely on to make decisions about the best course of care and treatment. However, there are too many examples of the tests that are inaccurate or just flat out don't work. This includes a broad range of tests, from COVID-19 tests marketed during the pandemic to tests that determine the kind of treatment a cancer patient will receive. Pregnant women rely on screenings and testing for the health of the mother and the pregnancy. Without ensuring accuracy of these tests, our nation's preparedness and response system and public health system as a whole will be negatively impacted. Both Republicans and Democrats are focused on this issue. Dr. Gottlieb, who was the former FDA commissioner appointed by a Republican president, previously criticized the United States' inability to provide accurate tests to the public quickly. Just 2 months ago, FDA Commissioner Califf testified before the Health Subcommittee on the critical need for a modernized regulatory framework that applies to all in vitro diagnostics. Despite the various technological innovations that have been made to help guide medical decision-making, the FDA does not have the flexibility to ensure patient access when they need it most, like in a pandemic, which could lead to disastrous results right from the start of the next pandemic. So we should be using this time to address the bipartisan concerns that experts from both parties are raising. My amendment, which is the VALID Act, co-sponsored by our acting chair, Mr. Bouchon, would do just that. By providing an oversight framework that balances innovation with the assurance of accuracy and reliability for tests, patients will finally have access to the necessary technology when they need it. We can protect patients, give doctors clear paths forward on the treatment, and provide our nation's overall health by getting to the root of the problem and ensuring that our diagnostic tests are accurate. During the pandemic, FDA established a regulatory pathway for the emergency use authorization of COVID-19. This step has the opportunity to fundamentally change how we identify and respond to threats if we're willing to act on what we've learned. Patients should be assured that they have access to the most innovative tests on the market, but these tests will need to be accurate, and this is what our amendment will do. Mr. Bouchon and I have decided we're going to keep pushing this because it is so important. We know it's probably not germane to this bill, otherwise we'd push it through to a vote. But we really think it's important that we do this as quickly as possible. With that, I will yield back.
Gentlelady yields back. For what purpose does the gentleman from Texas seek recognition?
Thank you, Dr. Bouchon. And of course, you know the respect I have for you and the gentlelady from Colorado on this issue. But I do need to offer a conflicting opinion and disagree on the amendment before us today. And if it were taken to a vote, I would urge opposition. The proposed amendment would give the FDA explicit authority to regulate certain laboratory-developed tests that are currently overseen by the Centers for Medicare and Medicaid Services under the Clinical Laboratory Improvement Amendments. A few thoughts. One of the main thing is you need to know what problem you're trying to solve. And this committee has not had a hearing on this specific issue in this Congress, in the last Congress, and I think it was several Congresses ago that we actually had the hearing. Granting the FDA this authority over laboratory-developed tests, to me, seems more hurtful than helpful. You're adding regulations as it relates to laboratory-developed tests. The results could be potentially to reduce the speed at which innovative tests are developed and halting innovation completely, and of course, limiting patient access to care. Additionally, I am concerned about the impact to academic labs. They simply do not have the infrastructure or the staff to handle the FDA oversight established by the VALID Act. Now, I appreciate that Dr. Bouchon and Representative gets attention to this issue. I appreciate that they have made changes in the amendment from the previous iterations to grandfather in existing laboratory-developed tests. But when I ask the question, how many existing laboratory-developed tests are we grandfathering, no one can give me an answer. It would be great to have a hearing so that we would know that information before we set to change things. And we do need to educate members on all provisions in the VALID Act. We need to continue to discuss improving the safety of tests. And finally, I recommend against advancing this bill without a hearing or significant member discussion. Look, I just got to ask you, and you kind of heard me a minute ago, why in the world would we give the FDA additional authority when they have continuously demonstrated that they cannot handle the responsibilities already in their world? And doubt me on this if you wish, but I would refer you to their own after-action report at the FDA where they examined their shortcomings in the coronavirus pandemic, except that there is no after-action report. They have not even done that. So, ladies and gentlemen, we've got a lot of work to do in a lot of different areas on this. I would speak against adding the VALID Act to this Pandemic All Hazard Preparedness Act legislation. Yes, we need to have additional hearings. Yes, we need to do additional work, but now is not the time to do that. And we don't want to put additional barriers to innovation and limit patient access to life-saving tests. And I'll yield back.
Gentleman yields back. Thank you, Dr. Burgess. I agree. I'd love to have a hearing on VALID. I now recognize myself for 5 minutes in support of the amendment. The Food and Drug Administration does not currently have a review process in place specific to diagnostic tests. Commercial in vitro clinical tests, or IVCTs, that pursue FDA approval are reviewed under broader medical device authorities. Laboratory-developed tests, a subset of IVCTs, are not required to undergo examination for clinical analytical validity. There is a legislative blind spot. Labs developing LDTs are subject to the regulatory authority of the Centers for Medicare and Medicaid Services pursuant to the Clinical Laboratory Improvements Amendments of 1988, or CLIA. Under CLIA, lab operations procedures are overseen and inspected. However, the tests themselves are not reviewed to ensure they are yielding accurate and clinically relevant results. That's not just my opinion, that's the opinion of CMS itself, which specifically has confirmed that they do not have the authority under CLIA to evaluate and regulate LDTs. So why do we need VALID? Historically, laboratory-developed tests were created and used in limited circumstances to perform relatively simple diagnoses. In more recent years, labs have started developing far more complex tests utilized for things like gene therapy and personalized medicine. Ultimately, this is an issue of patient safety and clinical decision-making. Physicians need to have data on the reliability of the tests they order on their patients. Last year, the New York Times reported that many of the prenatal blood tests used to screen for rare disorders were not providing accurate, reliable results. And in fact, in some instances, this led to expectant mothers choosing abortion when they would have otherwise not done so. This LDT loophole creates an opportunity for bad actors to take advantage of patients. Pew Charitable Trust said in an article from May 2022. This allowed people like Theranos and others to market diagnostic tests despite lacking evidence of efficacy or safety. It is appropriate and feasible to require LDTs to undergo FDA review. That said, the VALID Act does not require all lab-developed tests to obtain FDA approval. It grandfathers in all tests currently on the market. It provides an exception for low-volume tests, allowing labs to develop a test specific for an individual or small group of individuals. It provides special exemptions and emergency use authorization processes for high volumes of tests to be utilized without FDA review during public health emergencies. This was actually a revision that we put into the bill after the pandemic. It will not require new submissions for most test modifications, including changes in specimen stability. This accounts for about 75% of the quote-unquote new LDTs. It creates a specific pathway called TechCert for certain types of IVCTs. The TechCert concept will eliminate many submissions. FDA expects 60 to 70% of new high and moderate risk IVCTs to fall under this pathway and not require individual submissions. Here's the kicker on this. If Congress does not use our Article 1 authority, our Article 1 power to pass the VALID Act or something close, the FDA is preparing to act on its own. FDA has recently come out noticing rulemaking saying the FDA has the authority in statute over medical devices, which includes in vitro agents. Nearly all LDTs utilize some form of in vitro agent. FDA also has authority to go after products under adulteration and misbranding provisions. They've said they're going to do this. The FDA can point to a January 2021 letter led by Congressman Chip Roy in response to the New York Times prenatal testing article, which was signed by 97 Republican legislators, including 9 GOP members of ENC, to demonstrate the members of Congress that believe that the FDA has the authority to regulate LDTs. The Trump administration also made several statements indicating its belief that FDA has the authority to act here. Dr. Gottlieb is a big supporter of VALID. So why just let the FDA issue regulations? Rulemaking takes a long time. It leaves lots of power in the hands of bureaucrats. The VALID Act represents years of bipartisan, bicameral, interagency, and stakeholder efforts to develop a widely respected solution. FDA's use of device authorities for LDT rulemaking would impose far greater burdens on labs than the VALID Act. The device authorities were not designed for diagnostic products and so have excessive requirements. In addition, if VALID is not passed, there is no statutory protection for grandfathered LDTs, and there is no transition period as there is in valid. Ultimately, on this, Congress should recognize our Article I power and do something that the FDA is going to do and make things safer for patients. I yield back. For what purposes does the gentleman from Florida seek recognition?
Move to strike the last word.
Gentleman's recognized.
Thank you very much, Mr. Chairman. I rise also in opposition to adding the VALID Act to PAPA today. I have great respect for my colleague, Dr. Bouchon, appreciate his long history of work on this piece of legislation. However, I share the concerns of my colleague, Dr. Burgess, and I have serious doubts about the FDA's ability to effectively regulate laboratory-developed tests, given their current track record and demonstrated inefficiencies. The FDA does not efficiently execute its existing duties and is in need of reform. Now is not the time to task them with yet another regulatory authority. Independent labs and academic medical centers provide an important service when they can quickly tailor service to unique patients, emergency situations, or just unusual ones. Innovation and specialized medicine rely on the ability of these types of labs to act nimbly and quickly. The tests are safe. They're already stringently regulated by CMS via CLIA. And I think if the FDA is granted authority over the lab-developed tests, innovation will undoubtedly suffer. Independent labs will shut their doors, and academic medical centers will lose their innovative edge. I appreciate that the text of VALID Act has evolved over the years, and but I feel that it still strongly feel it needs more work to be done to evaluate the potential impacts and properly educate the members here in the committee about the provisions. I'll add one more thing. In the FDA, they have no scientists in white coats with test tubes standing in front of a bench. They have no ability to do these labs, run these labs. They have to hire that out. There's not one scientist with a test tube in all of FDA. They're all just reading papers. So I'm not sure that this is the right crowd to actually regulate laboratories per se. With that, Mr. Chairman, I yield back.
Gentleman yields back. Pursuant to the lady's previous request, does the gentlelady recognize to potentially withdraw her amendment?
Thank you. Even though nobody challenged the germaneness, I'm a team player. I look forward to having some hearings in the fall, and I withdraw the amendment.
The gentlelady's amendment is withdrawn. Are there any other amendments? Any other members seeking recognition for amendment? And since seeing none, then we go back to the amendment in the nature of substitute and a vote on the amendment in the nature of substitute as amended. All those supporting the amendment in the nature of substitute say aye. All those opposed say no. No. In the opinion of the chair, the ayes have it. The amendment is passed. We now proceed to a vote on H.R. 4421 as amended. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Johnson votes aye. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kemick votes aye. Obernolte. Pallone votes no. Eshu votes no. DeGette votes no. Schakowsky votes no. Matsui votes no. Castor votes no. Sarbanes votes no. Tonko votes no. Clark votes no. Cardenas votes no. Ruiz votes no. Peters votes no. Dingell votes no. Veazey votes no. Custer votes no. Kelly votes no. Barragan votes no. Blunt Rochester votes no. Soto votes no. Craig votes no. Schreier votes no. Trahan votes no. Fletcher votes no. Chair Rogers votes aye.
Did Chair Rogers vote? Any other members seeking recognition to vote? Any other members who haven't voted, who wish to be recorded? Seeing none, the clerk will report.
Chair Bouchon, on that vote, there were 28 ayes and 23 noes.
The ayes have it, and the bill is adopted. Now move to call up H.R. 4420, Preparedness and Response Reauthorization Act. Does anyone, well, the clerk will report.
H.R. 4420, a bill to reauthorize certain programs under the Public Health Service Act with respect to public health security and all hazards, preparedness, and response related to the centers.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any time. So ordered. Does any member seek recognition to speak on the underlying bill? Seeing none, are there any bipartisan amendments to the bill? Are there any amendments to the bill? Mr. Hudson, for what purpose does Mr. Hudson seek recognition?
Mr. Chairman, I have an amendment at the desk.
Clerk will report.
Mr. Hudson, can you specify your amendment?
It's the Ains.
Amendment in the nature of a substitute to H.R. 4420, offered by Mr. Hudson. Strike all after the enactment.
Without objection, the first reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. I filed an amendment in the nature of substitute for H.R. 4420. Just as in the Asper piece of PAPA, after months of bipartisan work, I've only recently heard concerns with these pieces of legislation. Since then, I've tried to incorporate these changes and made a few edits. With the recent release of the Senate bill, I've included some of their policies to address a broader range of threats past pandemic influenza. Given HHS technical assistance, I've included sections necessary for CDC to fulfill its mission to implement the Public Health Emergency Preparedness Program and the Hospital Preparedness Program. These programs support large-scale responses to distribution and dispensing of medical countermeasures and detection of chemical agents and response. I've also included a continuation of the Council to combat antibiotic-resistant bacteria and address the need to expand it further. Like I said last week, CDC needs dozens of reforms and not just a reorganization. To reiterate, the immediate Senate confirmation process for the director, good guidance practices, and further oversight of the agency. These are good first steps to build back their credibility. I look forward to seeing the work of the CDC reform that is currently underway. In the meantime, I'd like to work with my Democrat colleagues to again ensure we're prepared against future threats. I'm again extending my hand and asking them to come back to the table to fulfill the work that we were sent here to do. With that, Mr. Chairman, I yield back.
Gentleman yields back. Does anyone else seek recognition to speak on the amendment in the nature of a substitute? Seeing none, does are there any other amendments? For what purpose does the gentleman from South Carolina seek recognition?
Mr. Chairman, I have an amendment at the desk.
The clerk will report.
Mr. Duncan, can you specify your amendment?
It's just Amendment 01.
Amendment to the amendment in the nature of a substitute to H.R. 4422, offered by Mr. Duncan.
That doesn't, okay, because it's not in the nature of a substitute, is it? Okay, without objection, the reading of the amendment is dispensed with. The gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. I know this has been a long day. Today, I offer an amendment to H.R. 4420, the Preparedness and Response Authorization Act. My amendment would strike the funding level increase to public health agencies and instead authorize the same amount that was authorized last year. As I said earlier, this Congress, we're trying to, and with the debt ceiling deal, Fiscal Responsibility Act, trying to return our spending levels back to at least some sort of sense of normality without plussing things up when we're $32 trillion in debt and growing every day. We're finally on the other side of the COVID-19 pandemic. Even the other side has agreed to this. A pandemic in which our public health agencies really failed the American people with the draconian policies like forced masking and experimental vaccines and, as we're now seeing, politicized science. The Energy and Commerce Committee has already taken great strides during the 118th Congress to investigate the federal response to COVID-19 and look at ways in which our public health agencies do not fail the American people in the future. Unfortunately, this bill offers significant increases to the very agencies that failed in the first place. I don't believe that giving them more money, more of our taxpayer dollars, will fix this issue. Rewarding bad behavior with more money will not only make issues that we're trying to fix worse. Without serious comprehensive reform, I believe we should keep the funding levels the same for these agencies as we on this committee continue to address this issue. I talked earlier about guardrails and accountability and oversight and looking back and seeing how the almost over $4 trillion we spent during the COVID response were spent. Mr. Chairman, the House is in order.
The committee will come to order. The gentleman is recognized.
Without serious comprehensive reform, I believe we should keep the funding levels the same for these agencies. It's important now more than ever that we hold these agencies accountable to their pandemic response so that we don't experience a tragedy like COVID-19 again. We've researched the origins of COVID-19. We've researched and investigated the response to COVID-19. We've had leaders of CDC and NIH in front of this committee, oversight. Also, I realize that the reason these levels are where they are in this bill is because the appropriators have pushed the spending levels to this point. That's also bad behavior. They should have stuck to the authorized levels. We as the authorizers are not beholden to what our big spending colleagues have done. I'm a fiscal conservative. I make no bones about that. I'm concerned about our nation's debt. I'm concerned about where we source our pharmaceuticals. I'm concerned about domestic supply chains and how our nation has set us up for problems if another pandemic happens, for access to drugs and other critical things that we need, such as PPE that we've talked about. So let's hold the line on federal spending by returning these levels back to the prior levels. And with that, I yield back.
Gentleman yields back. Is there further discussion of the amendment? For what purpose does the gentleman from New Jersey seek recognition?
Move to strike the last word and speak in opposition to the amendment, Mr.
Gentleman's
Chairman.
recognized.
Thank
5
you.
minutes.
Despite the clear concerns that Democrats have raised that H.R. 4420 already underfunds the critical programs for our nation's public health preparedness and response, this amendment further reduces the authorization levels from the base bill. Instead of authorizing the most recently enacted appropriated amounts, this amendment would lock in 5 years of authorizations at the same level of funding from before COVID-19 and put our nation's health security at risk. This amendment sums up why we aren't able to reach agreement here today. There isn't even agreement amongst the majority about what the authorization amounts of these critical programs should be. The Public Health Emergency Preparedness, or FEP grants, are critical to ensuring our state and local health departments have the resources they need to respond in the face of an emergency or public health threat. And CDC needs the funding to combat public health security threats as well. Again, instead of working with us to find a path forward, this amendment only puts us further apart. And so I strongly urge my colleagues to oppose this amendment. And with that, Mr. Chairman, I yield back.
Gentleman yields back. Is there any further discussion on the amendment?
Mr. Chair, I move to strike the last word.
Ms. Lesko is recognized for 5 minutes.
Thank you, Mr. Chair. Our nation is in debt over $31 trillion. During COVID-19 pandemic, we experienced and suffered repeated failures by the CDC in policy and guidance. At a time when its policies were the most important, its decisions instigated a lot of mistrust in public health. I support Mr. Duncan's amendment, and I encourage my colleagues to vote yes.
Will the gentlelady yield?
Yes.
Thank you. You know, continuing to grow government, and there's an old saying, I'm from the government and I'm here to help. We haven't spent an unprecedented amount of money during the COVID-19 response. And continuing to grow the size and scope of government is not always the answer. What we should be doing in this committee is unleashing and unbridling the innovative and entrepreneurial spirit that Americans have and the American industry has. Government and more government spending is not always the answer and the solution. As I said earlier, it seems like my colleagues on the other side of the aisle have never seen a dollar they don't want to spend. Throwing more money at something and increasing budgets at a time of fiscal uncertainty in this country. I believe our national debt is one of the biggest national security threats we face. And if we don't look at every appropriated dollar, at how it's spent, programs that it's spent on, unauthorized programs, 1,500 unauthorized programs in the federal government right now, agencies are operating unauthorized, and we're going to continue to increase their budgets. I'm not saying that some of it's not appropriate, but just returning this or keeping this at the level where it was last year is appropriate in this instance, and I urge my colleagues to support this. I yield back.
Does the gentlelady yield back? Gentlelady yields back. Any further discussion on the amendment? Seeing none, the vote now occurs on the amendment. A roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Johnson. Johnson votes aye. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Balderson. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Kemick. Obernolte. Pallone. Pallone votes no. Eshoo.
I can't believe this. The Republicans are voting against their own bill. I vote.
Better vote.
Are we voting no? No.
Eshoo votes no. DeGette. DeGette votes no. DeGette votes no. Schakowsky. Matsui. Matsui votes no. Castor. Castor votes no. Sarbanes? No. Sarbanes votes no. Tonko?
No.
Tonko votes no. Clark? Clark votes no. Cardenas? Cardenas votes no. Ruiz? Ruiz votes no. Peters? Peters votes no. Dingell? Dingell votes no. Veazey? Veazey votes no. Custer? Custer votes no. Kelly? Kelly votes no. Barragan? Barragan votes no. Blunt Rochester? Blunt Rochester votes no. Soto? Soto votes no. Craig? Craig votes no. Schreier? Schreier votes no. Strahan? Strahan votes no. Fletcher? Fletcher votes no. Chair Rogers? Chair Rogers votes aye. Mr. Bilirakis, you are not recorded. Mr. Bilirakis votes aye. Mr. Dunn, you are not recorded. Mr. Dunn votes aye. Chair Rogers, on that vote, there were 26 ayes and 22 noes.
The amendment is agreed to. Are there further amendments? For what purpose does the lady from Florida seek recognition?
Madam Chair, I have an amendment at the desk, H4420, FCD Amendment 2.
The clerk will report.
Amendment to the amendment in the nature of a substitute to H.R. 4420, offered by Ms. Castor, beginning on page 6, line 17, strike section 107 and insert the following, and make such conforming changes as may be necessary. Section 107, supporting
Without
public...
objection, the reading of the amendment is dispensed with. The gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Madam Chair. Colleagues, one of the other lessons we learned from the COVID-19 pandemic is that we must ensure that our public health partners have the necessary tools and resources to keep our neighbors healthy and well and to keep our community safe. This includes having access to the most accurate, thorough, and timely data for the public. We must be able to detect disease in real time and stamp out problems before they grow. During the COVID public health emergency, Congress helped CDC use its emergency authorities to make great strides in standardizing data. They work closely with state and local partners to collect the information needed to make evidence-based decisions as Americans were dying. We need to continue the progress. Unfortunately, now that the public health emergency is over, America's leading public health agency is back to hammering out hundreds of individual data use agreements in every state and locality. You talk about a waste of taxpayer money, talk about a waste of time. This is time-consuming, it's patchwork, it's inefficient. I don't want our lead public health agency focused on all this bureaucratic red tape. We need them to use their finite resources to help save lives and detect disease. As the ranking member on the Oversight and Investigation Subcommittee, we've held multiple hearings since January on the past, present, and future of pandemic response, and there has been a common theme throughout. We've heard from all sorts of folks. What they say is Congress must step up in its role to improve the nation's public health, and that means making sure that CDC can be as efficient as possible, providing data, providing information to the public, working with our local partners at home. Here's what some of for those of you who didn't have the benefit of listening in on a lot of our hearings, here's what we heard. The director of the healthcare section of the Government Accountability Office said the data HHS has relied on during COVID-19 pandemic have been and remain incomplete, and inconsistent, highlighting long-standing concerns in this area about public health data collected, how it's collected. They recommend prioritizing the development of an interoperable network of systems for near real-time data situational awareness, helping to modernize the data collection. The Tom Inglesby, the director of the Johns Hopkins Center for Health Security, said data systems that help state and federal leaders understand when hospitals are nearing capacity are vital. He recommended modernizing data collection. Dr. George Benjamin he's the executive director of the American Public Health Association. He said, without reliable and timely data, public health decision-making is ineffective. For far too long, data collection has been slow, inconsistent, based on a patchwork of individually negotiated data use agreements between CDC, state, and local entities. Numerous studies have documented the need for better and more timely data collection at all levels of the public health system. Dr. Washington, the director of the Public Health Department from Mecklenburg County, North Carolina, said every effort must be made to strengthen public health data systems as an essential component of emergency preparedness, disease detection. It's too fragmented and inconsistent. We can do better. So members, I'm proud to lead the Improving Data in Public Health Act with my colleague, Representative Underwood. I'm offering it as an amendment today. The bill would promote data sharing between the federal agencies, but really help modernize the data collection so that our neighbors back home can understand what's in front of them and we can adequately prepare for the next pandemic. Our entire public health infrastructure needs access to the most timely, thorough data to inform everything that we do. We learned this lesson during COVID. Let's eliminate these very bureaucratic, time-consuming, costly data use agreements and move towards a modern system to help save lives in America. I urge adoption of the amendment and yield back.
Gentlelady yields back. Further discussion on the amendment? Gentleman, Mr. Guthrie is recognized for 5 minutes.
I move to strike the last word. I'm going to speak in opposition to the amendment. We talked about this in the Health Subcommittee last week, and this amendment that significantly expands required data that must be shared to the CDC. It would give the CDC authority to capture and use personal information. And questions still remain on how CDC used Americans' data throughout COVID-19 pandemic. We must continue our work to conduct oversight in the agency and how the agency operated throughout COVID-19 public health emergency. So I urge my colleagues to oppose this amendment. As I said just earlier, we had Dr. Cohen, some of us saw her yesterday, we chatted with her. I had the opportunity to, I think, have some, hopefully we can all build a good working relationship and we can bring back trust into our public health institutions. I just think what we need to do first and foremost though, and I'll close with this, if you really want to support this, CDC's current data authorities, then you would support Mr. Hudson's legislation, which includes a bipartisan proposal that I worked with Mr. Peters to require GAO to study how CDC used their data collection authorities unlocked by the PHEs. We have a GAC study this is going to launch. We're going to have information. I believe we have a CDC director hopefully we all can work with, and I think we can move this forward. I urge to not pass this amendment and move forward on trying to build back confidence in the CDC together. And I yield back.
Gentleman yields back. Further discussion on the amendment? Chair recognizes Mr. Sarbanes for 5 minutes.
I'll just take 30 seconds, Madam Chair. I just want to support the amendment from Representative Castor. We had testimony along the way in this committee from some of the private sector actors that stood up in the midst of the pandemic and helped collect data and build very sophisticated dashboards like what Hopkins did, and that became a resource for many in this country and across the world, and it gave us some insight into what it means to collect data and present it and put all the right kind of disclaimers in place and so forth. But those witnesses have observed that a lot of places, public health departments and so forth across the country, after the pandemic was over, in effect closed up shop when it came to supplying data. We need the CDC to be able to build a continuous communication channel out to these public health officials to collect this data on an ongoing basis and build the kind of picture that we need, not just for the next crisis or pandemic, but for basic everyday public health in this country, which is exactly what the bill that Representative Castor is offering as an amendment to this bill would do, and I support it, and I yield back.
Gentleman yields back. Further discussion on the amendment? Seeing none, the vote occurs on the amendment offered by the lady, Ms. Castor. All those in, do you want to? A recorded vote has been requested. The clerk will call the vote.
Burgess. Burgess votes no. Latta. Latta votes no. Guthrie. Guthrie votes no. Griffith. Griffith votes no. Bilirakis. Bilirakis votes no. Johnson. Johnson votes no. Bouchon. Bouchon votes no. Hudson. Hudson votes no. Wahlberg. Wahlberg votes no. Carter. Carter votes no. Duncan. Duncan votes no. Palmer. Palmer votes no. Dunn. Dunn votes no. Curtis. Curtis votes no. Lesko. Lesko votes no. Pence. Pence votes no. Crenshaw. Crenshaw votes no. Joyce. Joyce votes no. Armstrong. Armstrong votes no. Weber. Weber votes no. Allen. Allen votes no. Balderson. Balderson votes no. Fulcher. Fulcher votes no. Pfluger. Pfluger votes no. Harshbarger. Harshbarger votes no. Miller Meeks. Kamick. Kamick votes no. Obernolte. Pallone. Pallone votes aye. Eshu. Eshu votes aye. DeGette. DeGette votes aye. Schakowsky. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingell. Dingell votes aye. Veazey. Veazey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Bardagan. Bardagan votes aye. Blunt Rochester. Blunt Rochester votes aye. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers. Chair Rogers votes no.
Clerk will report.
Chair Rogers, on that vote, there were 22 ayes and 27 noes.
The noes have it. The amendment is not agreed to. Further amendments? Are there any further amendments? Further discussion? Okay. Seeing no further discussion, the vote occurs on the Ains. Was it amended? The Ains as amended. All those in favor say aye. Aye. Those opposed, nay. The ayes have it. The Ains is agreed to. Question now occurs on approving H.R. 4420 as amended, and a roll call has been requested. The clerk will call the roll.
Burgess. Sir. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson? Bouchon? Bouchon votes aye. Hudson?
Aye.
Hudson votes aye. Wahlberg? Wahlberg votes aye. Carter? Carter votes aye. Duncan? Duncan votes aye. Palmer? Palmer votes aye. Dunn? Dunn votes aye. Curtis? Curtis votes aye. Lesko? Lesko votes aye. Pence? Pence votes aye. Crenshaw? Crenshaw votes aye. Joyce? Joyce votes aye. Armstrong? Armstrong votes aye. Weber? Weber votes aye. Allen? Allen votes aye. Balderson? Balderson votes aye. Fulcher? Fulcher votes aye. Fluger? Fluger votes aye. Harshbarger? Harshbarger votes aye. Miller Meeks? Kamick? Kamick votes aye. Obernolte? Pallone? Pallone votes no. Eshu? Eshu votes no. DeGette? DeGette votes no. Schakowsky? Matsui? Matsui votes no. Castor?
No.
Castor votes no. Sarbanes? No. Sarbanes votes no. Tonko?
No.
Tonko votes no. Clark? Ms. Clark votes no. Cardenas? Cardenas votes no. Ruiz? Ruiz votes no. Peters? Peters votes no. Dingell? Dingell votes no. Veazey? Veazey votes no. Custer? Custer votes no. Kelly? Kelly votes no. Barragan? Barragan votes no. Blunt Rochester? Blunt Rochester votes no. Soto? Soto votes no. Craig? Craig votes no. Schreier? Schreier votes no. Trahan? Trahan votes no. Fletcher? Fletcher votes no. Chair Rogers? Chair Rogers votes aye.
Mr. Johnson recorded.
Chair Rogers, Mr. Johnson is not recorded. Mr. Johnson votes aye.
The clerk will report.
Chair Rogers, on that vote, there were 27 ayes and 22 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 3887 as amended by the Subcommittee on Health and asks the clerk to report.
Committee print of H.R. 3887.
Without objection, the first reading of the bill is dispensed with, and the bill is open for amendment at any point so ordered. Does anyone seek to be recognized on the bill? For what purpose does the gentlelady seek recognition from Arizona?
Thank you, Madam Chair. I move to strike the last word.
You're recognized for 5 minutes.
Thank you, Madam Chair. I am supportive of this bill. Children's hospitals throughout America are currently performing gender-changing surgeries on minors and young children, sometimes against the parents' own will. This is wrong. In a Protect Kids Caucus meeting that I held last year, we watched a few videos produced by the Boston Children's Hospital in which the director of Gender Multi-Specialty Service claimed that a child will, quote, often know they're transgender from the moment that they have any ability to express themselves. So is that when they're a toddler? A bill is moving through the California State Assembly now, which reportedly will hold parents liable for child abuse if they do not affirm their child's gender identity. Parents could actually have their children taken away from them if they don't go along with gender-changing surgeries, hormone therapy. This is outrageous, and it's wrong. I cannot allow children to be harmed in this way, and I will certainly not allow taxpayer dollars to be used for it. I applaud you, Representative Crenshaw, for including a provision in this bill prohibiting federal dollars from going to children's hospitals that furnish these harmful procedures that are often cannot be changed back to minors and children. I encourage the passage of this bill, and I yield back.
Further, does anyone else seek to be recognized on the bill? For what purpose does Ms. Eshoo seek recognition?
Strike the last word and speak in opposition to the legislation. My colleagues, you've heard me rise and speak against what this not only does to one of the best, finest, most effective programs that we have in the country, the training of pediatricians for children's hospitals across our country and pediatric specialists. This has been such a popular program, and there has been such collective pride in it on both sides of the aisle. It has always passed by, as long as I can remember, on a voice vote. It has passed on suspension on the floor of the House. We all know that requires a 2/3 vote. That's the kind of solid bipartisan support the Children's Hospital graduate medical education has enjoyed in many Congresses. Fast forward to today. I think that this is one of the saddest things that's happened at this committee, most frankly. And I've been sitting here thinking about it, and I recall great Republicans that served in the House of Representatives: Sherry Bollard, Fred Upton, Amo Houghton, Bob Michaels, Connie Morella, Susan Brooks. I'm sorry to say, but I think that the Republican Party has really crashed. This is not what those Republicans would ever do. They did not justify a policy and rejoice and celebrate the cruelty of people. There are two things that have guided me, especially in this issue, but they are the bookends in terms of how I approach things. Certainly this case. Science, and I might add, these are the very pediatricians and pediatric specialists being trained that not only have cared for my children, but yours. Now you want to damage the program. Two things: science, and there's junk science in this issue. I'm not going to go into it, but I've had the physicians talk to me about it. So science and my faith, most frankly. We are all God's children, and so are transgender children. They're not freaks. God made them. So Republicans, I think this is a sad day, because it's not only sad in terms of the issue and what happens with these votes and the words that go across the country and bomb threats against children's hospitals. That's what's happening. You even put it in the Defense Authorization Act. Come on. This is wrong. This is wrong. This is wrong. This is wrong because it's cruel. It's not just a bad policy, it goes beyond that. And it makes me sad about your party, because these members and so many others, the Gerald Fords of the House of Representatives, they would have never gone near anything like this. It's a different time, and it's a different organization. I have said to constituents, this is not a Republican Party. Not in my view. Republican Party had great leaders here and for our country. Decent people that would look to do the right thing. So with all of myself, I oppose this legislation for the reasons that I've stated, and that it's my remarks are really in sadness. I have a dark black crepe paper around my statement because I think it's a very sad commentary on what was once a great party in our country. I don't think, with all due respect, any longer. And I yield back the balance of my time.
Gentlelady yields back. Chair recognizes gentleman from Indiana, Dr. Bouchon, for 5 minutes.
Yeah, I mean, I honestly don't know how to respond to my friend's comments that the Republican Party has crashed because we don't support permanently surgically changing children's genitals. Look, I've said multiple times gender dysphoria is real and needs therapy. If you're 18 or older, it's a free country. But in children, I mean, I think people need to do some soul searching about saying that the Republicans are on the wrong side on this particular issue. We need to fund our education programs at children's hospitals. I trained at a children's hospital. They're outstanding. But I just take offense to saying that the Republican Party has crashed because we will refuse to support permanently changing children's genitals and also, or permanently changing them physiologically using hormone therapy prior to puberty. Look, people who have gender dysphoria who are children need treatment. Nobody's not saying that. They need psychotherapy. They need probably medication for depression and other issues that come along with this. But they certainly don't need to have surgical removal of their genitals when they're children. And then we have people out there think, oh, this isn't a real. Really, Washington State, I know, the chairwoman's home state, just like California, I think they already have into law that you can lose your parental rights if you don't agree to this. I mean, as a physician, I just can't wrap my head around this. Everybody needs to really do some soul searching here. No, I don't think anyone's saying we shouldn't provide therapy for people with gender dysphoria who are children. I'm certainly not. But I just don't know. I honestly just don't know how to respond. I mean, this really is 1984. I mean, this is Orwellian, where the party, so to speak, is trying to pressure the American people to agree to this. For what purpose? I think probably for electoral purposes, to try to get voters. I don't know. I just cannot wrap my head around this, and I have a great deal of respect for all my colleagues, but I think everybody needs to do some soul searching here when you're calling an entire political party crashing because we won't agree that children should permanently have their genitals removed and changed to treat gender dysphoria. As a physician, do no harm. Again, I want to reiterate, that doesn't mean I don't think these children need respect and treatment. We just cannot, and I will not condone permanently changing children. Again, if you're 18 years old, it's a free country, you can make that decision on your own. I mean, this is Orwellian. I mean, I just can't wrap my head around it. I yield back.
Gentleman yields back for the discussion. Chair recognizes Ms. DeGette for 5 minutes on the underlying bill.
This is a really hard conversation, and it was particularly hard for me to hear my friend Dr. Bouchon make the statement he did, because if you look at what this bill does, it doesn't just ban surgical procedures for children. It bans all gender-affirming care, which is lots of other things that he says that kids should be getting. And kids should be getting that treatment. And furthermore, as I understand it, it's not the standard of care to provide surgery to kids who are under 18. I don't know that, but this bill goes far, far beyond that. And if we want to talk about these issues, then let's talk about these issues in real fact. Let's not try to demonize the other side, and let's certainly, whatever we do, not make these kids more vulnerable because of our words. And I yield back.
Will gentleman yield? Will gentlelady yield? No. Over here.
Yes.
Thanks. Got you fired up over there, I see. I just wanted to add one additional perspective. I think it's been touched on, but because we are looking at it rightly through the eyes and the experience of individuals that would be impacted by this, we maybe haven't spoken as much to the institutions. These children's hospitals, the culture of them is to look after children, to provide care to children. The whole mission and purpose, every professional who works in those hospitals, from the rank and file up to the executives, the administrators of those hospitals, are there because they want to provide care to children. They want to embrace children. And to force them to make a choice between what is their mission, their reason for being, and being able to accept these resources is unfair to them as institutions and as professionals and hospitals that are dedicated to that particular mission. So I think that's just another dimension of this which causes me concern. And with that, I yield back.
And I yield back.
Gentlelady yields back. Further discussion. Gentleman from Ohio, Mr. Johnson, is recognized.
Madam Chair, I request to strike the last word. I have to ascribe myself with the comments of my colleague, Mr. Bouchon. I struggle to understand this argument, this debate. I agree with the ranking member of the Health Subcommittee in one aspect of what she said. It is a very sad day. It's a sad day that we have politicized an issue that seeks to allow minor children who can't even decide what they want to eat for breakfast, or whether to do their homework, or whether to take a coat with them to school because the weather is going to be cold, to make a permanent, life-changing decision to have surgical removal of their genitals, and without their parents, in some cases, even knowing about this. It saddens me that this institution is even having this kind of discussion. I think we are so far removed from what our founders anticipated and expected us to do. I'm almost speechless in how to respond to this. It boggles my mind. I agree with Mr. Bouchon. We better do some soul searching because we are heading down a path that is going to be very, very difficult in a few years to reverse. And I'd urge my Democrat colleagues to reconsider this.
The gentleman
Gentleman
yield?
yield? Oh, yeah.
I would yield to the gentleman from South Carolina.
I thank the gentleman from Ohio, and I appreciated his comments. You know, I'm not as young as some members of this committee. I'm not as old as some others. I'm 57. And in my lifetime, it's really been in the last decade or less that this whole gender transition, pronouns, et cetera, have come about, to my recollection. I can only speak to my memory. Not that transgender folks, people that identify different ways, have not always existed. That's not what I'm saying. But this whole idea of transgender surgery, especially for children, sometimes, as the gentleman from Ohio said, without parental consent, what we're seeing in our education system, where teachers seem to be encouraging a lot of this. I wonder what attributes to a lot of this. I believe social media, peer pressure, bullying, et cetera, probably has. But I think the right idea that allowing 18-year-olds and older consenting adults where, we don't even allow 18-year-olds to buy alcohol anymore. They can't buy cigarettes. They can't do certain things, but we're going to allow people younger than 18 now to alter their physical body. Oftentimes it's not reversible. It's hard for me to wrap my head around. I believe it's a modern thing, and I think we do need some soul searching in this country and as members of Congress on what we spend tax dollars for, hardworking Americans, and such a small percentage of the population out there that want to go down this road. We've got a lot of other things to think about funding in this government: national defense, armaments, salaries, unfunded Social Security and Medicare accounts that we've robbed in the past. A lot more to be thinking about when we talk about spending taxpayer dollars than this. And I appreciate the gentleman's comments, and I yield back to him.
I appreciate the gentleman yielding back. I would say one more thing. I've heard it said several times that we're being cruel to these children. I submit to my colleagues on the left that support this, it is cruel to allow these children to make this kind of life-changing decision that cannot be altered. That is cruelty. With that, I yield back.
Gentleman yields back. Chair yields to Mr. Ruiz from California, 5 minutes.
Thank you, Madam Chair. As a father, I would do anything to make sure that my girls know that they are accepted, safe, and loved. I would hope that my colleagues on both sides of the aisle would do the same. And as a physician, I have a moral obligation to do what is right and what is best for my patients. I also understand the sensitivity that goes into making a life-changing decision regarding a person's health. The attack on transgender children in the Children's Hospital GME Support Reauthorization Act isn't based in facts. It's based in fear-mongering, and it is now placing vital funding for our next generation of healthcare providers at risk. So let's talk about the facts. What Republicans are proposing would strip children and families of their right to equal access to healthcare that is currently responsible for saving lives. Second, this healthcare is supported by every major medical association and leading World Health Authority and is subject to rigorous standards of care. It is the same healthcare that is permitted for non-trans youth, and it has been proven for years to significantly reduce severe anxiety, depression, and suicide rates. My colleagues across the aisle insist that they are on the side of parents' rights, but they simultaneously attack families' rights to support their children in making informed decision with informed consent about their bodies with their health care providers. Not an easy conversation, not an easy situation when you have a child who has gender dysphoria, who has anxiety, who has fear, who is bullied, who is hated at school, victim of violence, and has a hard time reconciling their dysphoria, oftentimes leading to severe mental depression, locking themselves in rooms, being isolated from society, even cutting, even harming oneself, suicidal ideation, and taking their lives because they just can't handle the incongruency of their truth and their body's phenotype. In addition to targeting one of our most vulnerable communities, this legislation will strain an existing physician shortage with no scientific evidence. Truthfully, I am extremely disappointed that our legislative body is even discussing such a terrible piece of legislation today. The members on the other side of the aisle are taking cheap shots at innocent children who are mentally struggling, and the evidence shows have high rates of anxiety, depression, and suicide to score political points. Again, these arguments are not based on facts or science. They're driven by an obsession with bringing right-wing cultural wars into pediatric graduate medical education policy. As we face a critical pediatric provider shortage, Republicans are jeopardizing much-needed funding to train future generations of providers when it is most needed. I believe a true approach with compassion and love and understanding to get to know individuals who are struggling in families and listening to their stories and seeing the benefits and the reduction in suicide rates, anxiety, depression, would help America and Americans understand that we can work through this by doing what is best in reducing the anguish, the symptoms, and providing a better life for individuals. So let's instead talk about policies that help all Americans and pass legislation that makes life better for all children. Thank you, and I yield back.
Gentleman yields back. Chair recognizes Mr. Crenshaw for 5 minutes on the underlying bill.
Thank you, Madam Chair. I move to strike the last word.
Gentleman's recognized for 5 minutes. Strike last
All
word.
right, so this is the third time that we've discussed this. Our first time was during a hearing where the Democrat witness said that the evidence for the benefits of these kind of transitions, these affirmation transition surgeries and treatments, she said, quote, standards of care. Of course, that's a meaningless term if you don't have evidence to back why you created those standards in the first place. In the last hearing in the subcommittee, I was happy to hear at least a couple of studies cited that would confirm that position. Of course, I have the rebuttals to every single one of those studies. I've noticed that there's no more science being talked about. I've heard it explicitly said that they don't want to discuss the science, but we actually have to discuss the science. And when you establish standards of care, you have to do so through what is called systematic reviews. When you look at evidence-based medicine, systematic reviews are at the top of the hierarchy because it takes into account the way that these studies are done. It takes into account whether they're randomized, whether they're controlled, whether there's placebo effects, all of it. It takes that all into account, then it establishes those standards of care. And in every single systematic review, all 5 that have been done, they find little to no evidence that there's any benefit of this whatsoever. Now, that wouldn't matter so much if there weren't so much risk. But there is a lot of risk. There's a ton of risk when you give a 12-year-old puberty blockers, which 98% of which, by the way, move on to hormone therapy because those puberty blockers are like a gateway, and then on to surgical interventions. Telling me there's no risk there? There's a ton of risk. That doesn't even need to be debated. And if you're gonna do something that carries with it a lot of risk, then you might wanna really be sure about the benefits. I keep hearing that suicide, that this will prevent suicides. Zero evidence for that. There's not one systematic review that says that. Now, say the president of the Endocrine Society says it's true, but studies published by the Endocrine Society say there's no evidence to suggest that there's a causal relationship between less suicides and these kind of therapies. These facts matter quite a bit. It also matters quite a bit when you think about the fact that 70% of US teens who present to gender clinics already have comorbid psychiatric diagnoses that precede the onset of gender issues. That fact really matters when we're trying to ascertain what is causing what. I've been called cruel and indecent for promoting this legislation. That's insane. It's been said that Gerald Ford would never support this, would roll over at his grave as he looks at these terrible Republicans saying that 12-year-old girls shouldn't have double mastectomies or that little boys shouldn't be castrated. Yeah. Are we really the ones who have changed so much? I mean, really? I don't think so. I'll tell you what, back when Gerald Ford was president, there was no Democrats advocating for this kind of thing. This is a social contagion that has occurred just in the last 15 years. I don't think any of you believed in this before 15 years ago. This all happened very recently. This is a social contagion. It is a trend that has captured the imagination of some of our most prestigious society and the leaders of those societies, even though the evidence so clearly does not back it up. No, I don't like the fact that we have to do this through the GME funding. But tell you what, we are going to fund the GME program, just like everybody's worried about, we are going to fund it. And we're also going to say that when those residents get trained, they're going to be trained the correct way based on actual evidence-based medicine, not pseudoscience that is based on some social contagion trend. We've put a lot of evidence forward. I'll take on anybody who wants to talk about the studies or the systematic reviews. We'll talk about, actually, just after our last subcommittee hearing, Wall Street Journal published a letter from 21 leading pediatricians around the world talking about how this has to stop. They've stopped it in European countries. They've stopped it everywhere except here. The Dutch model that everybody likes to look to that says, look, this proves it works, the Dutch model, the Dutch will say their model is not the American affirmation model. There are doctors in America who say, look, we don't even ask questions. The child comes and presents as trans. We absolutely give them puberty blockers and hormone therapy. We put them on that path that you cannot come back from. You're going to say that's good science, that's good medicine? That's not good medicine. We have to press the pause button. That's all this bill is advocating for. In fact, all it does is remove taxpayer money from doing it when 70% of taxpayers don't agree that puberty blockers should be used on minors. That's all it does, and I yield back. Thank you.
Gentleman yields back. Chair recognizes Ranking Member Mr. Plone for 5 minutes.
Thank you, Madam Chair. I guess my problem is I don't believe that as members of Congress that we should substitute our judgment for that of the entire medical community, the community of transgender children, their parents, and those who care about them. You know, despite what my colleague just said, gender dysphoria is a documented medical condition that greatly impacts mental health. Studies, numerous studies, and I'm going to give you some of them, have shown that suicide among gender-diverse and transgender youth occurs at a rate of 4 to 5 times higher than their peers. But the evidence shows that this does not have to be the case. In fact, 20 peer-reviewed studies have examined the impact of gender health care for transgender adolescents, and this body of research indicates that medical treatments result in significantly improved mental health outcomes. Although my Republican colleagues have repeatedly alleged that this kind of treatment is not evidence-based, it's simply untrue. All the leading medical associations endorse gender-affirming care because scientific research shows it's effective and essential to the health and well-being of transgender youth. As our pediatrician witness told us during our legislative hearing, standards of care are developed based on substantial medical research and evidence, as well as decades of clinical practice. There's a 30-year history of providing treatment to transgender youth that has informed developed standards of care and protocols by the Endocrine Society, the World Professional Association for Transgender Health, and the American Academy of Pediatrics. And as I've said before, this treatment decreases the risk of depression and suicide in transgender youth. And I'd like to enter into the record research that shows that gender-affirming care among young people was associated with 60% lower odds of depression and 63% lower odds of suicidality. if I could, without objection.
Without objection, so ordered.
Thank you, Madam Chair. I'd also like to enter into the record today an amicus brief challenging the Georgia ban on providing transgender care to youth that is signed by over 20 medical associations, including the American Academy of Pediatrics, the American Academy of Adolescent and Child Psychiatry, the Association of American Medical Colleges, the American Academy of Family Physicians, the American Academy of Nursing, the American Academy of Obstetricians and Gynecologists, the American College of Physicians, and many more medical groups in opposition to the Georgia law and in support of providing evidence-based gender-affirming care to transgender youth. And if I could ask that that be entered into the record, Madam Chair.
Without objection, so ordered.
Thank you. And as these groups state clearly in their brief, and I quote, "The guidelines for treating gender dysphoria were developed through a robust and transparent process, employing the same scientific rigor that underpins other medical guidelines. Now, these guidelines are based on strict evidentiary requirements which have been reviewed, re-reviewed, and reviewed again by multiple independent groups of medical professionals. I just don't understand how some Republican members of Congress think that they know the scientific and medical evidence underlying the standards of care for transgender youth better than pediatricians and other medical professionals themselves. I don't believe that we as Congress people should substitute our judgment for that of the entire medical community and the community of transgender children, their parents, and those who care about them. The health care transgender youth receive, the decision about what to do, whether it's hormone therapy or whatever it is, this gender affirming care is a decision that I think that the transgender young person should be able to make in consultation with those who know them and their medical needs, their parents, the therapists, the doctors, not by members of Congress. And I just think the problem here is that Republicans are trying to force hospitals to choose between critical funding and providing evidence-based care. There's no reason why we should be putting doctors in children's hospitals in this position, and there's no reason why we should be denying transgender youth the care that they need. And I think that Representative Schreier is going to have an amendment that I support to make this a clean reauthorization of the children's GME program, rather than with all these contradictions that relate to transgender youth. And with that, I yield back, Madam Chair.
Gentleman yields back. Chair recognizes Mr. Allen for 5 minutes on the amendment, or on the bill.
Thank you, Madam Chairman. And, I feel insulted here today because of what I believe in. And I believe in the God of the Bible. And the reason that I can't support this, I'm being criticized for it, because I believe in the God of the Bible. And I'm going to tell you what the God of the Bible says about this. In Romans 1:28, furthermore, just as they did not think it worthwhile to retain the knowledge of God, so God gave them over to a depraved mind, emotional health issues. They have become filled with every kind of wickedness, evil, greed, and depravity. They are full of envy, murder, strife, deceit, and malice. They are gossips, slanderers, God-haters, insolent, arrogant, and boastful. They invent ways of doing evil. They disobey their parents. They have no understanding, no fidelity, no love, no mercy. Furthermore, Jesus said in Matthew 18:2-6, truly I tell you, unless you change and become like little children, you will never enter the kingdom of heaven. Therefore, whoever takes the lowly position of this child is the greatest in the kingdom of heaven. And if anyone causes one of these little ones, those who believe in me, to stumble, it would be better for them to have a large millstone hung around their neck and to be drowned in the depths of the sea. That is why I am against this. Don't criticize me for my values or the Republican Party for its values, because I believe in this. I will not criticize, I'm not criticizing you for your values. That is why I'm taking my position on this, because I believe in the God of the Bible. And obviously, the subject of God came up earlier. And with that, I yield back.
Would the gentleman yield? Would the gentleman yield? Oh, yield it back.
Yes, I
Okay,
yield.
Okay, yielded back. Gentleman yielded back. Chair recognizes Ms. Schakowsky for 5 minutes on the underlying bill.
I'm really happy to join this conversation on behalf of my transgender grandson and Lurie's Children's Hospital, which is certainly the most prestigious and largest in the city of Chicago and one of the greatest in the nation that provides training for pediatricians and also does provide gender-affirming care for people. And I'm certainly hoping that the truth is that we're going to continue to make sure that we are funding these children's hospitals the way that we should, and Lurie as well. Gender dysphoria is a real thing, and it is a problem that needs to be treated, and the so-called facts that we heard before, absolutely not verified by the medical community in any way. And I think it's really important to note, too, that before they are 18 years old, surgery is not an issue. What we are talking about is medication and mental treatment for patients that absolutely are risk for suicide. There's no question. The pain that can be found in children that with their parents, and that's the other thing, somehow this idea that this is done without parental involvement at Lurie Children's Hospital, which does do this care, it is never done without the involvement of the parent, that somehow little children are making decisions, lifetime decisions, without any adult supervision is absolutely crazy. And so I just want to say that this is, of course, a painful issue for me because I have a grandson who is thriving, who is living his best life, who is happy and healthy and being the person that he wants to be, deserves to be, and got the help that he should get. And so I'm just so angry, really, that people who don't know what they're talking about, and I was at that hearing when a woman who is not a doctor was on the panel giving a lot of disinformation and not factual information about the expertise that we know at Lurie Children's Hospital, that we know from doctors all over the country who understand that they are treating people who need the help. And so, obviously, we don't want to take anything away from children's hospitals, but we also don't want to take away anything from children who need the help, who are getting the help from the clinicians, from the doctors who really know what they're doing. Their bodies are not being mutilated in any way. They are not allowed to make decisions like that. They are working with their families. They are working with the experts. And I did check with the expert at Lurie Children's Hospital. A lot was said about what these countries around the world are doing was also misinformation. They may be adjusting some of the procedures that they use. They are continuing to do gender care, and that's what we should be doing. I'm really resenting what I'm hearing from across the aisle, misinformation that had you been in place when my grandchild was needing the help, that would not have gotten it. That is the wrong thing to do. I yield back.
Okay. gentlelady yields back, I do want to clarify. I believe the lady that was just referenced is a doctor, Dr. Grossman. She's practiced for decades and has worked with a lot of youth through those years. Further discussion? Chair yields to the gentleman from Texas, Mr. Pfluger, for 5 minutes.
Thank you, Madam Chair. Obviously, this is a emotional topic. I think it's probably uncomfortable. It's maybe misunderstood. I mean, I can't imagine how difficult it is for those individuals that are thinking about this. I don't think anybody, just to frame this debate, nobody's saying that gender dysphoria is not real. I don't think anybody has said that in this particular debate. I think the question that needs to be asked here is about the well-being, not just of a child. It starts with a child. It obviously has to be the well-being of a child, but it's the well-being of that individual who will live in that body for the rest of their lives. They will carry that body with them for the rest of their lives. Not the parent, not the doctors or the educators, but it's going to be that person. And so I would like to ask the question, I want to pose this question to my colleagues on the other side of the aisle. What other life-altering, irrevocable decisions do we as parents or we as the government allow children to make? Irrevocable decisions. What other life-altering, irrevocable decisions? If we're talking about science, can we agree that a child's, and I'm sorry, can we get order?
Yes,
With
yes,
the gentleman yield, I have an example.
the gentleman will yield, committee will come to order. Mr. Pfluger controls the time.
Thank you. Let's look at the science of a child's brain that is not fully developed until they're in their 20s. And some studies would argue that it's not just mid-20s, it's actually late 20s. So for those who have suggested that the Republican Party is somehow different or has changed or is crazy because we are not letting children, don't want to let children, would never advocate for children to make a life-altering, irrevocable decision when their brains haven't even developed. That's crazy.
Will my good friend yield?
No, not yet. That's the crazy part. I think it's this side of the aisle that's standing in the gap, protecting those children. We're the ones standing in the gap for those children. Most parents won't even let their kids get a tattoo before they're 18. So I think it's crazy to suggest that a child has that capacity. At
my good
18
friend
years
yield?
old, if they want to do that, fine. This debate centers around actually standing in the gap, revocable decision, that you do so with your own cognitive ability at a time and place when you can live with those consequences. And to be told by educators or doctors and anybody else that says that you should be doing that, that's what I have a problem with. That is the issue that I think this side of the aisle has a problem with. And I agree with my colleague from Georgia, Mr. Allen, on a spiritual level, completely agree with the arguments that I heard that that our beliefs are being attacked by society saying, well, that's not normal and you need to cave in your beliefs. No, I'm not going to cave in my beliefs. So on a spiritual level, thank you, Mr. Allen, for talking about what the Bible says. And I've got 10 seconds left, so I'll yield to, you've got 6 seconds.
My good friend, children do not make decisions. It's their parental guardian informed consent. And there are some difficult decisions made by them to resect, like things like brain cancer that
My
can
time has
permanently
expired. I'm
affect
sorry,
them.
Mr. Ruiz. I yield back.
Gentleman yields back. Chair recognizes Mr. Peters for 5 minutes.
I don't want to take that long. I just want to say we're talking past each other. We're arguing very from our own perspective about whether a certain procedure would be a good thing or a bad thing. And I totally respect the values that have been expressed on the other side. I express the values that Ms. Schakowsky expressed about her own kid. She wants to people want to do the right thing for their family. Where I'm humble is that I don't think the government should be making that decision for families. I think that is a very, very difficult thing to face. Can you imagine having to face something like, I can't. I didn't ever have this raising my kids. I had nothing like this challenge. But if I had this challenge, I would want to be able to talk to doctors, and I would want to be able to talk to my kid, and I would want to be able to make that decision as I saw was in the best interest of my children. And I just don't understand why we so appreciate the freedom that Americans have, the ability to do the right thing, the ability to do without government getting involved in their actions, why we would substitute our own judgment for that of parents, the ones who love the child the most. And as Dr. Ruiz pointed out, you can't sign a consent, informed consent for surgery. If you're a minor, you can't. This has to be signed by a parent. So I totally appreciate where Mr. Allen is. I think in his family, he would make a different decision than maybe was made in a family, Ms. Schakowsky's family. But that's not our job to decide. Our job is to support families in their freedom and their ability to raise their kids as best they see, because I don't think that's the government job. And I will be opposing this, and I will yield back.
Gentleman yields back. Further discussion? Chair recognizes Mr. Palmer for 5 minutes.
Well, first of all, I don't think the research is conclusive on outcomes for individuals who go through transgender surgeries or other transition treatments. I do look into the research, and what I found is here's a study by the Birmingham University's Aggressive Research Intelligence Facility, and that's Birmingham, England, which conducts reviews of healthcare treatments for the National Health Service, concludes that none of the studies provides conclusive evidence that gender reassignment is beneficial for patients. So I hear all this conversation about how this impacts people, but I think the truth of the matter is that we don't know for sure. And there's growing evidence that people who go through sex reassignment procedures suffer serious side effects later on in life that lead to psychological problems, substance use problems, suicide, and other health issues. So it's really dismaying, Madam Chairman, to hear my colleagues on the other side to speak so definitively about the positive attributes of something that the research is not conclusive on. And I think we're going down a very, very dangerous path. And to hear people say that it's only with parental consent, when in fact, as my colleague from Arizona pointed out, certain states are moving toward taking children out of a parent's home because they refuse to allow that. That's unconscionable. That's what was said. Yes, that's what's being considered.
Well, the gentleman yield, where is that they're making laws like that?
Washington.
California and Washington.
Washington State.
The home state of the chairwoman. So I just want to make it clear. The committee's not in order. Committee's not in order.
Oh. Gentleman will yield. Committee will come to order. Mr. Palmer controls the time.
There are other studies that indicate there are problems with this that are extremely severe. And then I just want to say this in regard to where we are in this Congress and this culture. With all due respect to my colleagues, I think this is just one of many issues that distinguishes between the values of the Republican Party and the values of the Democratic Party. I want to make it clear that we as Republicans stand with parents. We stand with those who are willing to stand up against any attempt to impose values that are in violation of the parents' values on their kids, whether it's in education or such as this issue. Republicans are not the ones who are sending the FBI out to school board meetings to surveil parents who are standing up for their kids against the curriculum or other school policies that violate their values. And I just want the American people who are watching this, who are listening to this debate, to understand there is a clear difference. And if they have any questions about where the Republican stands, let it be made absolutely positively clear. We stand with the parents. I yield back.
Gentleman yields back. Further discussion? Dr. Schreier is recognized for 5 minutes.
Thank you, Madam Chair. I'll be brief. I am a pediatrician. I trained at Lucille Packard Children's Hospital in Representative Eshu's district. I am so offended. I've been listening to this conversation for probably an hour. This vilification of pediatricians. Are you forgetting who you're talking about? These are the people who take care of your children. This insinuation that pediatricians don't work with parents, which is what we do 24/7. This insinuation that pediatricians are somehow reckless with the children that they take care of. And I find it just highly offensive. And frankly, I'm sure that your pediatricians who take care of your children or grandchildren are pretty offended too. And then I would take that a level higher and just say that I'm horrified that these kinds of comments, this rhetoric that we're hearing, has resulted in threats to children's hospitals. Can you imagine? And then I'm adding this all up and I'm hearing so many of my colleagues saying, I don't know, I don't understand. And that is exactly why politicians should not be inserting themselves into this medical decision-making. It is why we have doctors trained, and it is exactly why I will be introducing an amendment shortly to clean up this bill, to have a clean authorization, and to make sure that our children's hospitals get funding. Thank you.
Will the gentlelady yield?
Yield to Andrew Craig, my colleague.
Thank you for yielding. You know, a few speakers ago, my colleague said that we are so far removed. And you know who isn't removed? It's the multidisciplinary group of physicians, the psychiatrists, the psychologists, the parents of trans youth, the medical associations. And I understand that my colleagues across the aisle don't like the medical guidelines and the standards of care in the United States right now. I get it. But as one of my colleagues said just a moment ago, this is not something that a set of politicians should be deciding. You know, we're removed for a reason because the parents of trans youth and their physicians are in the best position to understand individual circumstances. When we start legislating from Washington, that is not a value that constituents in my district appreciate. You know, my colleagues, I'm sitting here and I'm listening to you, and I'm thinking about the fact that some of you will have a son or a daughter or a grandchild who is transgender. Not one of you in this room would want any one of us to make a health care decision for your family. That is what you are talking about here. This provision should not be anywhere in this GME funding bill, and I appreciate the values and my colleagues. I love working with you, but this is a culture war that you do not understand. I would bet money most of you have never talked to the parent of a trans youth, and I appreciate that what you don't understand, you probably ought to try not to legislate. And I yield back.
The gentlewoman yield.
I will yield to Nanette Barragan.
Thank you. Madam Chair, I'd like to introduce into the record an article by Dr. Jack Turbin. It's called The Evidence for Trans Youth Gender Affirming Medical Care. This,
Yeah, without objection, so ordered.
so this is an article, since people want to talk about evidence and studies, this is an article that goes through 16 studies to date that have examined the impact of gender-affirming medical care for transgender youth. It says that existing evidence suggests that gender-affirming medical care results in favorable mental health outcomes. And it reminds us that all major medical organizations oppose legislation that would ban gender-affirming medical care for transgender adolescents, from the American Medical Association, the American Academy of Pediatrics, and the American Psychiatric Association. So I just want to make sure this is in the record. And, you know, we heard about values, and Republicans claim they are the party that protects children. This is the same party that's directing Texas state troopers to push migrant children back into the Rio Grande River to drown. Republicans should be ashamed. I yield back.
Ask for time, give me time.
Yield back.
Okay, gentlelady yields back. Chair recognizes gentleman, Mr. Hudson, for 5 minutes.
I thank the chair, and I yield to the gentleman from Indiana, Dr. Bouchon. Thanks to the gentleman for yielding. I think we're talking past each other somewhat. I mean, at least from my medical perspective, you know, I mean, gender dysphoria exists. Children need treated. The question is do we, as a society, support permanently altering children's genitals surgically to confirm where the sex that they believe they are, and they genuinely believe they are? Or do we block prepubescent children from going through puberty with permanent puberty blockers that may result in them not being able to have children in their lives? I don't think, I mean, I'll speak for myself. I'm not saying people don't, gender dysphoria children don't need treated. I think that's being assumed, but they do. So you know, I have a great deal of respect for my colleagues, including Dr. Schreier. I'd like maybe ask Dr. Schreier a question. Does she support permanent surgical changes to people under 18, or does she support permanently altering people's ability to may potentially have children by blocking puberty, which is not reversible? I mean, those are two questions I have for Dr. Schreier. And so with all due respect, I mean, because that's what we're talking about here. People should go on the record and say, yes, I support that, or no, I don't. Under 18, for people under the age of 18. That's the question I have. And I'll certainly yield if Dr. Schreier is willing to talk about it. If not, then I'll yield back to Mr. Hudson.
Thank the gentleman. I'd like to yield to the gentleman from Texas, Mr. Crenshaw.
Only be a minute. The Turbin study was mentioned and provided for the record, so I'll just tell everyone what's actually in that study. It has severe selection bias. It's based on a survey in 2015. In order to be eligible to participate in that survey, respondents had to identify currently as transgender or gender diverse. So that means that anyone who used to identify that way was automatically excluded. That means people who regret that transition are detransitioners, by definition excluded from the study. And look, most of these studies, by the way, are on adults, not children. There's almost no evidence for any of the benefits here on actual children. Most of these studies that are being cited are for adults. None of them are randomized control trials. They don't account for placebo. There's no ability to separate results from other elements of the care routine, such as psychotherapy. And correct a couple other just complete lies that were said earlier. This bill does not prevent psychotherapy or the compassionate kind of therapies that are indeed needed for people who have gender dysphoria. We do not deny the existence of gender dysphoria, but we should be following the science here and the science that our peer countries are following, which says that you should not immediately affirm gender and start them on irreversible hormone therapies or puberty blockers. And you say, well, that's not happening. But look, we have quotes from the head of Boston Children's saying they're handing out puberty blockers like candy. That's just a direct quote. So we're not fighting some imaginary ghost here. We're fighting something that's really happening. You can't deny it's really happening. And any other studies that you want to bring up, I'll be happy to rebut. And I yield back to my friend, Mr. Hudson.
I yield back my time.
Hey, wait, the gentleman yield, Mr. Hudson?
I'll be happy to yield, gentleman from Texas.
Isn't it kind of ironic? We worked in this committee to protect our children from TikTok, but not this. I yield back.
I yield back.
Gentleman yields back. Chair recognizes Ms. Trahan for 5 minutes.
I have amendments.
Is there any other discussion on the underlying bill? Chair recognizes Ms. Fletcher for 5 minutes.
Thank you, Madam Chair, and I'll be brief. One of the things I've learned in my time in Congress is that you can use a quick shorthand to say I'd like to associate myself with the comments of other speakers, and I will do that here to keep my comments brief. And I do want to associate myself with the comments of my Democratic colleagues, in particular Mr. Pallone, Dr. Schreier, and Dr. Ruiz, as well as Representative Craig, and all of my colleagues made excellent points. And I think it's really important that we understand that there are a couple of things that have been said throughout this debate that I've listened and I've made notes, and I can't possibly respond to everything, but I think that there's a real problem here because a lot of this discussion is based on a false premise about what is happening. There have been a lot of discussions about surgery and decisions made by children. I think that our colleagues have made clear that these are decisions that are made for anyone under 18 with parents and with physicians. And I think what some of my colleagues have expressed is that it is unusual to hear our colleagues on the other side of the aisle. And the reason it feels so out of sync is having them talking about replacing the judgment of parents and doctors, healthcare providers, with the judgment of the federal government, with the judgment of those of us sitting here that don't know any of the specifics of the situation, that don't know any of the particular facts in that matter. And it's the kind of thing that we're used to hearing them say they don't support. And so I think that that's why there's so much confusion here, because you're seeing this response to something that is, as we've heard from our colleagues, as we've heard, I'm not on the subcommittee, but in testimony about the incredible complexity and of these decisions. And I know from personal experience with constituents and friends, the incredibly challenging situation of parents trying to do the right thing for their kids. And we're talking about replacing their judgment with the judgment of the people sitting in this room who, as Ms. Craig pointed out, have said they don't know everything about it. So why are we trying to take this decision from physicians and parents who are trying to provide the best possible care with this incredibly blunt instrument that is incredibly punitive and is going to affect the training of future physicians? So I think that, the points that have been made, I won't reiterate all of them, but I do want to respond to one thing that my colleague, Mr. Crenshaw, mentioned, because I wrote it down. It really struck me, and I want to say, it deeply offends me that he described what we're talking about now as a social contagion. This is not a contagion. These are our constituents. These are people who live in my district. These are people who live in our shared beloved home state of Texas who are thinking about moving because they don't think it's safe for their families and their children. These are our constituents, all of our constituents, and we should be approaching the conversation about their needs and their rights in a way that is constructive and not referring to our constituents as contagions.
Will the
it just-
gentlelady yield so I can explain that, and I'll give you all the data to support it?
I will finish my statement because I think what is important here is that we are here to protect the rights of our constituent and the freedoms of our constituents. That is exactly what we are talking about doing on this side of the aisle, and it's something I wish that everyone in here would support. We need to support the rights and freedoms of Americans, of all Americans, including transgender kids and their families. And with that, I yield back.
Gentlelady yields back. Chair yields 5 minutes to the gentleman from Georgia, Mr. Carter.
Thank you, Madam Chair, and I'm going to yield to the gentleman from Texas, Representative Crenshaw.
Thank you to the gentleman. All right, let's talk about why I call this a social contagion, because it's recent and it's a trend, and we have all the data to support it. Look, I haven't insulted anybody today. I've been insulted many times, told that I'm offensive, that I'm cruel, that we have no compassion for children. I'm not. I'm just reciting data. I'm just reciting data. Nobody has once addressed the fact that our data relies on 5 systematic reviews, which is the gold standard of any kind of evidence-based care. That's what we're relying on when we make this decision about whether this is good or bad. All right, but let's talk about why it's a social contagion. Look, just in the UK, referrals went up by a factor of 33 between 2009 and 2018. There was one pediatric gender clinic that did this kind of affirming care in 2007 in the US. Now there's over 70. The rate of diagnosis increased by 20% each year between 2017 and 2020, then shot up 70% between 2020 and 2021. These are real numbers, folks. Prescriptions for both puberty blockers and cross-sex hormones went up by at least 220% between 2017 and 2021. And that's probably an underestimate. This is a study by Reuters, and it's a significant undercount because they're only able to look at insurance claims. Surgeries, both double mastectomies and genital surgeries, have also increased significantly in recent years. Reuters documented 56 genital surgeries in patients between 13 to 17 between 2019 and 2021 alone. None of this was happening before. So what's the difference? And why is there other studies that show that you're far more likely to identify as transgender if your peers do so? To say that it's not socially based, to say that it's not based in what your peers are doing, would be refuting the evidence entirely. That's why I say that. It's not offensive, it's a fact. All of the data supports it, all of the numbers support it. So why do older generations not have these same numbers? Why? Could it be that because they didn't have access to all the social media and all of that peer pressure and this new trend? Why is it that, years ago we thought that frontal lobotomies were okay, or electroshock therapy was okay? All the scientific consensus thought that was okay too. Sometimes it's just wrong. In this case, the scientific consensus already says it's wrong. I want a Democrat colleague to please refute all of these systematic reviews. Tell me why they're wrong. I tell you why each one of your studies that you present is wrong, because I've looked at it before you did. I know them better than you do. So let's have that debate. Let's actually debate the science. Don't make this about emotion. Because you know what? That emotional hit, that'll happen to that kid when this happens to them when they're 12 and they transition and they're 25 or 30 or 35 and they can't have kids anymore. What's their emotional state going to be then? How are we not thinking about that? And how are we the cruel ones for even bringing it up? I yield back to my colleague from Georgia.
Will the gentleman yield?
Yield to the gentleman from Virginia.
Would the gentleman from Texas yield for a question? That Texas. Mr. Crenshaw.
Yeah, okay.
So I was just wondering if you were aware that last week the AP reported that, and I quote, the National Health Service said Friday, talking about UK, National Health Service said Friday that outside of research setting, puberty suppressing hormones should not be routinely commissioned for children and adolescents.
I was aware. I'm aware that from Finland to Sweden, United Kingdom, Norway, Belgium, Switzerland, France, this consensus is growing. I'll read a quote here. Every systematic review of evidence to date, including one published in the Journal of the Endocrine Society, has found the evidence for mental health benefits of hormonal interventions for minors to be of low or very low certainty. By contrast, the risks are significant and include sterility, lifelong dependence on medication, and the anguish of regret. For this reason, more and more European countries and the international professional organizations now recommend psychotherapy rather than hormones and surgery as the first line of treatment for gender dysphoric youth. And a key difference is that in the United States, immediate affirmation models are being used. As the head of Boston Children's affirms for us, they're handing out puberty blockers like candy. And yes, I understand that parents have that are there. We never said they weren't. Right? Don't debate points we aren't making. Okay, but the parents are being informed by people who are being misinformed. Like the science is the science, the data is the data. I yield back.
I yield back.
Madam Chair, I yield back.
Gentleman yields back. Further discussion? Are there any amendments? Ms. Trahan is recognized for 5 minutes. For what purpose does she?
Madam Chair, I have an amendment at the desk.
Clerk will report the amendment.
Amendment to H.R. 3887, offered by Ms. Trahan of Massachusetts. Strike page 3,
Without
lines.
objection, the reading of the amendment is dispensed with. The lady is recognized for 5 minutes to speak in support of her amendment.
Thank you, Madam Chairwoman. This amendment is straightforward. Instead of misrepresenting what gender-affirming care is while simultaneously attacking a group of vulnerable children and pediatric specialists, this proposal acknowledges the remarkable work being done at 59 children's hospitals across our country with teaching programs by doubling funding for the CHGME program. Currently, those 59 hospitals represent 1% of all hospitals in the country, but together, they train more than half of all pediatricians and pediatric specialists across our nation. Boston Children's Hospital in my home state is home to one of those training programs. In fact, the training program at Boston Children's receives no funding through Medicare and relies solely on CHGME to support their work with interns, residents, and fellows. Our children's hospitals have gone through almost more than they can bear after 3 years of responding to a tripledemic and a rapidly growing youth mental health crisis. Like so many hospitals, they've struggled to keep and recruit frontline healthcare workers. But unlike other healthcare facilities, children's hospitals are facing disproportionate levels of hate, harassment, and threats due to the embrace of rhetoric included in this legislation surrounding gender-affirming care. This vitriol, which is being exploited for political gain, only works to deter future healthcare professionals from entering the pediatric specialty for fear of violent threats and attacks. I want to remind my Republican colleagues of the kind of healthcare they are putting at risk while treating our pediatric workforce like they are pawns in a political game. Pediatric providers are training, learning, and making contributions to advance high quality and effective care that every single one of us would want for our own child if it was ever needed. The team at Boston Children's works around the clock to serve the children who travel from all over the country for specialized care. Esophageal atresia, or EA, is a birth defect that occurs when a baby is born without part of the esophagus. Until recently, there was no satisfactory treatment option for a child with long gap EA. Dr. John Foker personally trained the medical team at Boston Children's Hospital to perform his innovative and life-altering EA repair known as Foker process. Boston Children's surgeons have been working since 2009 to perfect this surgical technique, and children who receive this treatment in Boston show fewer hospitalization days, less time on ventilators, and more success eating. When we talk about prohibiting funds from going to our nation's children's hospital, we are talking about restricting access to this type of life-saving and life-improving care. This committee should be increasing access to health care for all children and supporting our pediatric workforce. By doubling funding for the CHGME program, my amendment does just that. Both Republicans and Democrats on this committee have had daunting conversations with our nation's children's hospitals, pleading for the resources they need to deliver care to our children. I strongly urge my colleagues to support my amendment so that we can answer those urgent requests for help, and I yield back the balance of my time.
Gentlelady yields back. Anyone seeking recognition to discuss it on the further discussion of the amendment? Anybody seeking recognition? Anybody seeking recognition? Seeing none? Recorded votes, okay. Let me look at the Seeing none, oh, it's right, oh, I'm sorry. Where's the script for what Okay. A recorded vote has been requested on the amendment. All in favor will vote aye, all those will vote no, and the clerk will call the roll.
Burgess. Burgess votes no. Latta votes no. Guthrie votes no. Griffith votes no. Bilirakis votes no. Johnson votes no. Bouchon votes no. Hudson votes no. Wahlberg votes no. Carter votes no. Duncan votes no. Palmer votes no. Dunn votes no. Curtis votes no. Lesko. Pence votes no. Crenshaw votes no. Joyce. Armstrong votes no. Weber votes no. Allen votes no. Balderson votes no. Fulcher votes no. Pfluger votes no. Harshbarger votes no. Miller Meeks. Kamek. Obernolte votes no. Pallone votes aye. Eshu votes aye. DeGette votes aye. Schikowsky votes aye. Matsui votes aye. Castor. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark votes aye. Cardenas. Ruiz. Peters. Dingell votes aye. Veazey votes aye. Custer votes aye. Kelly votes aye. Barragan votes aye. Blunt Rochester votes aye. Soto votes aye. Craig. Schreier votes aye. Trahan votes aye. Fletcher votes aye. Chair Rogers votes no. Mr. Cardenas is not recorded. Mr. Cardenas votes aye. Yes, sir. Ms. Lesko is not recorded. Ms. Lesko. Mr. Joyce is not recorded. Ms. Miller Meeks is not recorded. Ms. Craig votes aye. Ms. Castor votes aye. Mr. Ruiz is not recorded. Mr. Ruiz votes aye. Ms. Kamek is not recorded. Ms. Kamek votes no.
Anyone else here? Anyone? The clerk will report.
Chair Rogers, on that vote, there were 22 ayes and 26 noes.
The amendment is not agreed to. Are there further amendments? Chair recognizes Ms. Schreier for 5 minutes.
Thank you, Madam Chair. I have an amendment at the desk.
Clerk will report.
Amendment to H.R. 3887, offered by Ms. Schreier of Washington. Strike page 2, line 11, through page 3.
Without objection, the reading of the amendment is dispensed with. Gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Madam Chair. I'm offering this amendment today because as a pediatrician, I know quite personally the importance of Children's Hospital GME funding. CHGME funds the residency and fellowship programs that train medical school graduates to become pediatricians and pediatric subspecialists. Earlier, I was really struck when the ranking member in an issue spoke so eloquently about the Children's Hospital GME program and the historic, enthusiastic support from members of Congress in both parties. In fact, since its inception in 1999, this has been reauthorized on a bipartisan basis 5 times. And the impact is so clear. We have more pediatricians. Now, right now, we're facing a shortage of pediatricians, and that's happening at a time of increased need, particularly in the realm of mental health. And it's unimaginable to me that we would put forward.
Lady will suspend. Committee will come to order. Okay, Ms. Schreier controls the time.
Thank you, Madam Chair. It's unimaginable to me until today that this committee would put forward a bill meant to fund Children's Hospital that we could not all agree on. Hospitals depend on these funds in order to train pediatricians for tomorrow. It needs to be reauthorized cleanly, as it always has been, without partisan preconditions or attempts to score political points. The Children's Hospital Association has requested a clean authorization. We need a reauthorization that will pass both chambers of Congress and get signed by the President, and the bill we have in front of us today will not do that. My amendment strikes the parts of this legislation that the author inserted to dictate how physicians practice medicine, because that's inappropriate and dangerous, and it puts the training of the next generation of pediatricians at risk. This amendment is the customary, clean reauthorization that has passed before, 5 times before, and that can pass again. These politically charged elements inserted into the bill threaten funding to Children's Hospital, and that's something none of us should be all right with. I encourage my colleagues to vote yes on this amendment, and I yield back.
Gentlelady yields back. Further discussion? Chair recognizes Mr. Burgess for 5 minutes on the amendment.
Thank you, Madam Chair, and I appreciate what Dr. Schreier is trying to do, but as a practical matter, if there were a way for you to move a clean bill to the floor of the House, it simply will not pass. In the past, Children's GME has passed under suspension, but this bill would not pass under suspension. Your bill would not pass under suspension. So of necessity, it would come to the Rules Committee. And if you think the treatment at the Rules Committee will be any less circumspect than what has been going on here today, you're sadly mistaken. This bill will not pass the floor of the House as you have constructed it. And by bringing that bill to the floor of the House, you will have jeopardized the fundings for Children's GME. What Mr. Crenshaw has done is brought a bill forward that would be able to get the votes to pass in the House of Representatives. We all know we got to deal with the Senate. We all know we got to deal with the White House. But the first step is getting it to pass in the House. Mr. Crenshaw has delivered us a product that will do that. I don't think there's any way that a clean bill, a clean reauth, will survive on the floor of the House. And I know the fight in the Rules Committee would be intense. So while I appreciate what you are attempting to do here today, in fact, what you would achieve would be exactly the opposite of what you intend to do. Thank you, Madam Chair. I'll yield back.
Gentleman yields back. Further discussion on the amendment? Chair recognizes Mr. Sarbanes for 5 minutes on the amendment.
I just want to thank Dr. Burgess for pulling the curtain back, and I yield back my time.
Further discussion? Chair recognizes Ms. Kamick for 5 minutes on the amendment.
Thank you, Madam Chairwoman. I am so grateful to my colleagues, Representative Crenshaw for his leadership on this bill, and all of my colleagues here who are supporting funding for our children's hospitals. I want to reiterate again that nothing in this bill would prohibit a child with gender dysphoria from receiving proper mental and behavioral health care services. The underlying text is limited to experimental medical intervention, specifically using puberty blockers, hormone therapies, and surgeries to change a child's gender. And it was mentioned several times from my colleagues on the other side of the aisle that we don't understand this process. And so for the sake of clarity, really, I'd like to show a video, a brief interview that was conducted by an expert in gender reassignment surgeries from Oregon's healthcare system.
Madam Chair.
Madam Chair.
I object. I move that the committee adjourn. This has turned into a circus. I move that the committee be adjourned.
It's official. It's official testimony. I'm
Madam Chair, can I just ask,
Madam
rather
Chair, without
than
objection, I
object-
would like to. I
Okay,
would like to play this
committee
video.
will come to order.
I was
Motion
gonna,
to adjourn is not debatable, right? So I have to ask. Okay, so Ms. Kamick
Madam
controls
Chair.
the time. She gets her 5 minutes, and then we'll move to
Madam
the
Chair.
vote on the motion
Madam
to
Chair.
adjourn.
We don't want to
Thank
be
you,
held
Madam Chair.
hostage
Sorry,
by
Rhea-
whatever it
Rhea,
is that you
excuse
guys
me,
are.
Claiming my
Committee
time.
will come to order.
So
Ms.
you'll
Kamick
have your
controls
votes.
the time. Ms. Kamick controls the time.
Thank you, Madam Chairman, Chairwoman. Without objection, I would like to.
I
play this
object.
video.
there's an
I
objection.
object. We have no foundation or basis for this video. We haven't seen it, and
It's
I
a
object.
medical expert from your side.
I object.
If we don't as you claim, if we do not understand how this surgeries work, I would like to show a video that articulates how these surgeries are conducted. I think that is completely germane to the conversation that we are having here today.
Okay, just, excuse me. Lady will suspend. Committee will come to order. Okay, so Ms. Kamick gets to finish her 5 minutes, and then we will proceed.
Thank you. Please play the video.
You objected to the video.
It's an interview.
Okay. Committee stands at recess while the minority gets to look at the video.
I want to look at the video.
2 minutes and 17 seconds.
Oh, 5 minutes.
They have to.
Say that I insist on my objection. You want me to do that, or you're just going to rule?
Okay, committee will come to order. Committee will come to order. Ms. Kamick had asked unanimous consent for the committee to watch the video. There was an objection. I'm going to yield now to Mr. Pallone for the purposes of his objection.
I have looked at the video, but I insist on my objection because I have to be honest, I don't even understand what the person is saying. It's all, to me, it's just almost impossible for us to understand what he's saying and how it relates to what we're discussing here. Even the authentication is difficult, so I insist on the objection, Madam Chair.
Instead of a unanimous consent, the committee, I'm going to ask then that the committee vote as to whether or not to see the video. All those in favor say aye. Aye. Those opposed, nay. No. The ayes have it.
Recorded vote, Madam Chair.
Yes, for a recorded vote. A recorded vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Johnson. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. Pallone. Pallone votes no. Eshu. Eshu votes no. DeGette. DeGette votes no. Schakowsky. Matsui. Matsui votes no. Castor. Castor votes no. Sarbanes. Sarbanes votes no. Tonko.
No.
Tonko votes no. Clark. Cardenas. Cardenas votes no. Ruiz. Ruiz votes no. Peters. Dingell. Dingell votes no. Veazey. Custer. Custer votes no. Kelly. Kelly votes no. Barragan. Blount Rochester. Blount Rochester votes no. Soto. Soto votes no. Craig. Craig votes no. Schreier. Schreier votes no. Trahan. Trahan votes no. Fletcher. Fletcher votes no. Chair Rogers. Chair Rogers votes aye.
Then recorded.
Mr. Johnson is not recorded. Johnson votes aye.
The clerk will report the vote.
Chair Rogers, on that vote, there are 26 ayes and 18 noes.
The ayes have it. We will watch the video. Okay.
So 80% or so of my practice is gender affirming surgery. So I do facial, chest surgery, and genital surgery. But the majority of my practice and sort of where my passion lies is really genital surgery cases. So I do a lot of vaginoplasty and a lot of phalloplasty. I would just say they're expanding in either direction. So yeah, a lot of adolescents presenting for surgical intervention, but also a lot of people that are like in their 70s sometimes coming in for genital surgery, and then everything in between. But the adolescents for sure present some unique challenges. Obviously, there's great evidence supporting pubertal suppression for a whole variety of benefits. But the one thing that is very new is genital surgery in someone that has underwent pubertal suppression. Not so much an issue in someone with assigned female at birth anatomy that undergoes a phalloplasty, because we're creating something with a free tissue transfer or a flap anyway, but a much bigger issue for an individual that's undergoing a penile inversion vaginoplasty. Because we use all of that tissue to basically create the vulva as well as line the internal vaginal canal. And as a specialty, those of us that do a fairly high volume of genital gender affirming surgery, we've maybe done a handful of pubertally suppressed adolescents as a field, and no one's published on it yet. OHSU we're just putting our first series together as we're kind of learning and figuring out what works. But it's really changing things because you don't have enough tissue to line the vaginal canal. So you either have to take a skin graft or take skin from elsewhere or use some artificial product. The way that we're dealing with it is by using a robot, and we're basically performing intra-abdominal components of the surgery. So we're using peritoneum, which is the inner lining of the abdomen, to line most of the vaginal canal. And by doing that, that allows us to use all of the remaining tissue externally to create a vulva and try to make also an aesthetic result.
So what we just witnessed was an interview last week from Dr. Blair Peters, who is a gender affirming surgery expert at the University of Oregon's Health and Science Division. Earlier today, just a few minutes ago, our colleagues on the left said that we didn't know what we were talking about. So when presented with a video that details exactly what it means to conduct surgery on a minor for gender affirming surgery, they left the room. They don't want the facts. And as you heard from the specialist who does these surgeries, they don't know what they don't know. They don't understand the long-term effects. There is not even published information, peer-reviewed information backing up the claims that our colleagues on the left have said. We are here today to fund children's hospitals, not to mutilate them with experimental surgeries that we do not have science and data that backs up the claims that the left has made today. So I stand with my colleagues in funding these children's hospitals, but I also am very disappointed in my colleagues on the left who opted to leave the room in protest and refuse to watch a video from an expert on their own side. With that, Madam Chairwoman, I thank you for allowing me to show this video, and I yield back.
Gentlelady yields back. Further discussion on the amendment? Seeing none, the vote occurs on the Schreier amendment. All those in favor say aye. Aye. Those opposed, nay. Nays have it. A recorded vote has been requested. The clerk will call the roll.
Burgess votes no. Latta votes no. Guthrie votes no. Griffith votes no. Bilirakis votes no. Johnson votes no. Bouchon votes no. Hudson votes no. Wahlberg votes no. Carter votes no. Duncan votes no. Palmer Palmer votes no. Dunn. Dunn votes no. Curtis. Curtis votes no. Lesko. Pence. Pence votes no. Crenshaw. Crenshaw votes no. Joyce. Armstrong. Armstrong votes no. Weber. Weber votes no. Allen. Allen votes no. Balderson. Balderson votes no. Fulcher. Fulcher votes no. Pfluger. Pfluger votes no. Harshbarger. Harshbarger votes no. Miller Meeks. Kamick. Kamick votes no. Obernolte. Obernolte votes no. Pallone. Pallone votes aye. Eshu. Eshu votes aye. Deget. Deget votes aye. Schakowsky. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes.
Aye.
Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Dingell. Dingell votes aye. Veazey. Custer. Kelly. Barragan. Custer votes aye. Kelly. Barragan. Blunt Rochester. Blunt Rochester votes aye. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers. Chair Rogers votes no.
Clerk will report the vote.
Chair Rogers on that vote, there were 17 ayes and 26 noes.
The noes have it, and the amendment is not agreed to. Are there further amendments? Seeing none, the question now occurs on approving H.R. 3887 as amended.
Madam Chair,
Yes,
move to strike the last word on the bill.
yes. Ladies recognized for 5 minutes to strike the last word.
Thank you very much. I just wanted to say that I really regret that this turned into such a circus here at the end. And I was so hopeful that the Energy and Commerce Committee that deals with such fundamental issues of facing the families back home, that we would be immune from a lot of the extremism that has polluted the other committees. But unfortunately, we can't say that in this Congress. This historically bipartisan initiative, training doctors in America's children's hospitals, has been bipartisan for years and years and years, but now it's simply another hate-filled vessel for right-wing MAGA extremism. And let me give you a cautionary tale, because I watched what happened in Florida when this same, to borrow a phrase, contagion took off. Politicians there took their eye off the ball on what's important to the people we represent, to the small business owners, to families, hardworking everyday families. And when you take off your eye off the ball, what I've seen in Florida, people are really struggling now with the everyday bread and butter issues. They're paying higher insurance rates, they're paying more for housing, they're paying higher electric bills. There's a climate crisis that is very costly, and that's what happens when you take this extreme road to this kind of divisive policy. And I'm totally, it's just really unfortunate that we cannot have these debates and do our job without infecting it with this hate-filled kind of policy. So I just felt compelled to say that here at the end. I can't believe we have to vote no on the children's GME. And hopefully cooler heads will prevail out of the United States Senate. and we will get to a place where medical doctors and parents and children can be safe from hate-filled politicians that feel like they need to interfere in the personal, private decisions that they make. I yield back my time.
Madam Chair.
Gentlelady yields back. I move to strike the last word, and I'd like to speak in support of this legislation. I'd like to urge my colleagues on both sides of the aisle to support the reauthorization of the Children's Hospital GME Reauthorization Act. This bill, the vote before us, will continue, make sure that the funding for Children's Hospital Graduate Medical Education Program continues through fiscal year 2028. That's the question before us. We all agree that America's children need and deserve the best care possible. And I would urge my colleagues to join us in abandoning a radical ideology that is corrupting medicine, pressuring parents with fear, and harming our children. You've heard the long list of countries, Great Britain and others, that are banning the use of puberty blockers for children, except for those enrolled in regulated clinical studies. These countries are urging more caution and being honest about where the evidence for these experimental procedures is lacking. Our children's hospitals and medical institutions should be doing the same thing. There needs to be a pause. So the underlying bill would continue supporting the graduate medical education for children's hospitals without, by simply putting in a pause on these specific procedures. The risk outweigh the benefits. And I want to make it clear once again that nothing in this bill prohibits a child with gender dysphoria from receiving proper mental and behavioral health care services. You've heard it over and over. The underlying text is limited to experimental medical interventions, specifically using puberty blockers, hormone therapies, and surgeries to change a child's gender. Our goal is to advance the bill so that when a parent steps through the door of the hospital, they're confident their child's going to get the care that the doctors that are the best trained in the world can give them. So let's support the program and the training for pediatric residents. I urge a yes vote. Further discussion? Seeing none, the clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Johnson. Johnson votes aye. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Dunn votes aye. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Armstrong. Armstrong. Armstrong votes aye. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Pfluger votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. Pallone. Pallone votes no. Eshu. Eshu votes no. DeGette. DeGette votes no. Schakowsky. Matsui. Matsui votes no. Castor. Castor votes no. Sarbanes. Sarbanes votes no. Tonko. Tonko votes no. Clark. Cardenas. Cardenas votes no. Ruiz. Ruiz votes no. Peters. Dingell. Dingell votes no. Veazey. Custer. Custer votes no. Kelly. Barragan. Blunt Rochester. Blunt Rochester votes no. Soto. Soto votes no. Craig. Craig votes no. Schreier. Schreier votes no. Trahan. Trahan votes no. Fletcher. Fletcher votes no. Chair Rogers? Chair Rogers votes aye.
The clerk will report.
Chair Rogers, on that vote, there was 27 ayes and 17 noes.
The ayes have it, and the bill is adopted. Without objection, staff is authorized to make technical and conforming changes to the legislation approved by the committee today, so ordered. Without objection, the committee stands adjourned.